Good morning. I am Ward 4 Councilmember Janice Lewis-George, Chair of the Committee on Facilities and Family Services. It is 9:33 a.m. on Friday, February 23rd, 2024. We are holding this hearing via a hybrid format with public and government witnesses testifying via Zoom and here in room 500 of the John A. Wilson Building. This hearing is also broadcast live on my website at janiceward4.com/live. Here are some brief reminders about the committee's protocols for witnesses participating virtually. All witnesses participating in this Zoom webinar are currently listed as attendees. When it's your turn to join a panel for testimony, I will call your name and a member of my staff will promote you to be a panelist. If you wish to activate your video while you testify, you need to click the button in the toolbar at the bottom of your screen that looks like a video camera. Representatives of bona fide organizations will be given 5 minutes to testify. Unaffiliated public witnesses will be given 3 minutes as well. When your time is up, I ask that you please conclude your remarks so that we can stay on schedule today. We will be calling up witnesses in several panels, and council members present will have 10 minutes to ask each panel questions. I ask that all witnesses begin their testimony with a brief physical description of themselves. For example, I am a brown-skinned Black woman in my mid-30s with Black hair in a bob haircut, wearing a navy blue dress and suit jacket. We will start with the Office of Disability Rights first, with public witnesses and then government witnesses. We will then move to the Department on Disability Services, followed by the Mayor's Office on Deafblind, and Hard of Hearing. If you have any technical issues during the hearing, please notify my staff either via the Q&A function in Zoom or by sending an email to facilities@dccouncil.gov. All testimony and pre-hearing documents that have been submitted are available now on the council's hearing management system. Witnesses are reminded to please submit written copies of their testimony for the record by uploading your testimony to the hearing management system. The record for this hearing closes at 5 p.m. on Friday, March 1st. The Office of Disability Rights, the Mayor's Office of Deafblind, and Hard of Hearing, and the Department on Disability Services all play vital roles in enforcing the rights of ensuring accessibility for and providing services to people with disabilities in the District of Columbia. Whether it be for district residents, employees, or visitors with disabilities, it is of the utmost importance that all government services and spaces are as accessible as possible, even if such accessibility comes with a cost. We will focus today's hearing on some of the issues I hear most from district residents with disabilities. I look forward to discussing with the Office of Disability Rights the district's current status of compliance with the Americans with Disabilities Act, the difference between compliance with the ADA and actual accessibility, and how we can strengthen our current practices and policies to ensure our agencies are following the law and creating accessible services and spaces. And we will review a myriad of topics involving DDS, Developmental Disabilities Administration, better known as DDA, and Rehabilitative Services Administration, better known as RSA. For DDA, we will review service coordinator caseloads, the current complaint process, and the impact of unwinding of the federal public health emergency on services and supports, particularly regarding companion services. For RSA, we'll discuss the Randolph Shepherd Vending Facilities Program and pre-employment transition services. With the Mayor's Office of Deafblind, and Hard of Hearing, I will be checking in on what progress the agency has made in establishing itself as a resource for district agencies, how it is meeting the district needs of the deafblind, deaf disabled, late deafened, and hard of hearing communities, and how we can work together to ensure that all branches of the district government are as accessible as possible. I look forward to hearing from and engaging with our public and government witnesses today about all of these issues and more, so we can all work together to identify what we are doing right, areas that can be improved, and what policy changes or additional resources are necessary to make those improvements to better serve people with disabilities in the District of Columbia. I was checking to see if any of my colleagues are present. With no current colleagues present, I will begin with the Office of Disability Rights, starting with public witnesses. We have one public witness present with us here today, and so I will invite Ms. Gail Williams, public witness, to testify. Good morning. Good morning. You may begin your testimony.
Thank you. Good morning, Councilmember George and all members of the council in attendance. I am Gail Williams, a resident of Washington, D.C. for 70+ years and a participant of the senior program at the Lamont Recreation Center. I am pleased to testify before you today about the disability buttons, availability of ADA compliant restroom facilities, and unsanitary conditions at the Lamont Recreation Center. As we discuss these important topics, I hope you will consider improvement on providing more resources to make the Lamont Recreation Center ADA compliant. Seniors in the Lamont community enjoy and appreciate the activities that are offered to us by DPR, such as exercises, arts and crafts, games, movie day, and trips. Lunch is also provided by DACO. This makes for a very engaging and active program. Last year, during your Jubilee, it was determined that the disability button in front of the building and in the parking lot was not functional and had not been for years. Many seniors from across Ward 4 were in attendance, and some came with walkers, canes, and wheelchairs. Your office was contacted regarding the buttons, and it was determined that DPR had submitted tickets. However, the buttons were not fixed. After contacting your office, the buttons were fixed. Seniors at Lamont still couldn't use the buttons as DPR employees wouldn't turn the buttons on. Your office was contacted again. That matter was resolved and DPR staff began turning the buttons on again. Thank you, Councilmember George, for you and your staff's efforts to assist us with this issue. Although the buttons were turned on, problems still existed. The front door button only works when leaving the rec, and the parking lot button works when coming in and not when leaving out. This is a challenge for those who are using walkers or canes. I have contacted your office again, and your office still working on it. There are also concerns regarding the restroom facilities at the Lamont Recreation Center. Several seniors have had surgeries that require that they have access to an ADA compliant restroom. The women and men's restroom facilities have no compliant restroom facility available as they both are wrapped in a plastic bag and can't be used. This means that anyone who has a disability will have to struggle to use the restroom facilities. Your office was contacted regarding this issue, and I understand that the ADA compliant restroom facility issues are expected to be completed by the end of this month. Based on the tickets entered by DPR employees, if the restroom facilities are fixed, it would have taken 6 months. Another area of concern is the cleanliness of the Lamont Recreation Center. Tiles are falling and turning brown in various areas of Lamont, including where seniors enjoy lunch provided by DACO. This is unsanitary and unsafe. In addition, there doesn't appear to be regular cleaning at the rec. I don't believe the floors have been mopped in a while. The DPR staff reported this issue months ago, and nothing has been done to correct this issue. The seniors at Lamont appreciate your staff working on these issues for us, and we know it's because of their efforts we have had positive outcomes. I just want to take a moment to say thank you to you and your staff for what they have done for us and look forward to positive outcomes regarding the disability buttons, ADA compliant restroom facilities, and brown and falling tiles at the Lamont Recreation Center. I appreciate the opportunity to testify, and I'm happy to answer any questions you may have.
Thank you so much for your testimony. Ms. Williams, thank you for the work that you do with seniors, not only at Lamont, but for our entire Ward 4 community, through also the Mini Commission on Aging. Can you just talk about how important it is for seniors to have accessibility in all of our government spaces, and how difficult it is for them when our buildings are not ADA compliant?
So it is very important for all buildings to be ADA compliant, as we have seniors who we're trying to get out of their homes because of the loneliness and isolation issues. And when we invite them out, a lot of them have disability issues. They've had surgeries, and to make things comfortable for them wherever they go, ADA compliance is necessary. If we don't have that, then they feel that they're not included, and so they stay home. And we're trying to get them out. So it's critical that we have ADA compliance in the rec centers and every building that they are invited to come to.
And when you have seen these sort of ADA complaints with accessibility issues in spaces, how long is it taking to get those issues fixed?
Well, I do know that the rec department at Le Mans, they put in a ticket. It could take, well, a year, 6 months, I don't know. If it wasn't for your office, I wouldn't even know how long it takes, because once the ticket go in, I'm not aware of what they're doing, but your office has kept me aware of when the next thing should be fixed. And then I go up there and see if it's fixed. And I was just told by ODR that the buttons should be fixed. Now, I haven't been there since Monday. They weren't fixed then, but I'm going back up there after the today's hearings and planning to see if the buttons work inside and out, because they sent them a film of them coming in, but the buttons need to be fixed so they can get out as well.
Absolutely. Thank you so much for your testimony. We appreciate it.
Thank
And
you.
we will be following up
Thank
with questions and with action. Thank you. Right. We will now begin with the Office of Disability Rights government witnesses. For those who are present to represent the Office of Disability Rights, please come forward. We have 4 witnesses here on behalf of the Office of Disability Rights. Ngoc Trinh, ODR's Chief of Staff. Peter Steffen, Attorney Advisor. Anthony Young, Agency Fiscal Officer. And Allison White, the Executive Director of the DC Developmental Disabilities Council. Thank you all for being here today. Before you begin your testimony, I'm going to administer an oath to you. If you could please raise your right hands. Do you swear or affirm under penalty of perjury that the testimony you are about to give to the Committee on Facilities and Family Services is the truth, the whole truth, and nothing but the truth? Thank you all. Ms. Trinh, you may begin your testimony. Thank you. Oh, got, yep, there we go.
Thank you. Good morning, Chairperson Louis George and members of the Committee on Facilities and Family Services. My name is Ngoc Trinh. I am the Chief of Staff of the Office of Disability Rights, ODR. I am standing in for our Director Matthew McCulloch, who could not be here today. I'm here with my colleagues, Allison White, Executive Director of the DC Developmental Disabilities Council, Peter Steffen, ODR's Attorney Advisor, and Anthony Young, the Agency Fiscal Officer. I am pleased to testify before you to report on ODR's performance in fiscal year 2023 and fiscal year 2024 to date. ODR was established 17 years ago pursuant to the Disability Rights Protection Act of 2006 to ensure the district government's commitment to Americans with Disabilities Act, ADA, and other federal and local disability-related laws. This directive paved the way for the district to become a nationally recognized leader in ensuring that district programs, services, benefits, activities, and facilities are fully accessible to and usable by people with disabilities. The agency continues to encourage access to government programs and services for people with disabilities through guidance, information, and technical assistance to district government agencies and individuals accessing government services and facilities. These programs are vital to living and working in the community. Additionally, ODR provides ADA and sensitivity trainings and works to resolve requests for reasonable accommodation and modification of policies for district employees and community members with disabilities regarding accessibility to district buildings, services, programs, and activities. Finally, ODR provides administrative support to the federally funded Developmental Disabilities Council, DD Council, and the DC Commission on Persons with Disabilities. I would like to highlight some of our accomplishments in FY23. ODR provided 37 trainings events to over 2,400 district employees, grantees, residents, and other community stakeholders on ADA compliance, disability rights, cultural competency, and sensitivity. ODR effectively addressed and/or resolved 670 ADA-related complaints, information, and technical assistance requests brought forth by district employees, residents, visitors, and other community stakeholders. ODR also hosted Mayor Bowser's 15th Annual Disability Expo in October 2022. Through the event, Mayor Bowser emphasized the importance of employment opportunities and accessible government services for district residents with disabilities and their families. More than 50 district agencies and community exhibitors showcased their services, while over 200 residents and visitors participated. Additionally, to maximize the district's resources and expand its impact, in October 2023, ODR co-hosted the Mayor's Tech Fest Summit with the Department of Disability Services. About 400 attendees had the chance to explore a diverse range of services available for people with disabilities and older adults, from support networks to educational resources. Participants also had hands-on experience of cutting-edge technological advancement designed to significantly improve the lives of individuals with disabilities. During fiscal year 22 and 23, ODR engaged, trained, and worked with all district agencies and their ADA coordinators to conduct programmatic and architectural evaluation to identify accessibility barriers and develop each agency's annual ADA compliance plans. By the end of FY23, 90% of agencies participated in self-evaluation assessments and provided their findings to ODR. In FY24 to date, 5 additional agencies have submitted their ADA compliance assessment. ODR will continue working with and assisting agencies to develop and/or implement their ADA compliance plans. Metrics will include evidence of individual agencies making continuous improvements in removing accessibility barriers identified in their ADA compliance plan. ODR is also currently working with Octo to develop an application to collect agency submissions in a way that will streamline the work for agencies and make it easier to share with relevant agencies to remove barriers. As required by federal law, ODR is the designated state agency for Developmental Disabilities Council, DD Council. The DD Council is fully funded by federal dollars appropriated according to the Developmental Disabilities Assistance and Bill of Rights Act of 2000, DD Act, through the Department of Health and Human Services Administration on Community Living. The DD Act mandates that DD councils engage in advocacy, capacity building, and systems change to better the lives of people with developmental disabilities and their families. The DD Council is in the middle of implementing its FY22-FY26 5-year state plan with major goals related to self-determination and leadership, employment, and community living. In FY23 and FY24 to date, DD Council convened working group, coordinated activities and events, and awarded grants to support advocacy and leadership training, community building, employment of people with disabilities, and healthy living. The DD Council prioritizes language access by ensuring that interpretation is available whenever needed, but also by hosting and supporting activities fully in Spanish and Amharic, acknowledging the potential intersectionality between diverse populations and persons with disabilities. An example of this work was the 5th Annual Latino Conference on Disabilities in FY23. This conference provided information and resources in Spanish to over 150 people with disabilities, family members, older adults, and other community advocates. The DD Council also awarded $82,508.53 in grants to community organizations, including one grant focusing on supporting Ethiopian and Eritrean families by providing information and resources in Amharic. In October 2023, the DD Council-led Employment First Planning Committee, of which ODR is a member, hosted the 2nd Annual Employment First Summit. Over 100 community members, employers, and government professionals attended to take stock of the district's progress on Employment First, share ideas for innovation, and identify the next steps for making the district the best place for people with disabilities to work. The district's Employment First initiative is part of its much broader community integration efforts that ODR is coordinating under the district's Homestead Plan. In FY24, ODR is spearheading the district's preparation for establishing a new district-wide Homestead Community Integration Plan that will span the next 3 years. ODR is planning a series of work group meetings to coordinate 24 district agencies responsible for providing integrated home and community-based services in housing, healthcare, transportation, and employment for district residents with disabilities who are at risk of being placed in or who are currently in institutionalized settings. This goal and benchmark setting will also require the active engagement with residents with disabilities, family members, leaders, advocates, community organizations, and other stakeholders, which will be done through multiple town hall meetings, feedback submissions via comment periods, community events, and one-on-one interactions with community stakeholders. The Homestead Plan seeks to reflect the type of living environment and community-based services needed for district residents with disabilities to lead independent, integrated lives. ODR aims to have a comprehensive and finalized plan at the end of this calendar year. In support of the agency's racial equity initiatives and the growing need to effectively communicate with communities with limited English proficiency, pursuant to the DC Language Access Act, essential contents of ODR's website will be presented in other languages. As a result, individuals with disabilities who have limited to no English proficiency will have a greater understanding of their rights under the ADA and other federal and local disability laws in the District of Columbia. We are proud of the leadership provided by Mayor Bowser to ensure that the District of Columbia continues to serve as a national model of accessibility. I extend my deep appreciation and respect to Director Matthew McCullough for his leadership and vast knowledge of disability rights work, as well as to ODR staff, the DD Council, and the DC Commission on Persons with Disabilities for their tireless effort and commitment to improving the trajectory and quality of life for district residents with disabilities. In closing, I would like to thank you for your leadership and support. We appreciate the opportunity to share our achievements and plans for continuous progress. We look forward to continuing to work with the committee. And this concludes my testimony. My team and I are now happy to answer your questions.
Wonderful. Thank you so much. Let me first start by acknowledging Director Matthew McCullough, who is an exceptional public servant and an exceptional leader. not just in this city, but I think in this nation. And we are grateful for him. And he always has me and my committee's well wishes and continued support. I'd also like to thank you all for having me at the Disabilities Expo. Me and my team had an amazing time and thought it was just such an exceptional way for our community members to engage, and they really enjoyed themselves as well. So I look forward to next year or this year's Expo. All right, I want to start by talking about the district's compliance with the Americans with Disabilities Act. We often think about ADA compliance as one sort of monolithic concept, but as we know, the ADA covers a wide variety of obligations. I'd like to start our conversation by acknowledging the distinction between Title I and Title II of the ADA. I know ODR and other agencies do a lot of great work ensuring the district's compliance with Title I, which focuses on employment of people with disabilities. And from what I can tell, these efforts are paying off. There have been many improvements regarding the district's employment of people with disabilities under the state as a model employer initiative. And so I think we are moving in the right direction in Title I, and thank you all for your work on getting us where we are right now. My serious concerns come with Title II, which focuses on the accessibility of government services. Most of the complaints I hear from district residents with disabilities are about being unable to access government services and spaces. My first question is, how would ODR estimate the proportion of time and resources the agency and the district as a whole spends on Title I versus Title II? Is Title I getting more attention than Title II compliance?
Thank you for the question. According to the information we have, the proportion between Title I and Title II is about equal.
Okay. And in pre-hearing responses, ODR said the agency provides technical assistance when ODR deems necessary and upon request from an agency. How would ODR estimate the proportion of technical assistance that's provided upon request compared to when ODR deems necessary? Which one is more common?
It is true that technical assistance is provided both when we deem necessary and when requested. The proportion between the cases that came from requests accounts for the majority of the technical assistance cases that ODR handle.
Okay, so most of it is upon request versus when you all deem it necessary.
That is correct.
Okay. The same response, you all said ODR provides technical assistance to other agencies as well as members of the public. In fiscal year 23, it says ODR received 378 submissions for technical assistance. Who is requesting most of those submissions, agencies or the public? And if agencies, which agencies request assistance most often?
We know that the technical assistance that came from agencies accounts for a lot more than from the public. I do not have the information off the top of my head which agency submitted to us most. Please allow us to follow up later.
In your pre-hearing responses in fiscal year 23, ODR received 163 requests for complaints requesting informal dispute resolution, up 16% from fiscal year 2022 and up 94% since fiscal year 21. What does ODR think? Why do you think the cause of this increase? Is it due to more public interaction with government services, more ADA violations occurring, greater awareness of the public's ability to report issues and ask for help, or something else?
Thank you for the question. There are two factors that can be attributed to the increase in the cases since FY21. The first one was COVID-19. FY 21 was the depth of COVID-19 when people were staying home and not going out doing things, not interacting with the district government as much as in a normal situation. After COVID, people started to, after COVID, the government, the DC reopened and people started to engage more with DC government programs and services. And we started to see more requests for assistance and information and technical assistance. The second factor for the increase is also we have reached out to a lot more district employees as well as grantees and other members of the public and stakeholders. In the effort to educate them of their rights and where that we are here to help them, how we could help them and how to contact us. And that also contributes significantly to the more cases that we got.
Okay, so I'm hearing you say pandemic, one of the reasons we're seeing such an increase, and I'm hearing you say greater awareness of public abilities to report issues. My fear was that more violations were occurring. And so I'm hearing you say that's not the driving force here for this percentage.
That's our interpretation of the increase.
Okay. In your pre-hearing responses, you all said in previous fiscal years and in fiscal year 2024, ODR has shared its assessment results and the status of compliance with the Executive's Office of the Mayor. Has ODR made recommendations to the mayor about agencies' deficiencies in ADA compliance? If so, how many? And does ODR track if those recommendations were implemented by the executive?
Councilmember, I'll take that. Again, Peter Steffen, attorney advisor for ODR. And thank you for the question. When ODR undertakes a comprehensive review of the district government's programs, activities, and services, we're working informally with agencies to try to assess what is going on. We are involved informally with their reporting and then also their self-assessment on how they can improve compliance. So when we do that, we actually reach out to the ADA coordinators for each respective agency. And so we are making sure they understand their obligations under the ADA and their need to implement the compliance plan that they have developed. And so each agency has their own unique compliance plan. And we provide technical assistance as well as advice on remedies with just reviewing recommendations and concerns that each agency has.
Got it. Okay, so basically, because I'm just wondering if you're having a conversation with the city administrator and the mayor and saying, look, we got a few agencies who are chronically not ADA compliant. Like in my mind, DCPS, DPR are two that really stand out for me. And I'll get to those later, but I need to know that you all are saying to the mayor and to the city administrator, these are my recommendations of the agencies who have deficiencies and you all should be focusing on in the upcoming budget year so that they can cure those deficiencies. Is that happening?
Councilmember, thank you for the follow-up. When we compile the results, we issue, we create a report that is then sent to the city administrator. And so those results are shared with them, yes. Okay,
so what results are shared with the city administrator?
The results of the ADA compliance plans, the self-assessments that are conducted by each agency.
But it's really sort of their self-reflection on themselves versus you all saying they could do better. And I think we should change that posture, which is like, if I do a self-assessment of myself, it's probably going to be better than somebody else doing an assessment of me. Maybe not, but I would guess so. So I think we should, as moving forward, we should change the posture for how you all look at this and instead of giving the city administrator people's self-assessment of themselves, you all say, these are agencies I think have deficiencies and you should focus on those in the upcoming budget. When I ask agencies about ADA violations, I get mixed answers. Sometimes they don't have a desire to comply. Other times they don't understand the legal necessity of compliance. But oftentimes agencies tell me they don't have the resources to comply. The fiscal year 25 budget is going to be tough. And we at the council know well that ADA compliance is expensive. But cost is not an acceptable reason for lack of compliance. I hope you all agree with me. During this budget process for fiscal year 25, can you all, ODR, commit to working with the executive agent office of the mayor on identifying specific agencies and ADA violations that require additional and dedicated funding to bring them into compliance?
Thank you, Councilmember Louis George. Yes, if called upon, we will be happy to provide our input on ADA compliance.
Great. I've already talked to the city administrator, so I think he's gonna be asking you all about this. I want to go to ADA assessments, meaning their self-evaluations and their compliance plans. I want to thank ODR for providing this committee with agencies' ADA assessments. I know it was a huge undertaking given the quantity and size of the documents, and I appreciate the time and effort spent on providing us with this important information. I was glad to see 90% of agencies have submitted their self-evaluation assessments to ODR within the last few years. But I don't think that the number accurately captures agencies' level of compliance with this legally required initiative. For example, even though only 10% of agencies did not submit an assessment, among that 10% includes the Department of Parks and Recreation, one of the largest agencies that interacts most with the public. Did the agencies that did not submit assessments to ODR provide a reason why? And if so, what were those reasons?
Thank you. The ADA compliance assessment is comprehensive, and depending on the size and the structure of the agency, it can take time. We work very closely with agencies from training ADA coordinators to providing support throughout the process and technical assistance and guidance to give them the tools to fill out the assessment. And we stay with them throughout the whole process. We hope to get the rest of the submission in the next few months. And for FY24, we hope that the submissions from all agencies will be completed by the end of the fiscal year.
Okay, have the agencies that have not submitted their assessments provided you all with an expected date of their submission?
We have follow up with those agencies and have been in communication with their leadership, and they have assured us that they are working on it.
Okay. I would like you to put a little bit more fire under them and give them a deadline.
You have our commitment for that.
If they miss the deadline and they have a reasonable excuse for missing the deadline, that's one thing. But if we allow that train to keep on moving, they will allow that train to keep on going without having some type of accountability there. How can ODR sort of know the level of agency's compliance with the ADA when they don't submit self-assessments? For example, do you all sort of know the number of recreation centers that have non-functional ADA entrances, for example? Will ODR know the number after DPR, or will you know that number after DPR submits its assessment?
Yes, we would know after they submit their assessment.
Okay. The incompleteness of many of the submitted assessments were also, I think, disappointing. There were 35 agencies' assessments who were incomplete. For example, Section 4 reviews a facility's compliance with the ADA and it covers important elements such as elevators, ramps, and restrooms. The Section 4 facilities inventory for DCPS was conducted for only one location, which was 1400 I Street Northwest. That location is not even a school. I don't understand why every single public school is not included in DCPS's facilities inventory and why not including them is acceptable to you all.
I wouldn't say it is acceptable to us. We follow up, we review each submission thoroughly, and we follow up with agencies on the missing parts, and we continue to work with them. And sometimes we know that people wear different hats. If we don't follow up with them, it might slip their radar. So we follow up consistently with them to put it back on their radar, remind them of the obligation of their agencies under the requirement of the ADA, so that and offer to provide technical assistance or any support that they might need to complete what they need to do for the evaluation and submit the missing sections.
And just to underscore that, council member, I think it highlights a need for additional training and education.
Yeah. Do you know if any public school has completed Section 4 facilities assessment?
I would like to get that information to you after I review the submissions.
Okay. DCPS is huge. It's a huge portfolio. And I would say of agencies, DPR hasn't submitted theirs, and DCPS, which is grossly incomplete based on Section 4 alone, are two that we hear from the most. So those two are the agencies where I need ODR to step in and really push them to complete their assessments and do it fully, because those are the areas where, in order to comply, funding in this upcoming budget probably
Yes.
will likely have to come out.
We had that conversation with DCPS a couple of months ago, and we also came to offer our actual survey. So we sent our architect out to help them with a survey for several facilities, and we did survey schools in the past, but we will continue our efforts to work with them until every part of the plan is completed.
Thank you. 27 of the agencies were missing their Section 5 compliance plan. And the compliance plan, in my opinion, is the most important section because it is essentially the roadmap to bring an agency into compliance. It lists the current barriers to compliance found during the rest of the assessment, ways to remedy those barriers, a target date to remedy the barriers, and the parties responsible for bringing the agency into compliance. What do you do when you receive an incomplete assessment, particularly in an assessment missing a compliance plan? And how does ODR ensure agencies' violations are rectified if the compliance plan is not completed?
Yes. So when we receive a submission, we review them, and of course, if there is any missing part, like I shared before, we follow up with agencies, and we would continue until we receive what is needed.
Got it.
And we provide trainings often too, and we offer technical assistance.
Okay.
Also, yes.
Go ahead.
Also, when we review, we compile the findings of the submission and send it back to them, asking for updates to track the progress.
Thank you. I appreciate that. And, even though there are serious issues with the assessments, there is still a lot of data contained in assessments that were completed fully. In pre-hearing responses, ODR says the agency is currently in the process of compiling the data from agency's compliance plan. My team and I have reviewed the plans provided, and I'm curious about how ODR reviews this information as well. What data points does ODR extract when reviewing an agency self-assessment? How is that data analyzed, that data compiled and analyzed?
So every part of the plan is important to determine barriers and accessibility of the agency's program and services. So we do, and facilities. So we do look at all data that we get. And again, we compile the findings into a report which we send back to the agency asking for updates. And when they send us update, we would note down which one has been addressed, or
Got
we ask them for the plan for how to address it.
And do you all look at sort of compare, if an agency assessment compared to its like most previous assessments, so look at assessment from one year to the other, do you do a comparison?
We are setting up our new tracking system in
Okay.
a way that allow us to track between the years. So we, like I mentioned in the testimony before, we are
Yeah.
looking to have a new system that allows it more readily for us. We can currently mine that information from the source, the data that we get, but it would take a lot of resources.
Got it. Do agencies respond to you all, your ODR's request for updates from agencies, sort of as you all are updating, are they responsive to you?
Yes, but again, there needs to be a lot of follow-up and support.
Yeah, because you all had a metric and I thought it was good that you said a metric for tracking district-wide ADA compliance is sort of evidence of individual agencies making continuous improvements in removing accessible barriers identified in their ADA compliance plan. When you look at sort of that evidence, what does that evidence look like? So like, how does ODR, for example, say like X% of violations identified in agency assessment were remedied within X number of months?
We have, like I said, we compile the findings into a report and we send it back to them and asking for updates. The updates from them shows where they are, shows the status of the solutions for the barriers that they have identified.
And just to add to that, council member, so we're looking for progress across all elements that are identified. So,
Got it. What happens if the agency, what do you all do when agencies are not in compliance? Like they haven't made do they have a plan? They haven't met any of their metrics. They haven't done anything within their months, within the required months. What do you all do when agencies are not in compliance?
We know that training is so important. Awareness of the obligations under the ADA is so important. So we step up our training efforts. We train not only the ADA coordinators, because we understand that ADA compliance is not just the work of the ADA coordinators. We have reached out to train in collaboration with DCHR and MONC, the Mayor's Office of the Mayor's Office of Legal Counsel, to train HR advisors, to train managers, and also general counsels. So that
Is that
the
you making them aware that they could be getting lawsuits right now? And they're just not, I mean, is that what you're saying? Is that what you say to them? Like, hey, agency, you have all these ADA compliance issues and the city can be sued as a result of it.
well, council member, when we train them, we provide information on their obligations under the ADA, so Title I and Title II. And so that information then gets emphasized that this needs to be complied with. This is not optional. This is federal law and all district agencies have to comply with every single part of this.
Okay. One thing that I think, and we've gone back and forth on this, DC code 2-1431 says agencies shall make all ADA plans and reports available on their website and shall provide copies to the public upon request. It also says ODR shall make all plans and reports available on its website and shall provide copies to the public upon request. I've spoken with ODR before about the agency's liability concerns with making these ADA assessments and plans available to the public, which I understand fully. However, I think the fact remains that these plans are required to be made public to the law. So does ODR maintain the position that these plans cannot and should not be made public?
Well, council member, let me address that, but it's just by saying we value transparency. We want to make these plans available. we want, and we will work with the agencies to do so. We're still working with them to get their feedback on how we can accomplish this. But it's something we want to work towards. And ODR's mission is not to interpret the law in this manner, but we will continue to work with not only the agencies, but also residents to provide services that, empower them to make their own decisions. And it's our practice to follow the law as, we're resource-based. So we'll continue to work with the partner agencies as well.
Yeah. So this is part of the reason why I think where I need you all to be more aggressive with agencies regarding their ADA compliant, because I actually understand what you're saying, regarding, disclosing the extent of the district's noncompliance with the ADA would open up our government to a slew of lawsuits. That's just reality. But what I'm saying is I sort of disagree that this liability would be a bad thing. To be frank, I think we are unfortunately at a point where agencies are going to comply with the ADA only if they are facing a lawsuit. Unless we are more aggressive internally in that regard. I think public disclosure of these plans and thus public admission of agencies' noncompliance may be what it takes to get our agencies finally to care about whether or not people with disabilities can access their services and spaces. So it has to be either or in order for us to get some compliance from these agencies, is what I'm saying. Lastly, on the ADA assessments, ODR said in pre-hearing responses that ODR plans to have all agencies complete assessments in fiscal year 24. In your testimony, you mentioned that ODR has received several in fiscal year 24 today. Can ODR share agencies' assessments for agencies that have not already been provided with the committee as they are received?
Thank you. We had the opportunities to share the submissions in the past with the committee, and we look forward to continue to do that as soon as the data is reviewed and clear the internal process for approval.
Okay. I want to ask some questions about accessibility versus compliance. I would just want to talk about the difference between in that regard. So DC code requires ODR to ensure that agency employment practices, services, and supports facilities, telecommunications, and general policies and practices are fully accessible to people with disabilities and meet requirements of the ADA. Thus, ODR's Establishing Act recognizes this distinction between accessibility and ADA compliance. I recently heard from seniors about accessibility issues at Workforce Hattie Holmes Senior Wellness Center that illustrate this distinction. Seniors told me that there is not a ramp to the main entrance of the building. Seniors who use wheelchairs are forced to use the ADA entrance on the other side of the building. In addition, while there is one ADA stall in each of the first floor restrooms, many other stalls do not have railings or chair height toilets. This results in constant long wait times for the bathrooms because many, if not most seniors, need or prefer the ADA stall. I think these are both examples of a space that is technically compliant with the ADA, but in reality is not actually accessible. What, if anything, is ODR able to do to ensure true accessibility of our services and spaces so that compliance with the ADA is the floor and not the ceiling of the district's accessibility standards?
Thank you for that question. I want to share that we have stepped up our training to grantees as well. So we recently made a presentation in front of the district's grant managers to tell them that it is important that grantees are also in compliance because if they are not, then it is our issue. Because we fund their program. So the grant managers are aware of that. And we made recommendations on how and when to train grantees and offer our resources. And we are going to provide the training as however many that requests that comes to us. We are going to train grantees and work with grant programs to make sure that grantees are aware of their obligations. I think a big part of the issue is that they're not aware of it.
Right. Okay. The next thing I'd like to discuss is sort of what ODR is, and perhaps more importantly, is not empowered to do under your establishing act. Two of ODR's primary powers are to conduct investigations and make referrals to the Office of Human Rights when allegations of ADA violations arise. I was shocked and disappointed when I read ODR did not conduct formal investigations of alleged violations in fiscal year 21, 22, 23, and 24 to date. I often hear from seniors and district residents with disabilities in district government spaces and services violating the ADA. And from what I've learned from what residents have told me and what I've experienced through this committee's attempts to get violations remedied is that agencies are often reluctant to take action on their own. I truly don't understand why investigations are not happening in that as a result of that. It cannot be because agencies themselves or due to sort of corrective actions taken by ODR resolve violations as they arise, because if that were the case, we wouldn't have so many complaints about accessibility from district residents. So why is ODR not conducting investigations into allegations of district agencies' violations of the ADA?
Oh, actually, we take all complaints very seriously, and we review the cases thoroughly. For every complaint that came in, we review and provide advice on options that the complainant have. And if we identify any issues for ADA compliance with certain agency, we first seek to work directly with the agencies to resolve the issue informally. If we determine that a remedy could be provided for the issue by OHR, we would refer the individuals to OHR, and we leave it up to the individual to make a decision on whether or not they would like to resolve their matter by filing an official complaint with OHR. But we do make referral, and we reported the referral number in, I think, to question number 50.
Okay. So how does this review process you described differ from sort of a formal investigation? Is it as thorough?
We definitely look into all facts of the matter, and it's just that it's not a litigation process.
Got it. Okay. I was similarly disappointed to see ODR did not make any referrals to the Office of Human Rights in fiscal year 21, 22, 23, and 24 to date. Why is ODR not making referrals to the Office of Human Rights? Does ODR believe referrals to OHR are not necessary for ensuring the district compliance with the ADA?
Councilmember, like I just shared with you for the last question, we do make referral. However, we leave it up to the individual to decide whether or not they want to file an official complaint with OHR.
So you make a referral to the Office of Human Rights.
We refer the individual to.
So you tell the individual you should make a complaint to the Office of Human Rights.
Yes.
And it's really if they decide to make
to file
it themselves.
Yes. Mm-hmm.
Okay. And so are we saying most individuals are just saying, I don't want to go as far as going to the Office of Human Rights?
I do not have the statistics off the top of my head, but we know that some cases did go to OHR for formal investigation.
Well, I guess it doesn't help with your numbers essentially, because right now it looks like people might have gone down to the Office of Human Rights after you all made the referral to them. But you, I guess, unless you collect the data after the fact, then we wouldn't know if they actually did. So it sort of makes it look like I wonder why you all don't do it yourself, just so you have that data to be able to substantiate the work that you're doing.
the process is complex, and we would like to allow the individual to have the opportunity to make the decision on themselves on whether or not they would like to go in that route.
Got it. I mean, I think formal investigations and referrals are necessary, and I wouldn't leave it to the individual, because they've already been through enough, and they're already going through enough, and sort of they're going to have to go through a bureaucratic process that you sort of have the energy and the availability and ability to do on their behalf versus them having to do it themselves.
And Councilmember, respectfully, we provide advice and assistance, technical assistance to individuals, but we cannot represent them.
Okay. Because I think like conducting investigation and making referrals to OHR is sort of a few things ODR is actually empowered to do when agencies fail to comply with the ADA. And I can't reconcile your choice not to sort of utilize every tool and power at your disposal to get our government in compliance in that regard. But I know we've talked about what you can do. I want to turn to what you all cannot do. In pre-hearing responses, ODR said ODR has no authority under its Establishment Act to require any agency to take any specific action. The lack of authority was apparent in several other responses. For example, when asked how ODR ensures agencies submit ADA assessments, ODR said the agency sent follow-up emails reminding the agency of its obligations under the district law and the mayoral policy, but there was no mention of a consequence for agencies that do not comply. If ODR is not referring agencies of OHR, what is ODR doing when an agency does not comply with the law? That's just fundamentally what I'm trying to get to sort of at the end of the day.
So ODR's authority is derived solely from its expertise on disability rights laws. We work to educate agencies on their obligations under ADA Title I and Title II, as well as Section 504 and other disability rights law. We provide support and technical assistance to agencies as well, so that they are equipped with what they have to do under the law. We never have encountered an agency that doesn't want to be in compliance. Sometimes the understanding as well as the awareness of their obligation stands in the way of them being in full compliance. And that's why we continue to work to step up our trainings to make sure that everyone and every stakeholders is aware of what needs to be done under the law and what the requirements are. We have also received great support from the Executive Office of the Mayor to bring agencies together to resolve challenges that we have identified.
Got it. Let me ask you this. Do you believe the power to compel agency action and enforce compliance would increase agencies' compliance with the ADA?
We work to and we work toward and we encourage voluntarily compliance from agency, and we work hard toward that end.
Okay. Let me ask it differently. Is the power to compel an agency action and enforce compliance a tool ODR would like to gain to further the goals of agencies establishing act?
I would need to consult with my team and my director on this matter, and I would like to get back with you on this later.
And Councilmember, I just want to add, we appreciate the offer from the council for this assistance. We don't believe we need legislative changes, but we can personally commit to reaching out and following up with you all on the status of compliance with these agencies.
Okay, because I think you do need legislative changes, because I want you all to be able to feel free and do so on behalf of district agencies to get agencies to comply. And if there is if you don't have anything, which the two things you have are the referrals to reporting the findings to the mayor or making referrals to OHR for the issues of agencies noncompliance, which is now being, I think, left to individuals. That's all you have. And I just don't think that's enough to compel agencies to come into compliance. My point with this is that I think it's clear to me and the public and even agencies themselves that are under the current system, agency compliance with the ADA is essentially voluntary, even though it is legally required. And I want, there's so many examples of failings of the current system. Like you heard during public witness testimony, you heard about the ongoing ADA violations at Ward 4's Lamont Recreation Center. Ms. Williams described how much time and effort she spent trying to get the center to have a functioning ADA door, a simple and legally mandated request. And to be clear, those doors have been an ADA issue for a long time. Way back in September, seniors told me about those doors, and it quickly became clear to us that DPR was not eager to remedy this violation. My team did reach out to ODR, and ODR staff promptly went to Lamont and not only assessed the issue we raised, but also provided an a assessment of the exterior of the facility. And I really appreciate ODR's quick and thorough work on that, right? But it would be impossible for you to do that for everything. You would be exhausted, A, but it'd be impossible, B, and you shouldn't have to, because agencies should understand the importance of this. And we had to work with DGS to get them done, but I just think it's taking too long. And as a result, seniors and people with disabilities are forced to make their own way, for example, away from like the ADA parking lot around to the other side of the building. We have seniors waving their hands in the air until someone sees them and lets them in. It's just, it breaks my heart that, our seniors, not even just seniors, people with disabilities are having to wave their hand until somebody sees them. It's just like it doesn't show a respect for them and the dignity that they naturally have and deserve. And for me, it's just like unconscionable, in addition to illegal, that we are sort of in this space where agencies are not recognizing that. ADA is not voluntary. It is a legal requirement.
We do make that very clearly in our training. You don't have an option. This is your obligation under the law. It is all our obligation to do this by law. So that is one point that we make clear to them.
What advice do you have for district residents like Ms. Williams who are forced to advocate so hard to get agencies to simply follow the ADA?
We had the chance to chat with Ms. Williams before the hearing, and heard her out, and we exchanged contact, and we asked that if she runs into any future concerns, that she could reach out directly to us. And I would give the same advice to other agencies. At the same time, we you have our commitment to continue to work hard until we get the compliance plan in a good shape.
Okay, I appreciate that. I've heard from parents of students with disabilities who attend DC schools. Far too many of our schools have non-functioning elevators, and in many cases, those elevators are offline for months. As a result, there are students with mobility disabilities in the public schools of District of Columbia, and teachers and educators and social workers, in addition to students who are forced to stay on the first floor of a building and told to complete a packet while the rest of their peers participate in the class held on an upper floor. It is isolating for those students. It does not make them feel good. It doesn't give them the dignity and the humanity that they deserve. And so when I talk about this, I'm talking about every agency here, but DCPS and DPR has to, like, their assessment should have been in, they should be the first two agencies to have their assessment to you, and it should be fully complete. Section 4, Section 5 compliance, they should be fully complete. And what I need from you for you to do is to get both of those agencies' assessments as quickly as you possibly can, especially because we're going into budget right now. And I'm facilities chair as well. So DGS, that means DCPS and DPR both fall under purview of our facilities committee, because I need to know how much funding it's going to cost to get those agencies and the rest of our agencies in compliance with the ADA.
Yes, we will continue to work with these agencies on the challenges that have been identified.
One second. Awesome. All right. Thank you all for your testimony. I appreciate your engagement on these issues, your perspectives and your service to the District of Columbia, particularly our residents, employees with disabilities. I want you to be successful. I want you to succeed. And the rest of our ecosystem has to count on you to be their advocate in that regard and hold these agencies to account when they're violating the Americans with Disability Act, both Title I and Title II. And I need to see that Title II be emphasized a lot more as we move forward in this next year.
Thank you very much for your support.
Yes, Councilmember, we hear you loud and clear, and thank you. We will follow up.
Thank you so much. Thank you. All right, thank you. We will now transition to the performance oversight hearing for the Department on Disability Services, which will then be followed by the Mayor's Office of Deaf, Blind, and Hard of Hearing. We will start with the Department of Disability Services, Public Witnesses. Panel 1, I would like to first invite our first panel, Lindsay Wilkes, Project Action, Lynn Snyder, Project Action, Donna Thornton, Project Action, Ricardo Thornton, also Project Action. Anybody here? Virtual. All right. As they make their way, I see we have 2 here, so I'll call up the next panel as well. If you are here, Robert Kennedy, Project Action, Thomas Mangrum, Project Action, right? Good morning. All right, who wants to go first? I love when that happens, the way people look at each other. Please introduce yourself and you may begin your testimony.
Okay, I'm Thomas Mangrum. And like you asked for, at the beginning, for us to describe ourselves, brown skin, I guess. I got on a burgundy sweater or whatnot, so, African American. So, I'm here to talk about DDS and ODR. With DDS, they need more funding because like, for people like myself, it was like literally a life or death situation for me in several occasions, and they was there for me. So they need more funding. And for ODR, whatnot, when it comes to housing, we need more notice of different housing that be built up that for low income and for people that have mobility problems. Right now, different agencies has not been notified. Like Project Action, we got a lot of people that comes to us looking for help or what have you. And like, I'm a chair of Project Action, Ricardo Thornton, he's the other chair. And like, we don't have nothing to really tell people or help them because a lot of times, all the people that don't need the accessibility housing, they wind up with it because we're not told about it. And with new housing be built, there must be some affordable units, and there must be some accessible units, but we don't get told. So the ones that wind up with it, it's the ones that winds up going there on the right day and the right time. And it just happened to find out about it. So we're not being notified. And also, when it comes to the public streets and sidewalks, you should like maybe hire some kids for the summer to point out the different areas where it's not accessible. Because just because it's a curb cut, that don't make it accessible if you can't go from one end of the block to the other end of the block. So, and then that would make them more aware of the problems that people with disabilities have. So maybe one day, I don't know, if they see a wheelchair in the street because they can't use the sidewalk, they won't be cussing them out. They'll be trying to check it out to see why they're in the street. Because I have led a caravan of cars on many days because I was able to use the sidewalk. So keeping that in mind, like making sure that we do have a way to know when we have accessible housing and the square footage that we need. Because like putting us in tight spaces just cause a lot of us in wheelchairs to damage up the walls that's in our place because we don't have that much movement to be able to turn around. So it's more besides just the bathroom being accessible. The living room got to be accessible. The bedroom got to be accessible. Because some of us, we got to take our chairs to the bed and then slide over from the chair into the bed and back. So we need accessible spaces.
Got it.
Thank you.
Thank you so much, Thomas.
Yeah, so my name is Robert Kennedy, with Project Action. Back in the day, I was the president back in the day where we first started and stuff like that, okay? My testimony is more like I'm getting certified a DDS. Okay, why I'm here I'm having function, okay? And where I'll start where when I was my mother was I wasn't with my mother where 33rd G Street. People don't know how to talk to me, how to really being where I guess didn't understand. Okay, I should say I live in Ward 5, my name and all that good stuff. But anyway, I want to get into my stuff. But where what I'm saying is more like where I'm getting service at DDS. This is like it's more like talk to me where I don't understand. I had went through and stuff. I went through the whole thing. I was gonna go overhead, you know, and I wanted to making sure a person like myself, how I function, somebody getting, more treated, you know, where and stuff like that. Yes, this was day before yesterday. My DSP meeting at home. I haven't done a vital service. Oh, there was it again. I hope you have my paper. It's down on Georgia Avenue, or they helping me or doing like one. I want to have another lady come. I had a guy come in on Wednesday and Thursday, help me go to the store, but I'm teaching him go to the store. I can teach you because coupons. No, I'm saving, okay, or stuff like that. But my car is like she could tell me, you got to. So I got that together. I'm on his butt doing what's up. And she asked me, what you doing on the weekend? I asked her, what you doing on the weekend? Because weekend's mine. You 9 to 5. It's my time. It's not your time, right? But only thing I want to tell you is this, where a person like me, I function, whatever. I know what I have to do. Yeah, I drive. Yeah, I have two. I had congratulations, boy. I've been for 30 years. I've retired. Okay. Social Security sucks. I'm getting $1. I say $1. It's 100. They say I get a pension, but I have a house. I know how to get down. I want to say where has somebody like me, has somebody please know how to be more respectful, whatever, and stuff like that.
Absolutely.
That's what I'm here. That's all. Okay.
Thank you. Yes, thank you.
All right.
Good morning, Madam Chair.
Good morning.
It's truly an honor to be here to see you again. My name is Ricardo Thornton, and I'm here with my wonderful wife,
Donna Thornton.
and we're here together to just talk a little bit about the performance hearing of DDS. So again, I'm going to read a little bit here. Let's see. Good morning, Madam Chair and members of the Committee on Facilities and Family Services. Again, my name is Ricardo Thornton, and I am here. I am the co-president of Project Action. As Thomas has said, we have 2 of each. Yeah. Of Project Action, Self-Advocacy, and I serve on a number of coalitions. I serve on many committees, including the Advocacy of Public Policy Committee as chair of the Developmental Disability Council. Very honored that. My wife, Donna, is here today, and she wants to say a few words about your retirement. You want to say a little word? Go ahead. Retirement and how good as Andy has done.
Hey, I can't hear you.
Andy, thank you, Andy. About Angie Reed. How good do you like your services?
Oh, I love the service, and I love the service, and I like Mr. Andy Reese, what he's doing, and I like what I like what Bundy School doing, and I love what everybody's doing down there, and I hope they I hope they keep up the good work. And
Yeah.
that's all I have to say.
Thank you, Miss. Thank you, Mrs. Thornton.
I love it. I love it. Okay, so again, we're gonna go talk a little bit about. I'm off the strip again. I'm gonna try to put it together and make it work. So Public Policy Committee, I spoke about my wife, Donna. Both of us Both of us, my wife Donna and I, and my brother William, are all former residents of Forest Haven. Next year is going to be a big milestone celebration. Hopefully, looking back and looking where we are now, it's truly, truly a blessing. The services that we have received from DDS, they come to our meetings on Saturday morning and they are energized to hear some good things and what we can do to make our systems better. And I used to bring a lot to them, and they bring a lot to us. They talk about our health, remind us about the COVID-19 as we all look back over that, look how far we had come and give us updates with Andy and Dr. Bullitt. And we really appreciate that. We also appreciate the idea that we were included in decision-making. And I'm just like I said, I can say a whole lot of good things about them, but then things that we need to work on. We need to continue to work on communications. We need to make sure that people with developmental disabilities rights are not violated and that they're being accepted in spite of what their disability is. Providers need to continue to keep up and notify and know that the rights are their choices and that we have to respect that. Right now, we have providers that are going through a quickie and they're not listening to the people, they're just going through the work process. So we want to make sure that we are included at the table with that. Talk a little bit about ODR. I'm sorry, I missed the hearing on that one, but ODR, and they say how Mac is doing a great job. I'm sorry, Madam Chair, I'm looking at my paper. Okay.
Oh, you're totally
I wanted to thank Mac McCullen and his team of the Office of the Disability Rights for working hard to making sure everyone in DC government follows the American with Disability Act. The ADA, ODR is working more with employment, making sure DC government employers are getting accommodation, and they need them to make sure that the government gives them opportunities, good jobs, and good placement in the disability work. I am happy that ODR is working hard on the next homestead plan. We need to keep that going because no one should have to live or even think about institutions. That should be the last thought. We all deserve to live in a community. I want to talk about two issues from DDS. Partnership is making sure services providers are respecting people's rights. Partnership with advocacy and important. DDS should continue to working with Project Action and making sure self-advocacies are part of the decision making. The committees of DDS should also keep working across agencies to make sure that people with disabilities have accommodating and all benefits are served. I don't want to see anyone being left behind. I also want to see people going forward. I quote what this message right here was given to me, not on here, but someone that have told me, and I thought this was good for the day, and that is, I enjoy my services and I want to keep my services. Please don't take my rights from me. Let me continue the great work. Thank you, Madam Chair, for this.
Thank you.
Are there any questions? Oh, Madam Chair, one more thing. Lindsay Wilkes is not here today, and that's really my fault because I am a mentor to him now. So he was supposed to be coming with me, but his testimony is here so you could read it. He is also.
Would you like to read it for him? It's up to you.
Sure, I could. Okay. So here's this. Good morning, Madam Chair, Lewis, and the Committee on Facilities and Family Services. My name is Lindsay Wilkes. I am an advocate for people with disabilities, and I'm a member of Project Action, DC Self-Advocacy Coalition. Last year, the mayor has appointed me to the DC Disability Council. I am trying to be a strong advocate. I live and vote in Ward 2, and I'm a native Washingtonian. I grew up in Southeast DC, and I worked at the National Geographic for 40 years. And he is retired. Oh, and I am also in the Special Olympics. I'm a coach of the basketball playing and lots of other sports. I love sports. I am part of the Next Chapter Book Club. that RCM of Washington and DDS service provider facilitates. The book club helps me to read and to do better. Thank you, Madam Chair.
Thank you for reading for, I appreciate that. All right, here we go. Thomas, you talked about full housing accessibility. You mentioned the need for accessible housing and the need for more clarity on where accessible housing is.
Yeah.
Can you talk about where, if anywhere, people with disabilities can currently find out about accessible housing? And where would you like that information to be available?
I would like for that information to be available to DDS and Project Action, because we do have people coming to us.
That's right.
But right now, we not getting none of that information or where it is or what have you, unless we go to apply at an agency. So, but other people, they're walking off the street, they get into the affordable housing just by showing up, what have you. And so if they show up on the right day at the right time, they get into it. And then a lot of times the accessible housing has been given to people that don't need it, you see, because they was there. So instead of us being notified about them different things, what have you, and different agencies that definitely serve people with disabilities and learning disabilities, instead of us being notified, we don't get notified about that at all.
Got it.
And see, and also the importance of hiring teenagers to work and be aware of the accessibility issues will also keep a lot of the snatch and grabs and a lot of the stores from closing, because they be able to make money, but also they're learning how people with disabilities and seniors live and the needs that we have.
I love that. You also talked about housing that is accessible, actually being truly accessible, meaning not just considering sort of going through the front door, but how you move around in your space. And what are some things that you want to just make sure when we have housing that is considered accessible, what does it mean for it to be truly accessible as far as the space that's needed?
Right. So for the mean truly accessible, not just the bathroom. A lot of times people go like, oh, you could use the bathroom, right? But if you can't use the living room, if you can have family or friends that come over to see you because you don't have no couch, because the space is so tight, or what have you. So those of us that live by ourselves, it makes it even harder for us to actually have company. And then if you live in an apartment building, they might say the all-purpose room, whatever they want to call it, you know, you can have that. But in order for you to have privacy with your friends or family, you got to pay a fee. So sometimes you got to pay $250 just to hold the room, and for people that says might show up. Like at the building that I live in, when I first moved over there, they was trying to do that. And so, but people didn't show up. So they wound up having food after they done paid for the room. And they wound up knocking on my door because my floor is on the same floor where that room is. So I benefited from all that free food. But the thing is though, the people that wanted company come over, but the spaces could be so small that you can't really have people come over. So when my nieces and nephews come over, that ended up being a short visit, because they got to stand up the whole time that they're there. So, and then plus trying to maneuver in a chair, you wind up bumping into walls and stuff. I done damaged some walls in my place, or what have you, trying to maneuver because the space is so tight and what have you. So we need for people to think about the square footage, because putting other people in a tight square footage, that might be okay for them. But people that have to use mobility equipment, no, it's not okay for us.
Understood. Thank you for voicing that. Mr. Kennedy, Robert Kennedy, the former president from
Oh.
back in the day.
Oh,
What you saying?
I've been getting that all the time, okay?
You mentioned sort of you want to make sure people want to feel like people listen and are accepting and know how to speak to you and talk to you. Describe what that would look like for you.
Oh, well, I mean, from right now. Oh, you listen to me?
Yes.
Or are we arguing?
No.
Well, you know, what I'm saying is this, it's more like when you, okay, you talk about RCM, but see, I work at RCM, I've been, well, this year it'd be 15 years. It's more like more people being how customer service,
Okay.
okay? And it's more like how you treat people, how you do. Like I told you, I had worked, well, I remember I did, but work at a NLRB, the National Relations Board, for 38 years.
Mm-hmm.
Like I say, customer service, how to talk to people, how to talk to people on the phone, how to, the knowledge with people, how to do things, how to really, like, most of the time when I get on the 80 bus, whatever, I've been talking, the guy said, some people don't know how to talk to people. Some people don't know how to do this, whatever. But so somebody would say, I should teach them. No, why I got to? You should know that yourself. I mean, deal with the public.
Mm-hmm.
Deal with where you're supposed to be doing. I mean, if you can't deal with the public, whatever. But I'm gonna tell you something else. I'm an usher at St. Gabe's. I deal with the public, and when you do things, it's you have a good feeling
That's
of
right.
doing. Okay. Right.
Absolutely. I know, I hear what you're saying. Improve customer service, people who know how to speak to people, talk to people, especially and when you're in a public service position, being respectful and treating people how you would want to be treated yourself.
Yeah. Yes.
Absolutely.
Yes. I mean, I didn't come in and we back and forth like, no, come on now. We both gonna have a heart attack.
That's right.
Hey, you know, but you know, okay.
Thank you. Mr. Thornton and Mrs. Thornton, thank you both for being here. Something you talked about is communication and improving communications. How do you think communications can be improved?
I think it can be improved by coming together, sitting at the table with us, and more people listening to us, not making decisions for us without us. I think it's right. And I have a big problem with literacy because some of my friends does not read 100%. And they really feel good when someone comes to them and explain to them what it is that they're receiving or doing, not just giving them a piece of paper. This sign right here, don't worry about signing it. You're fine. And then when the people downtown comes, they like, we all on one page. I have a problem with that. I'm just hoping that we be able to get on the same page where we can work together in that area. And last but not least, Madam Chair, I'd just like to take, and I just saw this on my that was to invite you to come to one of our project action meetings if you have time on March the 23rd from 10 to 12, and you get to meet some of the other advocacies on Development Disability Awareness Month as we celebrating. We will be meeting in person at the First Trinity. Help me out, Thomas. First Trinity Church. Is that Luther?
Yeah.
Yes.
Luther. So we would love if you would like to come and be a part of that. And get to see some of more of our advocacies.
I absolutely would love to be there.
Anything else, Tom?
And Ms. Thornton, you talked about DDS. What's one thing you think DDS does really well that you're really happy about?
What she say?
What's one thing?
What is one thing that DDS does well as far as the services you receive that you want them to continue to do well?
What she say?
What is one thing you see the DDS is doing well with?
One thing they doing well, they doing They doing a good job, and I think they need to keep up the good work.
I will let them know. Thank you.
Pay our providers.
And paid
Pay
providers.
our providers so they don't keep running into Maryland and stay here in DC.
All right. Thank you. Thank you so much to this panel.
Welcome.
So what's this been heard, Madam?
All right, Lindsay Wilkes, Lynn Snyder, Carol Grigsby, Diego Mariscal, Leslie Veloz. Oh, okay. That was Lindsay's. Okay. Can I call the rest of the other panel? Okay. Irma Washington, Shawnee Jones, Tanya Martin, we have 2 virtual. So who are we going to start with? Thank you. Good morning. The rest of your panel is virtual, so they've left you at the table by yourself, but you will hold it down. Good morning, and introduce yourself and you can begin your testimony.
Good morning. Is this on?
Yes.
Can you hear me? All right. Thank you. You want me to start?
Yes.
Okay. So I'm Carol Grigsby. I am an older white woman. I have red glasses and I go by she, her, and hers. Madam Chair, I'd like to thank you for allowing me to testify again this year about the Department on Disability Services. I was formerly on the Developmental Disabilities Council. I now serve on a couple of different committees of DDS. And I also blog on developmental disability issues at DD in WDC. My son is 31 and he has received supported living services from the Department on Disability Services, the Developmental Disabilities Administration, for the past 10 years. And my comments are primarily focused on that arm of DDS, therefore. I first want to mention that in the agency's responses to the council, they were still talking about the change in eligibility as being sort of a prospective thing, but it's actually been in effect since October 2022. So I would have hoped to see more about how the first full year has gone of implementation, and I'm sure that Director Reese will address that some this morning. I also wanted to say that I was very pleased to see that the agency will be continuing to focus on training for dual diagnosis because we're told that that's an increasing proportion of the people who are coming into the system. And it's absolutely essential for that training to be available to providers. Hopefully it will become mandatory at some point because it is so important. So I have a few other issues that I wanted to also mention. And they're based on my sort of dual role as a family member, but also as a very active advocate with DDS. First, I would really hope to see a more systematic information flow from DDS to its provider agencies. There are monthly community forums. There are provider forums also that I understand exist, but somehow a lot of information about new policies, new procedures just does not seem to float down. And one thing in particular that I noted this year was that when the personal needs allowance for people receiving residential supports was raised from $100 to $150, quite a number of the agencies were unaware of that fact. And since they, in most cases, are the ones handing over the money, they were still only giving $100 to the people who they supported. And it wasn't until December that there was a letter that went out to the agencies saying, hey, this happened. And I suppose in most cases that the agencies then went back and made good, but that was several months too late. So that's just one example. Now, on the subject of the personal needs allowance, it was great that it went up from $100 to $150 because it had been like, 14, 15 years sitting at $100 with absolutely no cost of living allowance. So that was absolutely wonderful. The plan was also to initiate a COLA, a cost of living allowance, every January when the SSI amount went up. And that was actually intended to start going up last January, but okay, we got the 150, so that's good. But now, hopefully in the 2025 budget, there will be the COLA starting in January and a plan to make that go into effect every year thereafter, so that it's not always coming back to the trough and starting over. And last but not least, I serve on a DDS residential committee. And there are two issues that I wanted to mention in that context. One is that DDS has a rent cap for the people who get residential supports. That rent cap usually goes up some each year in recognition of the fact that the costs of housing are going up. This year, for some reason, that just flatlined. It was kept at the same level in fiscal 2024 as in 2023, even though rental costs are going up. And I was curious about why that was the case. Secondly, the housing guide came out this year, and that was excellent. It has a lot of really, really good information in it, but it's very dense. It's just full of really complicated terminology and that sort of thing. So I really hope DDS will find a way to roll out more user-friendly housing resources for people with disabilities and their family members. That's the end of my testimony, and I thank you again. I'll be happy to take questions.
Thank you so much. Diego?
All right, I'm one of the virtual people here. Can everybody hear me okay?
Yes.
Okay, perfect. So I'll start. Hello, everyone. My name is Diego Mariscal. I am a 30-year-old male with glasses on. So I wanted to testify today after being a resident for DC for over 10 years and express my deep frustration and dissatisfaction, particularly with Vocational Rehabilitation Services Program of DDS. I first enrolled in DDS in 2011 when I wanted to get assistance for college. And when I did that, I would often receive my authorization papers, which is essentially the paperwork that pays college, that pays for school, after my semester started. I did not know that this was a violation of VR own policies at the time, but because of this mistake, I ended up owing American University more than $40,000, and VR did not take any responsibility for that debt. Fortunately, about 10 years later, just last year, I was able to graduate debt-free with a bachelor's in business administration, but that didn't come without multiple appeals and multiple arguments with VR about the quality and types of services that I was receiving. Fortunately, I've been able to surround myself with colleagues, like many of them are in this room, or the late Judy Human, who was the former director of DDS, and understood how to navigate the complexities of the agency. But my point in being here today is that I shouldn't have to befriend lawyers or know too well the complexities of the appeal process in order to receive adequate services from the agency. I often feel humiliated and patronized when I go into the agency, as opposed to feeling supported and guided for services. I will end with this anecdote. My employment goal was is to support entrepreneurs with disabilities. Thankfully, I am at a point now where we have supported more than 100 entrepreneurs with disabilities across the country. But when I was first starting, I would speak to my counselor and he would give me resources and provide me supports. What he didn't realize was that he was sending me resources and supports links that would link to my own company. So he was essentially referring me to myself. And so I hope that with this anecdote and with my story, you can see how DDS, specifically RSA, is systematically flawed. And I encourage the council members not only to look at whether the agency is adhering to policies, but also to examine the satisfaction of customers and consumers, and to work with advocates like myself and others in this room to actually support people with disabilities the way they need to be supported. Thank you.
Thank you. Next, we have Tanya Martin. I'm going to go to Irma Washington.
Good evening, Ms. Facilitator. I'm Irma Washington, African-American woman, gray hair, 65 years old. Can you hear me?
Yes.
Okay, I must say that maybe it's maybe what I need. I live in Maryland. I have two great niece, a great nephew that's with IAG, and he lives in Illinois. And also I have a daughter. I adopted them. Okay, so they were all siblings, same mother, same father. And so they're my great nieces and nephews. So my daughter, Teresa Washington, is really what has brought me. I know Miss Carol, I know Miss Gatsby, and I always follow through with what she has posted on her email. But I have a daughter in your system. She's being serviced by an agency called New Living. And so my daughter situation is real technical. And I think what's happening is I heard, and Ms. Facilitator, I must give you the props, really listening to you earlier. I commend you for the way that you're so efficient with the OD, with the over disability rights. When I was listening to you as you started off, you're very efficient. What I need is help. My daughter is Teresa Washington. She's in her 30s. She's 32 years old. She's been pregnant twice. She's being serviced by a place called New Living. My daughter's disability is very severe. She has been placed several times in different mental health places, but she ended up going to a psychiatric institute. So what happened recently through the service providers that she had, I had notified them that she had severe issues. What happened is that she tends to not really take her medicine, so they had gotten her someplace to live, and she ended up losing control. And not just losing control, she also was pregnant and she had a baby. When she was living in Maryland, she had a baby and it was taken from her because of her severity of mental illness and unable to care for a child. Okay, and she had her child back in January of last year, 2023. My concern is that when I talked to the agency back in 2022 to find out how they were going to monitor my daughter, her name's Teresa. I'll use her first name if it's okay. I was given all this explanation, how they were going to care for her and everything. And unfortunately, the father of the child is also also in a situation. But anyway, I got a call from the DC Attorney General about 3 weeks ago, and they told me that they were asking me to come to court. And I know I've ran out of time, so I'm sorry. This is really serious, Madam Chair. I just wish that I could talk to someone, maybe out of your office or so, that I could give you more information on what my greatest concern is.
Yep, my team is gonna send you a message you'll see it in the chat in the Zoom. Just give us your name and number and we'll follow up right after we're finished with our hearings
Yes,
today.
it's very, and just again, may you continue to do the work you're doing. I appreciate what I've been hearing. Like I said, I live in Maryland. I'm also on the RAD board in Montgomery County. It's the Residential Advisory Board for HOC. And I'm also on the board of Montgomery County Federation of Families for Mental Health. I've been on the RAD board since October, but I've been on the mental health board for the last 22 years. So mental health, and also that's my background. Mental health is my background. And so if you could, I would appreciate it very much, please. And I will give you my information if someone can contact me on this situation, please.
Absolutely will do. Thank you so much.
Thank you.
Next, we have Tanya Martin. If you can unmute and come off video. There we go.
Good morning. Let me get myself together. I know I was going that fast. Excuse me. I'm back. Good morning. Thank you, Madam Chairman. My name is Tanya Martin, and I'm disabled as well as a disabled veteran. And I'm calling because I'm going to talk about, okay, you talk about the Office of Disability Rights in the Department of Disability Services. I understand they do have services, but as a veteran, I don't see anything for us. You have a lot of veterans here who have served their country, and you can't even get any good programs for us. No activities, no events, nothing. Also trying to find different programs for people with disabilities. It's not really easy. A lot of people who have disabilities, maybe they don't have a computer. You know what I'm saying? And so how do you find out the information? And I have a problem with that. Recently, I contacted your agency because I needed some help. I was attacked on February the 2nd, 2023, at the DC VA hospital on a main parking lot. I reached out to all the council members, the mayor, even council member Eleanor Holmes Norton, and nobody could help me and stuff. They don't have no security cameras, never had. And I felt like I was letting DC leadership know what was going on in their city. And so I didn't get anything. Pretty much everybody went ghost. So I want to say, please tell me, what do you have for disabled, not only disabled, but a disabled veteran? Because I'm not seeing anything. And you have a department. And I've talked to Fallon Williams. I even went to her and got nothing. So just almost like ghosts. So please explain to me, what are you going to do for the veterans that are in your city? And what services do you have for us? Thank you.
Thank you so much for your testimony.
I know you have a department, but what are you doing?
Absolutely. We're going to follow up and ask. We will follow up and ask those questions.
And also too, when I was telling you about what was going on, because I'm pretty sure someone on your staff knew that I got attacked, and that should be serious or important, especially for the DC leadership, because if anything was to happen to anybody at the VA hospital, they would blame it on the city. They would say the city's not doing enough with all the crime we have there. So I think that's important that someone from the council or then that on your spectrum needs to reach out to the VA and say, you need to do something about that. No, you got people running around there, got PTSD, talking to themselves, everything, and it's not safe there. Thank you.
Thank you. I'm going to call and see if we have Shawnee Jones or Lezia Velos. Okay, thank you. Just a few questions for this panel. Ms. Grigsby, thank you for your testimony. You mentioned that DDS opted not to raise its rent cap in fiscal year 24, despite the rent cost crisis we're experiencing in the district. Can you describe what the impact of that decision has been on people with disabilities?
Well, I will say that one thing I want to mention about that is that was also an example of information that didn't get widely distributed. And it even seemed as though service coordinators weren't completely clear about that issue. So, one issue about that is making sure that the word gets out. I found out when I asked. Since I am a parent of a person who's getting services, but I'm also someone who is able to help out some with the rent. It didn't affect us too directly. It does affect a lot of other people who then wind up having to go live in Maryland. People are getting pushed farther and farther out of the city. And that, that means they really aren't rooted in DC. They just keep getting pushed farther and farther out into Maryland because they have to go where the rent is lower. I think that's worrisome in and of itself, but I also just have a question about why, when the rents are clearly going up really everywhere, even in Maryland, why that wouldn't have been examined and why there wouldn't have been any increase at all.
Yeah. You also said there's a need for, I think, more user-friendly housing resources.
Well, the housing guide has been under development by the new housing coordinator for the last year.
Okay.
And, housing is complicated, right? Accessible housing, affordable housing. There are all sorts of voucher programs. It's really a complex set of issues. The housing guide is just chock-a-block with information, but it's for the disabled community, and for their family members. And when people want to come with very specific questions, it's going to be very, very hard to navigate that. So we've already had some follow-up discussions about that. And I know that DDS needs to sort of take that guide and break it down and think about the pieces of it that really need to be highlighted and getting the information out there in an accessible and and readable and understandable way.
Yeah. When you started your testimony, you mentioned that there was a part of the testimony that didn't really address where DDS is over a year, has been over the year. What more information would you want to see in that regard?
Well, this was a historic change, right? In October 2022, you went from having a developmental disabilities administration, which actually was only an intellectual disabilities administration, to opening the door to a much broader set of developmental disabilities. It's really important, I think, to understand how in the first year, what impact that had on the numbers of applications, what kinds of waiting periods people are experiencing when they apply with other developmental disabilities. And a variety of other issues, like whether they're seeing different types of needs coming through the door as a result of that, and what they may be thinking about doing on that. So I just would have hoped that right up front for this hearing, a lot of that
Understood.
information would have been in the agency's responses, rather than what looked like just sort of maybe dropping in last year's information. But I'm sure that information's available. I just think it would be good for it to be out there in public.
Understood. Yep. I understood. We're going to follow up in that regard. Because I agree, it was a substantial change and a great change, and something the agency actually should be celebrated on for being able to do that and do it so quickly as well. So we will be follow up on that as well. And I look forward to having further conversations with you outside of just the hearing space as well. Diego, thank you for your testimony. I'm sorry to hear about your experience with RSA. You mentioned that the way you were treated by the agency made you feel humiliated, and I'm sorry to hear that. You also mentioned that there's some systemic flaws. What changes would you like to see RSA make to prevent other supported persons from having an experience similar to yours?
Oh, just realized I was muted. Yeah, it's a complex question. I think that in my experience with RSA, counselors are overworked and undertrained. And so there really needs to be an effort from the agency and frankly from DC government at large to look at how are these specifically RSA not only following procedure, but ensuring that DC residents are getting accurate services and that we're not having to necessarily have essentially a deep understanding of our rights in order to get adequate service, right? And so that would be one, more support for the counselors themselves in terms of capacity building and training to be able to adequately provide services. And the other is just better information and dissemination on the rights that customers have about how to navigate these systems, because I've been a recipient of those services for 10 years, and it's taken me 10 years to understand the complexities, but I'm only able to advocate effectively now because I've learned that how those processes work over the years. It wasn't initially that simple.
Thank you. I appreciate that. Ms. Martin, first of all, I'm so sorry for the experience that you had and for the lack of leadership response across the board. And I agree with you 100%. It is in our best interest as a district to respond and make sure that the spaces and places are safe. And so I apologize for the ways in which you were not responded to, and in the hopes that we can get some leadership to respond. In reference to veterans, what services would you like to see our disability agencies provide to veterans?
I mean, well, like just having some type of activities, because we have experienced a lot of trauma being in the military. So, I mean, just programs, I don't know what kind of programs, I mean, some activities where, I mean, they have a round table every month, but maybe 2 or 3 times or even once twice a month, just have where people can come in, tell you about the resources and stuff, tell you things, even have like maybe someone come do a meditation with us or do some type of exercise, but it's nothing for us. Like especially for the female veterans. Now I've seen a couple of times where Mayor Bowser had like a parade that was for veterans, but it was all men. It was never no women. So I'm like, do they know we have a lot of female veterans who live or born and raised in Washington, D.C. would like to see some things done for us as well. I mean, I've talked to Fallon, but like I say, I mean, I don't know what her expertise is, but she hasn't really done anything. I mean, I went to something in November, but she as the coordinator of it, she should be doing more for us, because I think she is a veteran as well. I just need some help. I would like for y'all just to send something, because me being attacked at the VA, I figured that it was on it by being in Washington, D.C., that y'all would, I guess y'all intertwine and y'all connect somehow. And when I told you that they didn't have any working cameras at all, they didn't even install them at all on the main parking lot, which was in construction, that someone would, send something to the director. I went out to the director, the police, nobody did anything. That someone from the council or even the councilman would say, you need to get them as soon as possible. It's serious. It's been over a year and they still do not have any security cameras on the main parking lot, and that's serious. And somebody could get hurt on that on the property. So I'm hoping that you or somebody who deals with the Veterans Administration will send some saying they need to get him as soon as possible. Thank you.
Thank you. I'm gonna reach out to EOM and see what connections we can make there.
Can your could your staff keep me in the loop of that
Sure.
as well?
Absolutely.
Thank you. Have a blessed one.
Thank you. Next, we're going to have our next panel of witnesses. Thank you to this panel. We're gonna have Hazel Brooks, Marie Bolden, Jerome Walker, Troy Stevenson, followed by Marquette Henderson and Roy Patton. Good morning. Ms. Hazel Brooks, you can begin first, your testimony. Thank you for being here.
Good morning. I'd like to get my little self together here. I'm Hazel Brooks. I am a blind vendor. I'm a female, Black African American, a transplant from Detroit, Michigan to DC for the Blind Vendors Program. My colleague has asked me to read her statement, so if you will, and she has copies that she wants to give to you guys. Can she do that? Oh, okay, great. Okay, I'm gonna read her statement first, okay? It goes, dear council members, I, Marie Bolden, am writing to express my deep concerns regarding certain unfair practices of the state licensing agency, the SLA, of the Randolph Shepherd program under the direction of Mr. Andrew Reese. The director has brought me here to testify. As a blind vendor for 37 years, I believe it is crucial to bring these issues promptly to your attention to uphold our values of fairness, equality, and transparency. Specifically, the rules of the Randolph Shepherd law is not being followed. For example, the 21% levy of our gross sales is not being used for the maintenance of equipment, the purchase of new equipment, the fair minimum return, and the first initial inventory. The staff shortages is another factor that is affecting the smooth operation of the blind vendors. Financial reports that affect our business operations are never made public to us. These actions are only undermine the trust and morale within our organization, but also contradict the principles of fairness and equality that we strive to uphold. There are certain employees of the SLA that do not respect or treat us as independent business owners. Intimidation and verbal hostilities are a common practice when dealing with us. It is imperative we take decisive action to rectify these injustices and ensure that all blind vendors are treated with the respect and fairness we deserve. I urge the council to initiate a thorough investigation into these matters and implement appropriate measures to address and prevent such practices in the future. Sincerely, Marie Bolden, 301-567-2014.
Thank you.
Again, I'm Hazel Brooks. I'm a little nervous, I think, but maybe not. The Randolph-Shepherd program is, first of all, a great program. It always has been. And with me coming from a different state and being able to afford myself the luxury of being in two Randolph-Shepherd programs in different states, there's great differences. I really am very saddened by what's happened to the program. I'm deeply saddened. It's been a terrible experience for me in terms of trying to get things done, trying to communicate with the agency for our needs to be met. It's been horrible. We went without a program manager for a couple of years. So we basically had to fend for ourselves, do what we need to do to get everything done in our businesses. I read some of the replies to some of the questions that we had posed to them, and there was shortage of staff and their inability to work with the BVC, one of the seated BVCs. And I read it, it was kind of likened to, I've got these unruly kids and they're not doing what I want them to do. So we couldn't get anything done, but they're the state licensing agency. You would think you find a way to cross those bridges and make this thing work. It's horrible. It is unbelievably horrible. We've had no accountability from them. We get, just like Ms. Bolton expressed in her letter, we don't get any records or anything of the financial stability of the program.
Mhm.
And we just have not heard from them at all, basically, and then there's this other group. There's the have and the have-nots.
Mhm.
So the haves, basically they get all of the services from DDS because I don't even know why they get it. You know what I'm saying? I just know that there's a disfranchised group that we get nothing. And then the other folks, because of their associations, favoritism and things like that, they get everything that they want. So you're going to hear possibly today conversations from the have and the have-nots. They work, the agency, I've always believed this, they work for us. We do not work for them.
100%.
There's, and I'm going to say this, I hope there's no reprisal from them for me testifying, because they do deal in intimidation, threats, and make life very uncomfortable for vendors to speak out. Now, they say, I ask a lot of questions, but I'm not an angry person. I'm not a person that, no. I ask questions because I don't know. I ask questions because the agency is not being, in my mind, handled like it should be, by the fact that we can't even contact them. The last supervisor they had, she just left this week, I think, but she didn't tell us. this is word on the street, that on her phone, she said, don't, paraphrasing, don't leave a message because, it might be a long time before I'm even able to reach out to you to resolve any problems on a phone that the agency provided for her. So again, we have these people that come into Randolph-Shepherd, some of these managers, and they don't care for the needs of the vendors. And I'm going to say this one other thing is that some of the people that they train to help us, our monitors, they're basically non-existent. We don't see it. We don't see them enough. They're not there for us when we need things, So even with COVID, we had to pretty much kind of do the best we could. But COVID has been over with, I mean, even through that, we could have still communicated. We still could have got things done. We still could accomplish things, even in that fact that we were going through a pandemic. The agency works for the vendors. We don't work for them. And I think it's gotten away from the fact that some of the people that they hire, they come in, they treat us bad. They don't even know us, but they treat us bad. You know, so that's their culture that they're developing with people that they even hire, you know. And I think it's unfair. I think it's not right. And honestly, if I did some of the stuff that the agency did to me, my employer would not keep me. They would not. And I'm not sure if those bridges can be mended to make it work. I'm not sure. I'm not sure what it's going to take for us, the blind vendors, the blind community in Randolph-Sheppard, to be able to reach across the aisles and say, hey, you did this, you did that, can we fix it, can we work? I'm not even sure if that's possible because there's so much that's gone on. It's a whole lot, but let me just say this. They say I talk a lot, maybe I do. In one of the statements, they said, oh, it's just a group of people that didn't get what they want. A group of people get frustrated to the point to where they go out and picket. I don't think that's a group of people that's disenfranchised and saying they didn't get what they want. When people go out and make signs and picket in front of this very building and ask for change, I don't think those people are people who didn't get what they want. I think those are frustrated vendors. I think that they're people who want change. And I think that a lot of us that may or may not be here are basically intimidated by the outcome of us actually speaking out and making our concerns heard. I think I've covered everything. Thank you. Thank you for the council for allowing me to speak this morning.
Thank you so much for your testimony. All right. Who's next? Give me 1 second. Jerome Walker.
Council member George, my name is Jerome Walker. I've been here since 9:30 this morning. I know that my group was coming much later, but I just wanted to come in and listen to some of the testimonies of some of the other agencies. When I first came here, my intention was to describe or testify on a personal situation of mine with the agency. And after listening to some of the other testimonies, I decided to talk about the group as a whole and those persons who should be a part of this program and could be a part of this program, but they aren't. So a little testimony about myself. I'm a native Washingtonian. I'll be 71 on September the 1st. I live in Ward 1 in the same home since 1969, purchased by my father, 3rd grade education, my mother, a 10th grade education. He bought 2 homes in DC. I lost my sight in 1999 as a result of a crime. So one day I could see and the next day I couldn't. I moved back to my family home in 1999, back to Ward 1. In 2013, I came to the Department of Disability Services and asked them, could they help me with using a computer? And they told me they could, but only if I was going to seek employment. I hadn't worked in 14 years. Most of my work history was labor intensive, and I didn't know what I could do as a blind person. And I asked that person, well, what kind of opportunities could I have? Or what are the possibilities? And she said, there's a lot of possibilities. And I said, like what? And she said, have you ever heard of the Randolph-Sheppard program? And I said, no, I haven't. I lost my sight in 1999. I became eligible for that program around about that time. In 2013, when I went to the Department of Disability Services, I had never heard of the Randolph-Sheppard program. She told me that it's been around since 1936, and it gives blind people the opportunity to become entrepreneurs in the district government. And I said, that's what I want to do. And I became a licensed blind vendor in 2014. It changed the trajectory of my life, and it changed the trajectory of my family's life. I was then able to assist my sister, who was living in the home that we grew up in. It's 4 of us. 2 of them live in other areas of DC. And for the first time, I was able to participate in keeping that home in the family. What I've discovered and my complaint today is about the agencies and the failings of people like myself. I'm not want to talk about myself, but I hope that there are some council persons here other than Ms. George, because I believe the agency is failing every ward in this city. I live in Ward 1, and I'm the only blind person in this program from Ward 1. Ms. George, there's 1 new member in Ward 4 who just came to the program 2 years ago and almost didn't make it because of some bad actors in the SLA. There's 18 people in the program, and there might be 5 of us who still live in DC. All of us lived in DC to get in the program, but you know, upward mobility, and some decided to move to other jurisdictions, you know, the DMV we call it. But there's 6 of us who still live in DC. 1 in Ward 2, myself, in Ward 4, 1 in Ward 1, myself, 1 that I know of in Ward 2, 1 in Ward 7, 1 in Ward 3. We have the ability to give multiple, maybe twice as many as the 18 that's now in the program, opportunity as I have. There's no way to think that I'm the only one that can benefit from this program like I have in my family, because there's so many opportunities in this family and there's so many people not being reached. I've, in the 10 years I've been in the program, I meet people all over the city, and I share with them the program that I am in, how wonderful it is. And I know a lot of them have gone down to the agency to find out about this program, and I haven't seen not one of them enter the program. I think the constituents of each ward in this city is being failed by the SLA. I'm gonna end it there. Thank you.
Thank you for your testimony. Troy Stevenson.
Yes, ma'am. I'm Troy Stevenson, 61-year-old male. Midnight blue pinstripe suit. I'm the outgoing chair of the BBC, and I surely hope that Mr. Wyman had, you guys have gone over the emails that I have sent you, so you know that what I'm about to say actually happened, and it's in black and white. I like to refer to a part my colleague Hazel had mentioned, that the agency said that they couldn't work with the BBC. The agency couldn't work with the BBC because the agency trying to take the place of the BBC themselves. I removed the vendor that I appointed as the chairperson of promotion and transfer for not following the procedures and how things are supposed to be done. In 2018, 2019, I put out a grievance against the same cabal, is what I called it, the same vendors that Mrs. Hazel spoke of. These particular set of vendors have the ear of Abimi Solo Kuridolo Ali, and together they have colluded to defraud other vendors. And to give you some evidence of that, I will read to you the oath that we are all taking as BBC members. I agree to abide by the bylaws of the Blind Vendors Committee, to uphold the federal regulations and the District of Columbia laws, policies, procedures, and guidelines. I will not involve myself in activities or decisions for personal gain, but rather my action will be based on what I believe is good for the entire blind vendors. I agreed to be objective at all times and to respect the rights and opinions of others. I will, to the best of my ability, strive to develop and examine strategies to enhance the effectiveness of the committee and to promote a team of spirit that will flow to other blind vendors in the Randolph Shepherd Vending Facility program. I will make an extra effort to be actively and fully involved, sensitive to the needs of others, a leader who listens. We have these very same vendors who did none of these things. And something we call a call down when facilities come available. Mr. Daryl Evans, when we had a problem, but logistics of how could we take these facilities because they contributed to the pension plan of all vendors. And we tried to come together with a plan that will keep everybody to be able to continue to get their fair share of it. Mr. Evans went on with the call down after we had our objections. He violated the ADA. He didn't give us a reasonable accommodations. He did not tell us why. He didn't give it to us in Braille. He didn't give it to us in large print. He did not give it to us in recording. He said nothing to us. We had no clue that the call down was going to go on. Particular vendors, the cabal who's in close contact with Abimi Sola Dolu Ali did bid, violating the oath that they swore by, that they signed, and the District of Columbia signed. The District of Columbia and the BBC acknowledges that as a whole, we represent other vendors and not ourselves. When these vendors made these bids, 20% of the vendors made these bids, and the SLA received bids for 20% and did not receive bids from 80%, they know or should have known that something is wrong here. And this is where we stop to find out what is the problem. Because as I will read to you another email that back and forth between Mr. Evans and I will let you, I'm quite sure you have already, but as I find it, he had the unmitigated gall to write back to me, thank you for your follow-up, and I have engaged the federal authorities to see how we resolve. I am very uncomfortable that because certain members did not get what they wanted in the order that they wanted, see fit to eliminate vendors, members for their favor, in which a whole different matter. As I stated, the SLA recognizes Ms. Wright in her role. The SLA has no more power than the governor of Baltimore to come to the District of Columbia and tell how we're going to run things. He has no power or authority, and I reached out to him and let him know that he was overstepping and overreaching. He wanted to double down and continue with his negligent ways. And as a result, 80% of blind vendors have been defrauded of funds that go into our pension plan. The only thing that we can really do, really, as a start, is to get rid of Kiridolo Bimi Sola Ali, because he has no integrity. He came after me personally on a level. In the District of Columbia Randolph Shepherd program, you have 2 tiers of facilities. One is considered a primary. One is considered a satellite. Your primary is your place if you operate it correctly for life. A satellite goes up on call down every 2 years. Your primary cannot go on call down or be taken from you. When I made a comment about that this things that was going on from this cabal is the Bimi Sola Kuridolo Ali show, he had problem with that. We had a discussion and he told me himself he had a problem with that from a meeting that he shouldn't have privy to. He wasn't on the phone. So these same people involved in this cabal went back and told him what I said. And I admitted to him because it is. because it reeks of him. It was disrespectful. He had no integrity, and he retaliated against me by taking my primary facility from me. Never heard of before in the Randolph-Sheppard in good standings. He took it from me and put it on call down. I am running the most dangerous facility in the whole program, where I had to personally deal with unruly customers that come in, well, people off the street and threaten me. And I had to dismantle him and throw him out of my store. I am not supposed to have a satellite if you take my primary. I was supposed to leave that day, but instead I stayed there and stayed in the program, hoping that someday, some way, somebody will listen and take us seriously and respect us as human beings. We are not wards of the state. We are not members of an orphanage. We are grown, reasonable, intelligent, thoughtful human beings. All of us, some of us have children and grandchildren. I have 11 grandchildren myself, and I am nobody's child. And these things that happen to us should never have happened. He has it in writing. I don't know how he was able to stay in his position to say these vendors has favor, because in every other instance, it says for the collective of vendors and promotion and transfer is to have a uniform way of dealing with people. Uniform means everybody together. We cannot deal with these certain individuals if they want to go behind our back from meetings that we had with insider information and bid on facilities, who's also been a part of the Budget and Finance Committee for as long as we've been here. They know that these facilities contribute to this pension plan. They know that no vendors have any idea that this call down is going to go anyway, and they did.
Thank you.
Thank you very much.
Thank you. I appreciate it. I think we had Marquette Henderson, Roy Patton. I see you're here. Did you want to speak? What's her name? What's her name? Marie? Marie? Say it again. Marie Bolden. Marie Bolden, you may give your testimony.
She read mine.
Oh, she read it earlier
Yes,
for
she
you.
did read it.
Okay.
Thank you.
All right. First of all, I want to thank you all for being here today in this panel and for sharing your experiences with us. I want to start off by apologizing for the way you have been treated by the government of the District of Columbia. Your rights have been violated, your dignity has been violated, and I'm sorry this has happened. This has been the situation for so long. I know you mentioned, other council members being here today. I want you to know that several council members have gotten calls and emails regarding what has happened to you all. And many of my colleagues who couldn't be here today said to me, we expect you to handle this today. And I told them, and I gave them my word that I would handle this for all of the ward members who could not be present, from Ward 1 to Ward 7 to 5 and others. It is unacceptable, and I will be discussing this situation in length with DDS later on today. You all are a group of what represents many people who have come to us, people who have come to my office in tears. Just this past weekend, I had an interaction with someone who's a vendor who has dealt with this situation as well. And it will be handled today at length. Let me say that. I want to ask you to just talk about the impact of how the treatment by the SLA has had on your ability to earn a living, and how your experience with SLA has affected you personally.
That for any one of us?
Yes.
Again, my name is Jerome Walker, and I said earlier that initially I was going to come and talk about a specific incident of mine. And I will use this time to do that. I'm located in the Department of Interior, and I've been there for 5 years. I'm one of the first ones in the program to have what we now call a 365 market, which means, and mine is a man-operated market. I work there with 3 other employees from 6 to 2, and when I leave, my facility stays open with the use of a kiosk machine and automation that a company called Monumental has provided to us. Well, in the 5 years that I've had this piece of equipment, it's mechanics have broke down and malfunctioned dozens of times. The owner of that company has never had to call me for payment for the services that they rendered. We lost our manager, Mr. McManus, almost 2 years ago. And a year ago, I got a call from one of the executives of Monumental asking me who should he get in touch with to make payments that he hadn't received in over a year. I gave him 2 names and numbers. I called him 2 weeks later. He said he still hadn't heard from anyone. A week after that, he called me and said, Mr. Walker, I'm not hearing from anyone. You have an outstanding bill of $3,300, and I can no longer service you without payment. He sent an email to the new supervisor. She responded. She went over the invoice, and out of the $3,300, she made notions that they were only responsible for $712 out of that $3,300, and that they would pay that, and it was my responsibility to pay the rest. I called the financial person. They told me to make the payment and add it to my profit and loss sheet. I had no alternative but to do so because there were things that I needed from that company to keep my business going. I did that. So that month that I spent $2,200 out of my pocket, that reduced my income by that amount. And it reduced the levy that I would have paid to the agency by $400 and something, right? So 9 months later, I've been ordering some equipment that I needed to operate my stand. And it took 5 weeks before I got an answer. And the representative told me he couldn't send me those things until the $712 that the agency promised him he would get. This 9 months after they sent him a email invoice stating that they were responsible for the $712. So I had to make that payment of $712 to get the equipment I needed to operate my facility. Those are the kind of problems that each and one of us are having.
Thank you.
Thank you.
Thank you.
I would like to comment as well.
Yeah, and I want to note, we've been joined by Marquette Henderson. Mr. Henderson, if you want to come to this panel, I'm going to give you an opportunity. They're going to answer questions, but I want to set you up so that you can also give your testimony. Thank you. Go ahead.
Budget and Finance Committee. There was a time when my kitchen had a plumbing problem at Minnesota Avenue, and it was shut down for 3 months. And for those 3 months, they said idly by, and I still had to pay the employees as if it was still running. A time after that, someone broke into my store, bust the window out, came into, stole both of my registers. Other people followed behind that when they saw that the window was broke. They came in and they stole drinks and snacks and things like that. The SLA did not offer me 1 penny, no assistance, not even a bag of chips. These are the things that I have been going through. On this last call down, I didn't bid because it wasn't legitimate. And I've been accused of dropping a ball in fighting for our vendors' rights. But I was running with that ball because I'm the person who didn't receive anything. I've come to Mr. Walker beside me now. I borrowed $4,000 from him on 2 or 3 different occasions. I owe him today. And the agency did not assist me in any kind of way with these particular people in charge. That's just the short of it. Thank you.
Thank you.
I would like to make a comment. We pay, my name is Marie Bolden. We pay 21% of our sales. And the agency refuses to let us know what they do with our money. Now, that levy that we pay, that 21%, is supposed to take care of repairing equipment, buying equipment, bare minimum return. If a vendor gets in trouble, they're supposed to restock their store, et cetera, et cetera. But they refuse to tell us what they're doing with our money. They take our money and they use it. We ask for financial reports to see where our money is going, and they refuse to give it to us. Another thing, some of us need accessibility. They refuse to give us our material and the accessibility that we need. Some of us need tapes, some of us need Braille, some of us need large print. But Mr. Califf, the employee they have spoke of, insists on sending all of us emails, which some of us cannot read. The agency is horrible. It is horrible. As I said in my statement, I've been there 36 years, 37. I have never seen this agency in the condition that it is today under Mr. Andrew Reese and Mr. Dale Evans. They treat us like we're nothing. They disrespect us, all of them. And we go to work, we're stressed out. We always, something is always going on with them, and we stay stressed out all the time. I am trying to save this program. Randolph Shepherd program is a good program. I'm trying to save this program for the vendors, the blind people of tomorrow who's going to need a way of making a living. And we refuse to let anyone take our program from us and run it in the ground. That's all I have to say.
Understood. Thank you so much.
I'm Hazel Brooks. I'd like to speak directly to the fact that the services that I get in my facility don't exist. The monitors that we have working, we have one, Mr. Jelani Smith. He's been with the agency for years. And he's supposed to be someone who comes in and helps us implement changes in our business and to ensure our success. He works Tuesday, Wednesday, and Thursday, and is off Friday and Monday. And when we do try to contact him, when I try to contact him, he's non-existent. Never shows up, never does anything. And he makes a very, very nice salary through Randolph Shepherd. So it's not just Mr. Evans and Mr. Reese. It's everybody that they employ, everyone. We don't have a contact person if, like they was talking about, if equipment goes down or something happens. I'm in constant turmoil with them about equipment that I need, but I'm not going to buy a freezer in their location. I'm not going to buy, equipment that they should be providing, and we don't make, listen, today, when you take the cost of goods sold, when you take employee wages, when you take taxes that you have to pay, when you take insurance that you have to pay, when you take that you have to have people help us in our businesses, what is left for us? And then on top of that, 21%. 21% of what we make over the counter and 21% of what we get from vending income. They're saying, oh, it's 21. If you add 21 and 21, that sounds like 42 to me. That math ain't mathing. So we don't get none of the services. And like Ms. Bolden said, where's the money going? you know, I'm going to mention the terrible word, an audit. We need to know financially where we stand. We've not gotten any reports. Every month when the BVC meets, it's supposed to be information that they're supposed to give to us as far as the financial solvency of the program. I've been there 10 years. I've seen one report, and it was a half of one. So as far as what we're getting nothing. So just like one of the other vendors said, we lower that 21%, because at this point, when we talk about the cost of doing business, it's extremely high. And it's extremely high for everything: housing, food, everything. Everything that touches our businesses, we're impacted by it today. And we get no help from the agency. Now, the other thing is that they have decided to pick and choose and cherry pick as to who should be in this program. Even when we do bring new vendors in, they're closely scrutinized by the agency and that select group that Mr. Stevenson referred to as the cabal. There's been a woman that's been on the BVC, Ms. Brenda Beatty, for years. The agency has a great relationship with her. So she's kind of like, if I liken it, she would be like our mother and we're the bad children. We've had Mr. Abimasol even say, well, I'm going to tell Miss Beatty on you, or I'm going to tell Miss Beatty. We're all grown. We're all business people. We don't need to be micromanaged by this small group that is making decisions for us. We, even with the past BVC, before Mr. Stevenson was on the BVC, they never told us anything about what's going on with the program. It was almost as if we were non-existent. And the way it's supposed to go, they're supposed to gather information from the vendors at large, the larger number of the BVC, and they're supposed to take those issues to the agency. They're supposed to work them out. That does not happen.
Yeah.
They make decisions within themselves without us. So that's all I got to say. Mr. Henderson is to my left here.
Thank you.
To my right. Thank you, Jerome.
Hi, my name is Marquette Henderson. I've been in the program for about 4 years now. I came in, it was about November of 19. And then maybe a month or two later, COVID hit. I was forced to close down my location because I have COPD and a few other things, but I was advised to close down. So I stayed closed for about a year, I believe it was a year. Well, when I reopened, I was told by Mr. Ambasola to, you know, he chose who I associate with. He told me that if I dealt with, you know, because I was having a hard time, because in the building that I was in, which was Judiciary Square, and everybody in the building was basically working remotely from home. So it was, I would say it was like 1% of the building population that came in there on a daily basis. And so therefore my cross-the-counter sales would, if I made 200 a day, I was doing good. So paying my employee and buying inventory was, I had to really, try really hard to accomplish both of those things. Well, Mr. Ambasola called himself helping me, and he told me that the way he would help me, that as long as I didn't mess or talk to, as he called it, as long as I didn't talk to certain vendors that he felt that were trouble-making vendors. And these vendors that he called troublesome were vendors that basically complained about the conditions. So if you complained, you were a troublemaker. And he told me if I didn't deal with those vendors and I dealt with the vendors he told me to deal with, that he would look out for me. At the end of the year, when there's a surplus, he would make sure I get some of the surplus. That if I needed some additional money during the month, that he would try to see to it that I get some. So the people that he told me not to mess with, not to talk to, were the people that I recognized were the good-hearted people that cared about the program, that weren't trying to benefit like some people do who have the best stores, who may have 3, 4, 5 different locations. You know, the people he told me not to deal with was the people that had the worst locations. So naturally, those people and myself got along, had a lot to talk about, had a lot of changes that we would try to make. So of course, he found out that I was dealing with those individuals, and he put a cross on my back. And my location, my employee quit because of the problems with the homeless, because that particular location, you didn't have a police, a guard station. People can just walk in on the street and didn't have to go through no metal detectors or nothing like that. So they used to abuse some of the homeless, abuse verbally some of my employees, and I had to lose employees here and there. So I lost an employee, and I had, I'm getting ahead of myself. I had a third-party vendor that was supposed to pay me commission every month because he had 3 restaurants in my immediate area. And he paid me a certain amount of money, probably about $1,800 a month in commissions for, you know, like 500 per location. Well, COVID happened. He stopped paying. So I told Mr. Ambersola that this person isn't paying me my commissions any longer. And you guys aren't saying anything about it. It's just okay.
Yeah.
And everybody else is getting their commissions but me. So he told me that was above his pay grade, that he was going to give it to the legal team. And when I mentioned it again, he would hang up the phone on me and tell me, look, I done told you that this is beyond my pay grade, and we done talked about it. I done told you what I was going to do, and we're not going to talk about it any further. And if you continue to talk about it, I'm going to end this conversation. And he would hang up the phone on me because, of course, I'm going to call him back and we're going to continue this conversation. And where is the legal team that's supposed to be representing me? Well, it's been 4 years. I have heard nothing from legal. And this third-party vendor wind up owing me about $50,000. I never got anything from him again. So when my location is basically starving, I'm not making any cross account of sales. My employee quit. I have to try to hire someone. So I called my cousin, which was the chief of police at the time, because I couldn't get anything through to them. So I called Chief Conti, and I had him to call Mr. Reese, and tell him I'm having
good.
problems with this monitor. He's talking to me any kind of way. He's not helping me. And I have problems with my location and I need to talk to someone. And this guy isn't available to me. He's hanging up on me. And so he talked to Andy Reese. Mr. Reese talked to Mr. Evans. Mr. Evans called me and asked me what was my problem. I told him I was having problem with Mr. Ambersola, and he basically isn't giving me the consideration that I feel I need. I need help in my location. I'm drowning and nobody is throwing me a lifeline.
Yeah.
So
Thank you.
they told me that if I had any further problems, to give them a call. I gave them a call and left them a message. They didn't offer me whether I could communicate through Braille or large print or audio, but excuse me.
So wrap it up.
Okay. So any case, they put me in corrective actions because they said I closed my location down without leaving them any communications, which I did. And because I didn't leave an email, they took my location. They basically took about $10,000 from me, and I haven't been able to catch up yet.
Yeah.
They wouldn't allow me to get into what they have, which is a payment plan where you could pay back every month until you've paid up. Nope, they made me go into my savings and give up everything that okay.
Thank you.
I've been going on longer
Yeah,
than I anticipated.
it's okay.
So
I
sorry.
appreciate it. Thank you so much. Thank you. Thank
Had a
you.
lot to say.
I understand. Thank you so much to this entire panel.
Mhm.
We will have some follow-up questions to the agency and follow up with you all as necessary. Thank you so much.
Thank you.
Thank you.
All right, next we have Ian, I'm so sorry. Ian Paragol, Executive Director, DC Coalition of Disability Service Providers. Robin Shafford, thank you. Senior Policy Associate and Research Instructor, Georgetown University Center for Excellence in Developmental Disabilities. Sandy Bernstein. I'm gonna get these all wrong. And Sandy, I actually knew Bernstein, but I got it wrong last time and then same this time. I'm gonna work it out. Legal Disability Rights DC at University Legal Services. Chloe Peoples, Staff Attorney, Disability Rights DC at University Legal Services. Yeah, that's fine. It doesn't matter which go. I'm going to start with you, Ian. So, yeah.
Ready?
All right. Thank you. Good afternoon, Ian. Thank you for being here. You can begin your testimony.
Well, good afternoon, Madam Chairperson. My name is Ian Paragol, and I serve as the Executive Director of the DC Coalition of Disability Service Providers. The coalition currently represents over 50 provider agencies supporting over 2,300 persons with intellectual and developmental disabilities and employing over 4,700 staff. Member organizations provide residential, day, employment, in-home, and other home and community-based services, as well as intermediate care facility or ICF supports for residents of the district. On behalf of the provider agencies and those whom we support, we want to recognize the leadership of DDS Director Andy Reese. In addition to a series of online monthly updates, Director Reese has made himself and the DDS leadership team available to the provider community for focused bi-monthly discussions that have resulted in many valuable consensus-driven changes and clarifications. The provider community is welcomed and well represented at DDS person-centered strategic initiatives during policy change discussions and has a role in dialogues designed to improve outcomes for persons supported in the district. We also want to commend Director Reese's Chief of Staff, Jared Morse, for his candor and problem-solving ability. We congratulate Director Reese and his team in helping service providers weather the storms of the last 3 years as we reach our shared objective of enhancing the lives of DC residents who receive DDS supports. And to that end, we have 2 recommendations directly related to improving the lives of persons whom our provider communities are privileged to support as they relate to the upcoming FY25 budget. As we approach discussions around the budget, we want to note that the FY24 budgets did not include any adjustment for the escalating rental costs, as mentioned by Ms. Grigsby, or general food, transportation, or costs of living within the district. We want to take this opportunity to advocate for an increase in the rental stipend allocated to persons receiving supports to include the excluded FY24 increase, as well as an appropriate rental uptick for FY25. Persons who receive residential supports through DDS and the Medicaid waiver require housing. As of February 2024, the average rental price for a 1-bedroom apartment was $2,224 a month, and the average rent for a 2-bedroom was $2,985 a month in the district. As part of the Medicaid waiver funding, persons receiving rental support have a rental cap of $1,799 per month for a 1-bedroom and $2,132 for a 2-bedroom. That's about 20% below the median for 1-bedroom and almost 30% below the median for a 2-bedroom. And operationally, it's important to recognize that DDS actually prefers to utilize 2-bedroom units versus a 1-bedroom unit for persons receiving residential supports. Present levels of funding for rent, which might be adequate within the lowest cost areas of the rental market, are typically not in areas that the community, not in areas of the community that provide persons supported with adequate community resources. And to answer your question that you had asked Ms. Grigsby, this has resulted in many persons who are receiving reports relocating to less expensive units in Maryland, pushing them away from the district and disconnecting them from the DC community, or it results in forced clustering of persons with disabilities within economically disadvantaged communities that do not have the necessary resources so they can thrive. As a result, we ask for the council's support in raising the rental caps for 25 as part of the DDS budget, while not shifting resources from any other community supports. Similarly, funding for the expenses of living in the district needs to be addressed. Presently, persons supported through DDS receive a monthly allocation of $395 per month through what is known as the Human Care Agreement, which must cover all groceries. When it comes to basic necessities such as food, clothing, and groceries, costs in the district are about 18% more than the rest of the country. There's much discussion in the district about economic security and equality for those residing in the district. The lack of adequate funding for basic necessities such as fresh fruit, food, cleaning supplies, or even clothing on the district's district's Human Care Agreement funding caps for persons supported adversely affects and adversely impacts the ability of persons in need of services to gain equal footing or even the most basic of outcomes. When we combine this and the substandard allocation for rent, it should signal to our leaders that there's an inherent inequity that does exist for persons receiving supports. So the coalition urges the district to do a better job and include adequate funding for rent, food, housing items, so they can have the person support can have a better chance at success. Notably, the coalition will address staff vacancy concerns, unsustainable turnover and overtime, and wage compression at the 25 budget hearings. So you'll see me again on that. So on behalf of the DC coalition, I thank you for your time and welcome any questions.
Thank you, Robin.
Thank you. I'm Robin Shafford. I'm a middle-aged white woman with short, thick silver hair, wearing a red wine colored dress and rimless glasses. And on behalf of the Georgetown University Center for Excellence in Developmental Disabilities, thank you, Chairperson Louis George, for the opportunity to testify today. The Georgetown UCID is a federally mandated and funded program of the Administration for Community Living of the U.S. Department of Health and Human Services. My testimony today focuses on advancing disability employment, implementing participant-directed services, and strengthening the direct care workforce. DC has been an employment first state since 2012. Competitive integrated employment is the first and overwhelmingly preferred option for working age youth and adults with disabilities, regardless of their disability. Integrated competitive employment calls for the end of segregated workplaces, segregated work groups, and substandard compensation. According to U.S. Department of Labor estimates, the employment to population ratio of adults without disabilities in DC is 78%, while the rate for adults with disabilities is 35%. Yet the rate for non-Hispanic whites and Asians with disabilities is 65%. For non-Hispanic Blacks with disabilities is 26%. And for Hispanics with disabilities is 51%. DC's efforts to close the gap between the employment rate of people with and without disabilities must emphasize eliminating these racial and ethnic disparities. The Georgetown USA supports DDS's efforts through both the Rehabilitation Services Administration and the Developmental Disabilities Administration to increase meaningful employment opportunities for DC residents with disabilities. With technical assistance grants from the U.S. Department of Labor's Office of Disability Employment Policy, DDS is working with partners across the DC government to make the district a model employer for people with disabilities. The Georgetown USA welcomes and supports these efforts. But more must be done. To prepare DC youth with disabilities for adult life, the public education system must address the significant deficits in special education in DC. And DDS must do its part to ensure that every eligible student with disabilities has meaningful post-secondary education and employment opportunities. It is critical that every eligible student receive pre-employment transition services focused on meaningful post-secondary outcomes. In an attachment to the pre-hearing questions, DDS has provided data concerning the number of eligible students who receive pre-employment services. The numbers vary among high schools considerably, but it's clear that a systemic problem exists. While we understand that the challenges in providing these services to all eligible students are complex, it's time now for RSA to take the lead and coordinate with DC public schools and public charter schools to develop and implement a comprehensive plan to ensure that all eligible students receive these critical services. Data also show that participation in inclusive post-secondary education programs enhances employment outcomes for youth and young adults with intellectual disabilities. Today, there are over 300 of these inclusive programs at colleges and universities across the U.S. DC stands alone with Wyoming as having no post-secondary education program for students with intellectual disabilities. The Georgetown USA hosted a panel of experts earlier this month to reignite the efforts to create IPSI opportunities in DC. And the Georgetown USA thanks DDS for its past efforts in this regard and current support for IPSI programs. Leveraging funding from RSA will be a critical element in providing equitable access to IPSI programs to all DC residents with intellectual disabilities. Availability of participant-directed services is a critical element of a 21st century system of long-term supports and services. They promote self-determination and have the potential to mitigate the direct support workforce crisis, as well as to support inclusive post-secondary education programs. Through Services My Way, participant-directed services have long been available under DC's Elderly and Persons with Physical Disabilities Medicaid waiver, which is administered by the Department of Aging and Community Living. Last year, DDS began to offer participant-directed services under the Individual and Family Support waiver, yet the pre-hearing responses report that none of the 8 people seeking to direct their own services has yet started receiving participant-directed services. Effective implementation of this option in the IFS waiver should be a priority, and the Georgetown USA urges DDS to also implement the option for participant-directed services under the intellectual and developmental disability waivers. Even with the recent wage increases, vacancy rates for direct support professionals remain above 20%. DC's community-based system of long-term supports and services relies on a robust, high-quality, well-trained, and stable direct care workforce. Providers report significant difficulty in recruiting and retaining not only direct support professionals, but also nurses, managers, and supervisors. DDS should lead efforts to create appropriate training and advancement opportunities for direct support workers, and reimbursement rates must enable providers to hire and retain skilled workers in all of these job categories. And we also look forward to hearing more from this from Mr. Paragall at the budget hearing. Thank you for the opportunity to testify today, and I would be happy to answer any questions.
Sandy.
Sure. Good afternoon, Councilmember Louis George and members of the Committee on Facilities and Family Services. My name is Sandy Bernstein, and I'm the Legal Director at Disability Rights DC at University Legal Services. I'm a middle-aged white woman with brown hair and glasses, wearing a black shirt and a beige and white blazer. Disability Rights DC is the federally mandated protection advocacy program for people with disabilities in the district. As the protection advocacy program, DRDC has represented hundreds of individuals supported by DDA and RSA, and it has assisted even more through our systemic advocacy and investigations. My testimony today will focus on DDA. I do want to start by expressing my appreciation for the monthly community forums DDS provides to people with disabilities, family members, providers, and other stakeholders. These monthly forums provide critical information to the community about different issues, including changes in services, new resources and initiatives, services available, and rights protections for people supported by both DDA and RSA. I'm a member of the planning committee for those forums, along with other stakeholders, and know that DDS strives to provide useful educational information through this outreach. For the past several years, DRDC has testified regarding our concerns about how long it takes before someone found eligible for DDA services actually receives those services. DDS's responses to the council's oversight questions reveal that in fiscal year 23, it took an average of 126 days, more than 4 months from the date of eligibility until the person received their first service. While DRDC is glad to see this delay as a decrease from the previous fiscal year, it is still too long. And this time is in addition to the time people spend waiting for an eligibility determination, which in the same fiscal year was an average of 62 days. These delays have real consequences for the people DDA is charged with supporting. DRDC represents many individuals who have waited months and months after an eligibility determination until they receive services. It is typical for people to wait several months simply for their waiver services to be approved. For example, we are currently representing a man in his late 20s with an intellectual and developmental disability who was found eligible within DDA's required 45-day timeline. However, he did not have his ISP meeting, that's his planning meeting, until a month after he was found eligible, and his Medicaid waiver packet was not even submitted until a month and a half after that meeting. As of the date of this hearing, his waiver services have still not been approved. He is still not receiving from DDA the in-home supports and day services he requires for his serious health and safety needs, despite the fact that he was found eligible for DDA service at the end of October 2023. This is unacceptable. DDA also needs to improve and streamline their intake and eligibility process. Currently, DDA schedules 2 different meetings with 2 different staff where a lot of the same information is gathered. When individuals submit all of the necessary information, there is no reason for this process to take longer than a few weeks. This year, my office assisted an individual apply for services who had previously been found eligible for DDA services. Despite his previous eligibility determination, DDA required him to apply again and prove that he still has an intellectual disability. DDS took 2 months to find him eligible. Sadly, he died a month after his eligibility determination before he received any services. DDA thanks the mayor, the council, and DDS for including in the fiscal year 24 budget an increase in the personal needs allowance that people supported by DDA receive in residential placements. The personal needs allowance was raised to $100 in 2007. I remember that well, and it had not been increased, so the district took action to raise it to $150 in October. The district also indicated that in January 2024, people supported by DDA in the residential placements would receive a percentage of the COLA from their Social Security benefits. However, people have not received any percentage of the COLA thus far in 2024. We ask that the council address this issue with DDS. In addition, as you've heard from Ian Paragall, DRDC is also concerned about increasing the rental cap for individuals living in waiver homes. DDS's current rental cap for people supported is too low and not realistic considering the high cost of housing in the district, making finding accessible and safe housing very difficult in DC and forcing some people and providers into the Maryland suburbs. DRDC hopes the upcoming fiscal year 24 budget includes an increase in the rental cap. DRDC again requests that DDS and the Department of Healthcare Finance provide people with intellectual and developmental disabilities the option of participant-directed services through the IDD waiver and not only the IFS waiver. PDS allows people with disabilities to hire their own staff and direct their own services and supports. This option should be available not only to the 28 people enrolled in the IFS waiver, but also to the 1,866 people in the IDD waiver. We are also concerned that DDS has referred 8 people for PDS in fiscal year 23 and fiscal year 24 to date, but not one of them has received those services yet. We asked DDS to ask what is causing this delay. Not only is PDS a way to provide people with disabilities more control and autonomy over their services and lives, it also can help address the staffing shortage that currently exists with DSPs. Thank you for this opportunity to provide this testimony.
Thank you. Chloe?
Good afternoon, Chairperson Lewis George. Thank you for the opportunity to provide testimony today. My name is Chloe Peoples. I'm a staff attorney at Disability Rights DC. I'm a white woman with blonde hair pulled back into a ponytail, wearing a maroon shirt with a black suit jacket. I am part of DRDC's Client Assistance Program, a federally designated program that provides free legal representation to individuals who are seeking services from the district's Rehabilitation Services Administration. Today, I'd like to bring a few issues to the council's attention. First, we have received complaints that RSA focuses on the achievement of entry-level employment goals instead of focusing on maximizing vocational potential. This is not in compliance with the Workforce and Innovation Opportunity Act of 2014, WIOA, which specifically emphasizes that state vocational rehabilitation agencies must assist individuals with disabilities to achieve their maximum vocational potential and not only focus on entry-level employment. Confusion within RSA may stem from a reference to entry-level employment and RSA's procedure on post-secondary education cited in my written testimony. This RSA procedure is not in compliance with WIOA and has resulted in people with disabilities not advancing in their employment based on lack of support. RSA's failure to comply with WIOA's requirements must be addressed through additional training within RSA and changes in RSA's policies and procedures. Second, we are concerned that a high percentage of students with disabilities are not receiving key pre-employment transition services, pre-ETS, from RSA. According to numbers provided by RSA and their attachment response to questions 126 and 127, and putting those numbers into an Excel spreadsheet created by myself, you see that only 34% of potentially eligible students with disabilities received pre-ETS in fiscal year 23, meaning that approximately 66% of potentially eligible students with disabilities did not. We have heard that some RSA transition counselors are only physically present at their assigned schools once per semester. The ability of transition counselors to be present at their assigned schools may relate to caseload size, which is over double the average caseload size as other units. We are concerned that students with disabilities are missing out on key pre-employment transition services. Third, we continue to receive calls about delays in receiving RSA decisions or hearing from RSA counselors. Many complaints stem from RSA's decision-making process for post-secondary education funding, which requires students to submit many documents, some of which students don't have until the start of the semester, before RSA will agree to provide any education funding. Clients have also reported receiving oral denials of funding from RSA, but then waiting 3 to 4 months to receive a written decision letter that includes their appeal rights. RSA must establish an official process for requesting final written appealable decisions. RSA should be required to inform individuals during their initial meeting with RSA of their right to request such decisions, and RSA should be required to respond to requests for final decisions within a specific time frame. Failure to timely issue a decision must have real consequences for RSA. Thank you again for this opportunity to submit testimony on these important issues.
Thank you so much for your testimony. And I'll be asking DDS about the rental cap later on. I'm trying to get an idea of how much money we need to find for this. I know it's not your job to come up with this number, but do you have a sort of a best estimate on how much raising the cap would cost?
Actually, I don't. I just know that,
Yeah.
you know, the present number is about 1,800, and even to get to the median, I mean, and we really should be talking about, quite frankly, the 2132, because
Mhm.
the 2-bedroom is the norm, right?
Yeah.
So, and the preferred. So if that's the rate and presently they're 29 and change, we're talking maybe 800 per unit per month.
makes sense.
So, I mean, I could do the math on the back of an envelope really quickly, but
No.
it's not that substantial, but it will be a local cost.
Cost, that's right.
It will be a local
Local
cost.
cost. Okay. Thank you. I appreciate that. I will be, Robin, I will be asking about DDS about the pre-employment transition services, and the low number of eligible students being reached. That number was very concerning. Can you talk more about the importance of pre-employment transition services? What kind of difference they can make in youth lives? And do you have any recommendation for how RSA can increase participation?
Giving people both an opportunity to explore what they want to do in adult life and then practice doing it and things like an internship are really vital in getting people ready to make the very difficult transition from school to adult life. But on top of that, there are students who want to explore post-secondary options, either on the vocational technical side or on the academic side. And that requires transition services. The district requires the transition process to start in the schools a year before the federal requirement. It's something we've recognized as a public policy matter is very important in DC. So it's really vital that people get these services. I think, we have a lot of high schools, so the counselors have to serve a lot of high schools. There apparently are some issues that DDS has discussed in the past about getting consent from parents for students to participate in this process. That's a public education issue. That is a manageable issue to address. Which is why I talked about a comprehensive plan. So I think there are a lot of factors, but there are clear ways to make improvement in it.
Yeah. What can they like just start doing today? You know what I mean? Like, what are some things that they can be doing in the immediate right now to sort of try to increase participation?
I think one thing to do immediately is to figure out an effective communication with parents about what these services are and why they should be consenting to them.
Yeah.
And, what we heard last year was that there was some issue about sharing social security numbers. If that's an issue, we should make sure that there are adequate protections, that those are not subject to fraud, and that we convey that to parents so that they consent. But we also have to make sure that the RSA counselors are trained. We've heard that from a number of people, to make sure that they're speaking to families in appropriate ways. Just a second on the issue of racial and ethnic disparities. One of the things that other states have found in examining the data around who is serving RSA and how is some biased assumptions about what the outcome should be for different people. What a problem I don't think we have in DC. We haven't analyzed the data, but in some states, RSA is serving fewer people from historically disadvantaged groups. I don't think, my guess is that isn't true in DC, but who is being led to which outcomes? I think we should really take a look at both for youth transition and in the broader vocational rehabilitation to see if that's a place where there's bias which we could eradicate.
Yeah. Sandy, I'm going to be asking DDS about the P&A cost of living adjustment, and why it's taking so long to connect people with services after the agency's determination of eligibility. I agree the delays are unacceptable. What do you think the reason for the delays are? Is it, it's two meetings with two people, but is it understaffing? Are there procedural changes that would be helpful in speeding up receipt of services?
I believe so. For the intake process, there are, some different things that happen at those different meetings. I see no reason why they can't have one meeting. They should have one meeting because it takes time, right, to organize all these people coming to the meeting and picking a time that works. If you had one meeting and then you gathered all of the information from one staff, or if you have two DDS staff attend and do that, then you're moving it along much quicker. I also do believe that they need to change their eligibility policy, especially for people who were found eligible for services. The client that I referred to, the only thing that happened before his first eligibility determination when he applied is that he was incarcerated. He didn't lose his intellectual disability. His skills did not improve in prison. And everybody knows that. And so there should have been no reason for that. If you had a process where someone could be streamlined and just have to prove that they're a current DC resident, which I think that is reasonable. And when it comes down to the services, I think there is a bureaucracy problem with getting the waiver services applied. I don't know if it's a DDS or a DHCF or a combination of the both. I do know that at times they have immediately moved to place somebody when we had someone in an absolute emergency situation. And when that happens, waiver services have been approved rather quickly, sometimes in only a couple of weeks, which makes me think that when they're in services and they're not getting funding for it, there is a process that is expedited. And so it can be done. I don't know if it's a staffing issue. I'd love to hear from DDS about what they think the problem is. All I know is it's very consistent. And if that is happening to people where we are involved, these are people who have lawyers who are helping them.
That's right.
You know, what is happening to the people who don't have an advocate? It's just unacceptable. People should not be applying and then getting services 6 months later. That's just not a system that is working for the people it's supposed to support.
Yeah, and DDS pre-hearing responses, we asked, how is RSA addressing sort of persistent turnover in staffing to ensure consistency and continuity of operations across its operations? DDS said, DDS RSA does not have a systemic turnover problem. Chloe, do you agree? And what is your assessment of RSA staffing levels?
So I did see that response as well. I can't speak necessarily to their staffing levels over many years. I'm new to the organization this year. But I do know from looking at the numbers in the caseloads that transition counselors in particular have extremely high caseloads of pre-ECS and general vocational rehabilitation, over double that in the other VR units. So I think that's a problem that leads to low pre-ETS numbers, is just not having enough transition counselors in general.
Yeah, that was my question. What are the outcomes as a result? What are you seeing as the outcomes as a result of that?
Yeah, I think that directly leads to the low numbers of pre-employment transition services being provided to kids with disabilities.
Yeah. I don't want to spend too much time asking questions because I want to get to asking DDS about the questions you raised, but I want to thank you all for your thorough testimony and your services to people with disabilities. But just know that many of the strides that have been made with personal needs allowance and so much more would not have been done without you and your organization's advocacy over the years. So please keep that up and remember that you've been moving the needle and we will continue to move this needle. So thank you.
Thank you.
Thank you. Our last panel will be Shawnee Jones, Anjanette Shelby, Doreen Blue, and Jimmy Lethbridge. Shawnee, I see you are online, so you can come on camera and come off mute, and you can begin your testimony.
Councilmember, can you hear me?
Yes.
Okay, great. Good afternoon. I'm Shawnee Jones, and I'm loving and raising an individual with autism. Accessing DDS services has been challenging. There is confusion as to which waiver an individual is receiving, which makes it difficult for families to access services. The complaint process is atrocious. The lack of a tracking system to track the complaints extends this process. The client has to constantly ask for updates, in which a reply can take days or weeks. In my daily role, I also advocate on behalf of other families. I have filed a complaint with the client's permission in July of 2023. The complaint was not processed for an entire month while Ms. Alice Agunhonda went on vacation. Although DDS did apologize, during the review of this complaint, they discovered that the complaint went to the wrong email address, although it was filed online through DDS formal complaint system. The apology was accepted. However, the client was out services through this time. Requesting retroactive services has also created a huge concern. When there is a delay in approval of services and DDS admits that they caused the delay, clients and families still end up waiting, sometimes for months, for the approval of the retroactive request. Again, without a tracking system in place, this extends the processing time. In my experience, the bulk of the issues within DDS stems from the lack of implementation of the policies. The DC Municipal Regulations and Register, or DCMR. The culture of DDS is an internal decision environment. When families have concerns or questions about services, approvals, and/or denials, most replies to families are simply, "My supervisor said this." When families need written instructions or explanations for comprehension, most service coordinators, when they are questioned a bit more as to where families can access this information in writing, families are again directed to the supervisor. I myself have had to mention various policies and transmittals to service coordinators and supervisors to ensure that they are being implemented. Here are a few solutions. DDS should create a portal that will allow for tracking from the initiation of intake. This portal should allow access for families to track and request services. The current encrypted email system that DDS utilizes, it erases every 30 days. This is not beneficial for families. There should be ongoing training for DDS staff of the DCMR. This is the blueprint for services. DDS should also inform families of where to find such services within the DCMR, especially for the written denials of services. Thank you for your time and consideration, and I'm available for any questions you may have.
Thank you. Next, we'll have Anjanette Shelby. Cut the red button. Press the button. There you go. The red, oh, yeah, yeah, that's good.
Good afternoon, Chairperson Lewis and other members of the committee. My name is Angie Shelby. I am the Chair of the DD Council and Vice Chair of Commission on Persons with Disabilities. I am testifying on behalf of the DD Council and about the Department of Disability Services. I am a Ward 6 voter, an advocate for people with disabilities, and I have received service from RSA for many years. The DD Council role is to amplify the voice of people with developmental disabilities and their families, support greater independence, inclusion, empowerment, and the purpose of life.
Can you move your, the microphone closer to you just a little bit? Yeah, thank you. You're good.
We partner closely with DDS on several initiatives and enjoy a positive working relationship in our programs and advocacy. Our written testimony includes additional information and details about, for the sake of time, I will focus my spoken testimony on these points. Building and maintenance a high quality and effective direct care workforce, increasing resources for undocumented persons with disabilities, creating a Medicaid buy-in program. 4, eliminating racial disparities in employment outcomes of people with disabilities. DC continues to struggle with a direct care workforce crisis. Direct care workers are essential to enhancing the quality of life, promoting independence, and ensuring safety for people with disabilities and their families. DDS must work closely with DHCF to identify more solutions. Later this year, we will co-host the 6th annual Latino Conference on Disabilities with DDS and other DC government and community organizations. We aim to provide information and resources about disability service and support in Spanish, and we also found a lack of resources for undocumented people with disabilities. The number of undocumented residents in DC continues to increase, and we urgently need a plan to support them. Currently, 46 states have a Medicaid buy-in program, and we want to see DC added to the list. A Medicaid buy-in program would enable people with disabilities who rely on Medicaid for essential health care services to earn income without worrying about losing their health care. We know that the fear of losing benefits like Medicaid is a barrier for many people with disabilities to seek employment. With Medicaid buy-in, people with disabilities would not need to choose between employment and health care. Department of Labor data from December 2022 shows significant racial disparities in employment to population ratio among people with disabilities in DC. The employment to population ratio for individuals with disability broke down by race was 65% for white residents, 51% for Hispanic residents, and only 26% for Black residents. Strategies to increase employment opportunities for DC residents with disability must employ the outlined faces of the disparities and work to change it. Finally, we echo calls from the advocates for a cost of living adjustment for the person's needs allowance, support of the state as a model employee initiative, and prioritize implementing participation direct service in both Medicaid waivers administration by DDA. We appreciate the opportunity to testify today, and I would look forward to answering any questions you may have.
Thank you so much for your service and for your testimony. Next, we will have Doreen Blue, Director of Family Voices of the District of Columbia, Inc. All right, Jimmy Lethbridge.
Good afternoon, Chairwoman Lewis George. My name is Jimmy Lethbridge. I'm the Deputy Director of Programs for Quality Trust. Thank you for the opportunity to testify today. I'm a middle-aged white man wearing a blue sweater. DDS is at the center of a complex system, including multiple government agencies, private providers, attorneys, advocates, families, but most importantly, people with intellectual and developmental disabilities. Since we began our work over 20 years ago, the district has developed a rational and cohesive system that supports people with developmental disabilities. Despite the challenges of COVID-19 and new mandates created at the federal level, we've seen improvements to DDS's incident management and service coordination units. The quality of incident investigations has increased, and investigations are completed timely. Service coordinators are more impactful in their advocacy as well. And DDS collects significant amounts of data to inform system improvement. However, as we've learned through our participation in the Creating a Culture of Quality initiative, sorting, eliminating duplication, and streamlining that data so that it actually powers improvement in the day-to-day lives of people in the system has proved elusive. Multiple factors are coming together which will change how services and supports are structured and used by people supported by DDS in the decades to come. With implementation of the DDRA, we thought we would see a bigger increase in people entering the system. We also thought we might see an increase in enrollment into the IFS waiver, as well as the use of self-directed services within that waiver. We did not see those changes. And according to DDS, significant vacancies remain in both waivers. DDS also noted that over the past 2 years, there's been an increase of 120 people entering the system. While we still expect significant change in the years to come, we did not see it the past year. In 2014, CMS proposed the new settings rule. It was to begin in all states by 2020. The date was pushed back to 2023 because of the pandemic. The setting rule was an effort by CMS to push states to move away from large congregate day and residential models. States were challenged to develop structural changes that would ensure people would gain more autonomy and opportunities for real community inclusion in the HCBS waiver. What we found in our work last year was that there was little change in the day-to-day lives of many of the people we met. That's because the choice of where and with whom people live continues to be rooted in the practice of filling vacancies, which limits options to what is available in the give and take between DDS and providers through their contracting negotiations. We did encounter people who had their own room, but not a key they controlled to ensure privacy. Likewise, people had the use of their own debit card, but not the autonomy to control how and when they used it. Finally, most of the people that we met who receive supported living have lease agreements with their provider relating to the apartments in which they live, a key element of the district's approved plan to implement the settings rule. But the provider continues to maintain control over the lease with the management company. For so many people who've never exercised true autonomy, this reality goes unheralded. They simply go about their day-to-day lives in the manner they always have. Some people, especially those who've entered the system in the past few years, however, exercise their choice by coming and going from their homes on a schedule and for reasons of their own preference, rather than that of providers, guardians, and government officials. The challenging work of giving people methods to create the wealth and true autonomy necessary to control their own lives is still years away, because to give people more power and autonomy, the government and providers must retain less. That change will be slow and it will be difficult. For 20 years, QT has remained steadfast in our belief in the inherent dignity of everybody we meet. Since 2001, we have stood beside people with disabilities. As the nature and structure of community living changes, we'll continue to stand with people as they aspire to live their best life. Thank you very much for the opportunity to testify, and I'll be happy to answer any questions.
Thank you for your testimony. Shawnee, I'm sorry to hear about your experience with the complaint process and changes to companion services. How would you like to see DDS handle companion services and changes to services in general directly? Can you talk about sort of the lack of functioning complaint, how the lack of functioning complaint process impacted your family services?
Sure. There was a lot of confusion around the implementation of the wind down program. I received over 20 calls from families just confused. They weren't aware of the actual exceptions to the wind down program. A lot of the service coordinators did not inform families of the exclusions. It was a mess, honestly. Companion is being weaned out. Okay, we're not really getting answers as to why. What we do know is that all individuals receiving companion are eligible for IDS, which is the individual day services, which is the alternative that has been pushed during the wind down program. And the answers that we're receiving is that since the pandemic ended, that now this is what we have. I think companions should stay in place, especially for families where IDS is not the most appropriate environment for the individual. I myself, I was encouraged to switch to IDS, which we did. But for me and my son, it's working. But it's working because I am heavily involved in the process. There are a lot of families that either don't have the knowledge or the time to do what I do the way I do. But again, I cannot stress this tracking system.
Yeah.
My transition from companion services to IDS took 3 months. It was supposed to take, give or take, 30 days. And right now, while I'm speaking to you, we still have not figured out what the issue was. And those retroactive services that I spoke about, I'm in that branch. So I've been requesting retroactive services since November. We're in February, and I'm just waiting. This is a waiting game, honestly. And you've heard from witnesses where individuals have died waiting for services. This is all we have left. There's not another transition system or agency. This is it. And I am scared, for lack of words, like I am scared that this is what my child has left. So this is pushing me to actually try to create and think outside the box for something else, for housing and for services for my son. And I'm not young. Time is not on my side, but I don't think that as a parent, I can leave this earth knowing the way that DDS is set up, that it will actually do what the policies say. I'm not certain of that. I'm not.
Understood.
Thank you.
you.
You're welcome.
Thank you. And thank you for the work you've been doing to helping other families with this as well. And Jeanette, thank you for your testimony. We have all three of district's main disability agencies in the room with us today. What would you like to see them do more to address racial disparities in employment of people with disabilities?
Well, on the unemployment part,
Oh, speak to the mic.
on the unemployment part, I would like to see them giving more priority to people with disabilities, especially those of us who are seniors, because the senior population is living longer, and we want to work. We don't want to sit around being lazy or just waiting to die. And I would have to get back to you on the racial part.
Gotcha. Understood. Thank you. Mr. Lethbridge, thank you for your testimony. You mentioned the significant underutilization of the IFS waiver. I'll be asking DDS about this later. Can you talk about why it's important that we are utilizing as many of these waivers as possible? Basically, what is the district losing out on by not taking advantage of all waivers available?
Well, I think in the case, historically, the district was not utilizing the waiver program in the way that it could be. And that was a huge problem, mostly because it was paying for those services with local dollars. But we're not in that reality now. What I see is where we need to be going. And what I was trying to allude to when I said that there are many factors that are playing into how things will be different when we go forward, is that the IFS waiver is a small waiver, and I'm not clear as to why we're not utilizing it 100%. I mean, I believe the district said there were 90 plus vacancies in, I think in those pre-hearing questions, maybe it was both waivers. So, I mean, I don't want to say bureaucratic reasons, but I don't understand why you wouldn't be at nearly 100% capacity in both waivers. I do think that the IFS waiver, it's a capped waiver. There's a $75,000 a year limit. So the needs profile for the person who's going to use that service, by definition is different. It's not a 24-hour-a-day, 7-day week thing. But also, as other people have alluded to, using self-directed services, since they're only available in that waiver. I would have hoped that we would have seen at least a small increase, but I would hope going forward, we'd see a dramatic increase in the use of self-directed services in that waiver. And as Ms. Bernstein said, in the larger waiver, because of the reasons that, amongst others, that she said, which is just people want to control their own services to the greatest extent possible. And with so many providers telling you that they can't staff up at the levels they need to, this is a way to get around that. People own their own services and rely less on the provider-driven model, which I think is where services will be in 10 years. There's no holding this back at this point. So I'm going to be interested at what Mr. Reese has to say on that issue.
Yeah, same. Thank you so much to this panel of witnesses and to all of our public witnesses for DDS. Please, reminder, if you haven't submitted your testimony in writing, to please do so to the council facilities at dccouncil.gov. We will now hear from our Director of Department of Disability Services, Andrew Reese. After a brief 5-minute break, we will start sharp at 1:30 p.m. Thank you. Joining us today is Andrew Reese, the Director on the Department on Disability Services. Thank you, Director Reese, for being here today. Before you begin your testimony, I'm going to administer an oath to you and other members of your team who will be testifying today. If you all could just please raise your right hand. Do you swear or affirm under penalty of perjury that the testimony you're about to give to the Committee on Facilities and Family Services is the truth, the whole truth, and nothing but the truth? Thank you. Director, you may begin your testimony.
Thank you very much, and good afternoon, Chairperson Lewis George, staff of the committee. I'm Andrew Reese, the Director of the Department on Disability Services, DDS. The mission of DDS, as you know, is to provide innovative, high-quality services and supports that enable people with disabilities to lead meaningful and productive lives as vital members of their families, schools, workplaces, and communities in every neighborhood in the District of Columbia. On behalf of Mayor Muriel Bowser, I'm pleased to provide testimony today on the accomplishments of DDS in fiscal year 2023 and our work in fiscal year 2024 to date. With me today are Winslow Woodland, on my right, Deputy Director for the Developmental Disabilities Administration, or DDA. On his right, Daryl Evans, the Deputy Director for the Rehabilitation Services Administration, RSA. And on my left, Shasta Brown, the Deputy Director for the Quality Assurance and Performance Management Administration, or QAPMA. The story of 2023 was about working together to meet the challenges of the moment and emerging from an unprecedented global pandemic with new approaches and increased engagement. The federal public health emergency that began nearly 4 years ago on March 11th, 2020, finally came to an end on May 11th, 2023. And the flexibilities of the Appendix K to our intellectual and developmental disabilities, the IDD waiver and the Individual and Family Supports, IFS waivers, expired 6 months later on November 11th, 2023. This 6-month period allowed time for gradual winding down of the public health flexibilities. DDS had been involved in educating stakeholders of these changes for more than a year through its regular community forums, beginning in November 2022 and continuing through the end of October 2023. We provided information at community forums, in individual interdisciplinary team meetings, and at other outreach events to educate providers and the public on the public health emergency unwinding plan that ensured that people supported by DDA would be fully integrated into the community and have a smooth and gradual transition back to community-based day programming. As part of this effort, we also hosted a provider fair on July 19th at the Walter E. Washington Convention Center. The provider fair connected more than 90 community-based organizations and district agencies with approximately 500 attendees and gave people supported and their families the opportunity to learn about day program options and other topics such as the unwinding of the public health flexibilities, participant-directed services, assistive technology solutions, remote supports, and benefits counseling for people interested in pursuing competitive integrated employment. In addition, DDS also made presentations to the Family Support Council and Project Action. We also regularly attend the Project Action monthly meetings. DDS develops programming and policies and procedures in consultation with internal and external stakeholders. During the past year, DDS worked collaboratively with staff at the Interwork Institute at San Diego State University to complete our comprehensive statewide needs assessment, evaluating the rehabilitation and independent living needs of people with disabilities who live in DC. The purpose of this triennial assessment is to provide current and relevant information on the needs of individuals with disabilities in the districts, to inform the development of the vocational rehabilitation portion of the Unified State Workforce Plan and the State Plan for Independent Living. DDS is also one of 12 agencies selected for the city's first racial equity pilot cohort. The pilot program was the result of the Racial Equity Achieves Results, REACH, Emergency Amendment Act, which was passed by the council in 2020. REACH seeks to eliminate socioeconomic inequities experienced by African-American residents and other people of color in the district. As a pilot agency, DDS has drafted a DDS Racial Equity Action Plan, that's REAP, which will be finalized and submitted to the Mayor's Office of Racial Equity later this month. We recognize the need to analyze the demographic makeup of people with disabilities presenting for services to determine which services they're accessing and outcomes, and whether people from varying backgrounds have differences in their patterns of access and their experience of care. Exploratory analyses led us to identify and engage underserved communities to build trust and connect these communities with services that could impact their quality of life in a positive manner. In 2023, DDS hosted the 5th annual Latinx Conference for people with disabilities and their families, with about 85 attendees. This free Spanish language event gave Spanish-speaking residents with disabilities and their family members access to information, support, and resources in their native language, with interpretation available for non-Spanish speakers. In addition to the annual conference, DDS also hosts other Spanish language outreach events throughout the year, offering a hybrid of virtual and in-person options for participation. For example, in March 2023, as part of Developmental Disabilities Awareness Month, we hosted a workshop on stress reduction for caregivers that was attended by approximately 40 attendees. DDS also hosted Spanish language Know Your Rights sessions, a session on parent advocacy, as well as 3 information sessions about DDS services, including a presentation to the Latino commissioners. Additionally, to broaden our connection with the Ethiopian and Eritrean communities, DDS has hosted 2 community resource events to provide Amharic-speaking residents with disabilities and their family members access to information and support and resources in their native language, with approximately 70 attendees. These events were conducted in Amharic with interpretation to English and Tigrinya. In August 2023, DDS, in collaboration with the DD Council and the DC Bridging Aging and Disability Networks and Racial Equity Community of Practice, hosted a future planning lunch and learn series. This 3-part series addressed an overview of disability and aging services in DC, financial options and legal decision-making options to plan for the future. In March 2022, the council passed and Mayor Bowser signed the Developmental Disabilities Eligibility Reform Amendment Act. This legislation allowed DDS to expand eligibility for DDA services to all people with developmental disabilities. Prior to its enactment, eligibility was restricted to people with intellectual disabilities. Following the passage of this law, Mayor Bowser included funds in her budget to increase staffing in DDA's eligibility unit to ensure the agency had the capacity to process potential new applicants. We hired 1 additional community liaison, 2 eligibility service coordinators, and 1 intake supervisor. In 2023, we received 262 applications for DDA services, which was up from 103 applications in 2022. And 91 in 2021. Of the 262 applications received in 2023, 169 were determined eligible for services, and this was up from 82 in FY22 and 52 in FY21. To meet our projected needs under the DD expansion, American Rescue Plan Act, ARPA funds were also used to support the DDA Behavioral Health Initiative. The goal of this initiative is to build system capacity to serve people with intellectual or developmental disabilities who are also diagnosed with a co-occurring behavioral health issue, to manage behaviors and build functional skills that will result in improved management and treatment of behavioral issues for the people served. In October of 2022 and again in July of 2023, DDS completed intensive training in positive behavior supports for staff of DDS and other DC government agencies, as well as the DD service providers. Between March and September of 2023, DDS also worked with the Support Development Associates to offer training on person-centered thinking for dually diagnosed people. Another service enhancement realized in 2023 was an amendment to our IFS waiver implementing participant-directed services through the My Life, My Way program. This program will allow participants to be their own bosses, acting as common law employers to manage their own staff. This means that they will be able to hire someone they trust, like a family member, to help meet their needs, and with the help of a third-party support broker entity, oversee their own budget and manage taxes and payroll. DDS has submitted 9 referrals to the Contracted Fiscal Management Services Agency, GT Independence. As GTI continues to work diligently with DDS to enroll and activate participants into My Life, My Way, we are excited to announce the activation of our first participant this month, with 3 more initial budgets underway. The COVID-19 public health emergency highlighted the negative impact of the digital divide for people with intellectual and developmental disabilities. People had difficulty getting services, were socially isolated, did not have access to technology that could connect them to others, or the know-how to set up and use increasingly vital technologies. DDS recognized the urgency of responding to this critical gap, which impacted every aspect of people's lives. We launched the Technology First initiative, which reflects the heart of DDS's mission to provide innovative, high-quality services that enable people with disabilities to lead meaningful, productive lives. The integration of remote supports and urgent care telehealth services during COVID-19 demonstrated their value, and DDS worked with the Department of Healthcare Finance, DHCF, to develop regulations under the IDD HCBS waiver that would expand remote supports to include new services after the flexibilities of the Appendix K expired. People can now receive virtual services and supports beyond their home into their workplace and the community. Looking ahead, we are launching the DDS Enabling Technology Project, which will accelerate our Technology First initiative by introducing artificial intelligence, a web-based platform designed to automate the matching of individuals with IDD to suitable enabling technologies such as assistive technology and remote supports. DDS will award a contract in FY24 to spearhead this project, focusing on implementation strategy, technology matching, acquisition, delivery, installation, and training. In January of 2023, DDS, along with 15 partner agencies, applied for and were awarded a technical assistance grant through the National Expansion of Employment Opportunities Network program for a state as a model employer, a SAME initiative. This initiative supports Mayor Bowser's priority to have our government workforce reflect the citizens of the District of Columbia by expanding employment for people with disabilities district-wide through modeling best practices in hiring and retention of people with disabilities within government service. Working with nationally recognized subject matter experts, partner district agencies, community partners, and self-advocates, we first completed a landscape assessment reviewing current district policies, programs, and initiatives designed to expand employment for people with disabilities in DC and in DC government, and recommended next steps to build on these initiatives. This information was used to develop a state as a model employer strategic plan to guide the initiative with clear objectives and action steps. Then in November 2023, DDS was awarded another grant of 200 additional hours of technical assistance from the Department of Labor's Office of Disability Employment Policy, ODEP, to focus on 4 strategies to continue the implementation of the district's initiative. In addition to the work supported by the grant, DDS and partner agencies are continuing to work on additional strategies identified as priorities in the strategic plan for FY24 that may fall outside the TA provided by ODEP. Even as we innovate, expand, and conduct outreach, we continue to do the hard, quiet work of hitting our performance marks, delivering services quickly and efficiently. On the RSA side, entry-level wages for people with disabilities who found work in the district averaged $2.81 per hour above the minimum wage in 2023 and are averaging over $4 an hour above the minimum wage in FY24 to date. 80% of high school students aged 16 to 22 received at least one pre-employment transition service during the school year, surpassing our 75% goal. We surpassed our target for the percentage of participants who obtained a recognized post-secondary credential after participating in an education or training program during the program year. The Disability Determination Division continued to have consistently strong performance in 2023, clearing over 20,000 cases. This was 164% of our goal and placed our Disability Determination Division as #1 in the region. The mean processing time for cases was about 145 days in FY23. and 173 days in FY24 to date. These processing times were better than the national mean processing times of 162 and 181 days, respectively. On the DDA side, we are well outpacing our targets on timelines in conducting level of need assessments, completing individual support plans, and closing investigations. The median number of calendar days to complete the ISP was 39 days in FY23 and 43 days in FY24 to date, which is well below the target of 90 days. Our fundamentals are strong because our team is so committed and resilient. I would like to thank every member of our staff. Things like waiver amendments, ARPA initiatives, changes to our internal policies that improve the lives of the people we serve are only realized through the hard work and dedication of members of our team. Our agency is full of people willing to speak up, adapt, and do whatever it takes to fulfill our mission. It is that spirit that drives the positive outcomes that you see throughout our responses in the pre-hearing questions. That spirit is shared by our provider community and the DSPs who bring resolve, grace, and talent to their critical work. Recognizing and retaining DSPs is vital to our mission and the mission of the Bowser administration. That is why DDS has worked with DHCF in implementing another ARPA initiative to provide annual allocations to provider agencies that allow them to increase wages for direct support workers to 117.6% of the living wage. Before I conclude, I would like to thank the public witnesses who testified today. At DDS, we don't do anything in a vacuum. On the DDA side, we've convened an HCBS waiver advisory committee of 15 stakeholders to provide feedback on every policy and procedure that we issue. On the RSA side, we have the State Rehabilitation Council that holds quarterly public meetings regarding the operation of the Rehabilitation Services Administration, and an active employment innovations work group with community partners that meets monthly, and a public hearing process that ensures thoughtful and constructive stakeholder engagement. We're fortunate to benefit from the ongoing guidance of the DD Council, the Family Support Council, and a robust community of self-advocates, family members, legal service providers, and other local and national partners. Performance oversight is a natural extension of these inclusive and deliberative efforts, and we will follow up on all the feedback that we've heard today. Chairperson, I'd also like to thank you and your staff for your dedication to this work. We at DDS do appreciate your hard work and your commitment to these vulnerable district residents. We look forward to continued collaboration with you. Lastly, I want to thank Mayor Bowser. Her dedication to the dignity and independence of people with disabilities will continue to make the district a more equitable and accessible place for all residents. That concludes my testimony. My team and I are happy to answer any of your questions.
Thank you, Director Reese, for your thorough testimony and your service to the district. I want to start with staffing vacancies and go a little bit through there first. According to DDS organizational chart provided in pre-hearing responses, Q8 vocational rehabilitation specialists have a vacancy rate of 15%, I think 7 out of 48. Do you believe that is too high? And what impact does that level of vacancy have on service? And what impact does that level of vacancy have on staff?
So I would say, if you talk about 15% across RSA, that's probably not the best way to look at it. The vacancies, we have sort of two separate divisions within RSA. One is general VR and the other is transition. We have currently, of the 14 transition counselors, there are 2 vacancies, and that creates a pressure. We've seen, because students returned to school in 2021, those caseloads have remained high. Our general VR side is still sort of recovering from the pandemic, and so the caseloads were lower, and the vacancies on the general VR side don't create as much of a problem. I'm happy to report that we have made offers to people for the vacancies in transition. I hope those get positive responses and that we have a full team there, because that can affect service delivery in transition. Across RSA, I wouldn't I wouldn't look at it that way because in our supported
I was-
employment unit.
It's from the chart, so when I.
Oh, no, I understand. I'm just
Yeah,
saying.
yeah, when I looked at the chart, I thought it was, I was just thinking about the VR specialist one where I saw out of 48 people with VR specialists as their title, 7 were vacant, and that was to the org chart, and I thought that appeared to be a high number and could have a negative impact.
So it's a concern in that one section of the chart. The other section, it's not as much of a concern, but we are working to fill all of those positions as
Okay.
we ramp up all of our services again. Prior to the pandemic,
Do
we
you have
had.
any incentives for that sort of
No, we
area?
don't, unfortunately.
Okay.
We, prior to the pandemic, had people in outreach sites across the city. And it has been slow with some of those partners getting back to having our staff share their space. So being fully integrated in the community helps us also to increase our referral numbers in general VR in the same way we've seen them increase in transition. And that's why while we're working hard to fill those vacancies on the general VR side, we're not as concerned about those taking a little bit longer.
Understood. According to the pre-hearing responses, the average caseload of a service coordinator I and a service coordinator 2 are 28 and 30 respectively. DDS says this is consistent with policy and procedure, but that just seems a bit too high to me. Do you know how DDS average caseload and policy compared to other jurisdictions in that respect? And does DDS have a target average or total maximum caseload?
The total maximum caseload for a service coordinator 1 is 30. For a service coordinator 2, it's 35. And I dare say we're probably the envy of other state agencies in the country. That caseload size, and Mr. Woodland might want to speak to that.
I'm sorry, some jurisdictions.
That's crazy.
Our initial, we had a
Oh, shoot. I need y'all to turn your mics
Oh,
on.
sorry.
They just
When
told
we
me.
exited Evans, we evaluated what would be an appropriate caseload across the board. And cases are assigned based on sort of the level of need so that someone isn't overloaded with high need people. But we did have a discussion with our service coordination staff, with our advocates, when we changed that number from 30 to 35.
Got it. I mean, what does DDS do if a service coordinator feels their caseload is too high?
I think they would get support from their supervisor about how to manage those cases. They could also evaluate whether they have particular cases that are higher need cases, but I don't know that we have. I'm looking at you, Mr. Woodland. I don't know that we have had so many people who are saying my caseload is too high.
So over the course of service coordinators' experience, they may have times when they have high stress. You have some cases where a person may destabilize in terms of their behavioral aspects, and that service coordinator may be receiving more calls than normal based on a period in a person's life. So when we have that, we provide this support, and in many cases, we have assessed whether that person should have support or even not receive new cases until they reach a point of stability within their caseload. So
Yeah. I mean, I was just thinking that the caseload was high, and I was thinking that was some of the reasons we were getting some of the public testimony we were seeing. So, because during the testimony, we heard from witnesses who said their service coordinators don't listen to them, instead speak for them. What is your reaction to that testimony?
So with regard to issues within relationships, we do have training on communication. And if a family member calls with that issue, we address it immediately and we try to get to what actually is triggering that. I've had experience where people's relationships that have been stellar for years suddenly change, and usually there's something that causes that. So we don't just initially remove people from cases. When we hear complaints, we try to get to the source of it. I've moved people from service coordinators, and within a month had family members request the previous service coordinator because they had an established relationship, only to learn that it was just a point in time when the relationship had a bit of stress. So
All right. Well, I mean, Director, I think this is just an area, since we're hearing this from multiple people, where we need to look into improving that training. If it's not the caseload, I was thinking it was the caseload in which you said, everyone's saying that's not the issue. So improving the training for those coordinators seem to be it. I want to talk about complaints. We've heard a desire from supported persons and families to have the ability to submit complaints anonymously. In pre-hearing responses, DDS said formal complaints may not be submitted anonymously, but a person may file an anonymous complaint through the customer relations staff orally and in writing. What is this distinction between a formal complaint and a complaint filed through the customer service relations? How are they treated differently?
They're actually not treated differently. I'd say a few things. First of all, the problem with an anonymous complaint is, how do you resolve something if you don't know the specifics of it? I mean, we heard a lot of people today speak about concerns that they have. And of course, we're going to want to follow up with those specific concerns, because you hear the beginning of a story and then you peel back and peel back and peel back to understand it well. You can't understand the whole story. You can't understand the story if you don't know the specific facts. Now, we do have we passed what became the formal complaint system with DDA, which is a complaint system that involves both our provider community, where people can make formal complaints about the services that they get there, or they can make formal complaints about services that they get from DDA only. And those can then, if they're unsatisfied with the resolution of that formal complaint, it can then be escalated to an external person, an external mediator who meets with all the parties, makes a recommendation and forwards that on to me. I can tell you, since we've implemented it, I've had none that weren't successfully resolved through that process. None have been referred to me as a suggested resolution of mediation. I think we've only had one referred outside for mediation. We also have a customer service line. So the customer service line takes all inquiries to the agency, which could be a complaint someone has. It could be a question about receiving services. Those are handled. Actually, our complaints first are referred into the customer service line. When we get a customer service issue addressed to the agency, it is first assigned to the first level supervisor above where the complaint is alleging there's a problem. So that, for example, if a person says, I've complained, I'm having a problem with my service coordinator, I've called their supervisor, they're not calling me back, then that would be assigned to the program manager to follow up, because it's essentially a complaint about the service coordinator and their supervisor. And there's 7 days to resolve those complaints and enter them into our IQ system as resolved. So,
Understood.
so we are tracking those complaints through that system regularly. That's under Ms. Brown.
The main reason we've heard from people wanting the ability to submit complaints anonymously is fear of retaliation, both from the agency itself and from the providers. So I've heard this fear of retaliation from people supported both by DDA and RSA. And to be frank, they don't sound like isolated incidents. They sound like a pattern. I've been told that exercising a legal right to appeal an agency decision related to one service has adversely impacted other unrelated services. I've been told families are hesitant to request a change in service coordinators, even though they know they have the option to do so, because the new service coordinator will treat them unfairly for changing. And, you know, I take these allegations seriously. I think it's unacceptable for district government employees to retaliate against district residents for raising concerns about the services they receive from district agencies. And I believe you, I believe that as well. I really do, that you don't feel this way, Director Reese. But what I'm saying is, I don't think your agency is acting in accordance with that sentiment. What is your response to families and supported persons who fear retaliation from DDS and its providers? And do you think there are ways the complaint process can be changed, like an anonymous one, to address these concerns of retaliation?
You know, another thing, at all of our monthly forums that we have with the community, at the regular project action meetings, a representative from University Legal Services, which is the protection and advocacy organization, is there. Always shares their contact information. If people have those concerns, they certainly should reach out to them. I hear concerns from people saying, You skipped providers. Providers also saying, I don't want to complain because then they're not going to refer someone to me.
Correct.
What I hear though is fear of retaliation, not examples of retaliation. So what you're hearing from people is, I'm worried about this because then this might happen. And I also don't want to, I would not discount someone reporting that in any instance. I can think of, I mean, part of it is also, as Mr. Woodland talked about, people's relationship. It can also be that people have a conversation about a complaint that's made that's perceived differently by the two people and should be escalated so that it can be resolved. So that, for example, if you've been a service coordinator or a VR counselor with a person for 3 years and the person goes to your supervisor, you might say to them when you next meet, wow, I've known you this long. How come you felt it was necessary to go over my head? They might feel like you just said, why'd you go over my head? And so, and what's important is, and I think it is challenging, being able to communicate to people that they should then escalate that so that we can then have a conversation between, because we've actually had one of these recently where I said we need to have a conversation about how the conversations went, how the discussion went between each of the parties in this example so that we understand how it is that people walked away feeling that way and that people understand. I mean, what we've said is everyone has a supervisor and, I've tried to communicate that at our monthly meetings as well. Please escalate something. I don't want to hear at a hearing, people don't call me back. I know I used to hear, I've told this anecdote before, when I first started as the deputy director at RSA, I heard from people, their voicemail is full. On Saturdays, I would pay my son $10. I'd say, call every number on this list and you tell me which ones say voicemail full and we're going to follow up on that. We take customer service very seriously. I do think it is challenging because there's a power dynamic there. And I understand, sometimes people, they say, I complained and then they did this to me. Actually, sometimes what we did was take the appropriate next step. And they're saying that was retaliation. It was actually the action the agency took, which should be accompanied by their right to appeal.
Well, what I'm saying is because there's a chronic issue, I think there has to be a way, as you as a director says, that we're going to improve the complaint process to try to address some of the issues that we're hearing. So for example, in your pre-hearing responses to question 53, DDS said the subject of the complaint is not prohibited from reviewing the complaint. However, the complaint is redacted to exclude personal information. That's troubling to me, especially in light of these allegations of retaliation. Why are subjects of the complaint not prohibited from reviewing the complaint? I don't think excluding personal information is always going to be effective at concealing the identity of the complainant. If, for example, a service coordinator has 25 cases, wouldn't it be quite easy for the service coordinator identify the complainant based on the information provided, even without the personal information?
The challenge with what you're presenting is that the locus of the problem there is the service coordinator's behavior. Regardless of whether the supervisor addresses it by saying this person complained or addresses it by saying these actions are inappropriate, the service coordinator may either know or speculate that's because so-and-so complained, or the VR counselor or any other staff person that we have. Whatever the complaint is needs to be raised with the subject of the complaint, because otherwise we're never going to change their behavior. And it does need to be raised in a way, I mean, as I said, I recall very recently having this conversation. It does need to be raised in a way that people understand that it's not okay to then follow up and challenge the person as to why did you complain?
So I hear what you're saying. I just think the system is flawed in the current manner that it is in. And as a result, it's going to continue to result in people feeling like there's retaliation, and there's a way for you to change this system to prevent this from happening.
We'll look into it.
And so what I think needs to happen is that if somebody is the subject of the complaint, like you do with anything, a DC HR person, if I'm the subject of a complaint, HR doesn't come to me and tell me I'm the subject of said complaint. HR does their own investigation and then will come to me later on. It just, right now, the system as happens is opens you up to what people feel like are retaliation, and it's become a pattern. I want to, in this regard, I'll move to Randolph Shepherd Vending Facilities Program because I want to talk about the Randolph Shepherd Vending Program. As you may remember, during my visit to DDS headquarters early last year, you showed me a Randolph Shepherd vending site and it looked great. And I was so excited. I thought Randolph Shepherd is a fantastic program that empowers our blind vendor small business owners. But now I have serious doubts about DDS's ability to administer this program as the district state licensing agency. We've heard quotes today, they treat us like nothing. They came after me personally, no integrity, no transparency. That is the assessment of the program from the people in the program, Director. I'd like to get your response to the experiences shared by several of the program's blind vendors during public testimony. Were you aware of these experiences prior to hearing their testimony today?
I have heard of some of them and we have addressed some of them. One thing I will say, we did just in the past week swear in a new blind vendors committee. My hope is that what this means is that the blind vendors committee works with the state licensing agency, and that we will sit down together with the leadership and the blind vendors committee and talk about these issues and address some ways that we can improve in this area. It takes me back, well before your time in 2011, right before I joined the program, we were actually in a very similar place with our Randolph Shepherd program. And we had some steps that we went through. We still have all the materials from those steps of working on what our active participation process should look like. It's a really unique program in that the program participants are supposed to, and as you heard today, I think some frustration about their role there. They are supposed to take an active participation in all major administrative decisions. They should be hearing the budget every month at their meetings. There should be regular blind vendor committee meetings each month. I will say that because it's this unique program, as you said, one you'd never heard of, doesn't that sound great? It is a very unique kind of niche program. And unfortunately, our person who was responsible for the program left in 2022. It's a really challenging position to fill. And it is an extremely important position because that person really has to navigate the relationships with 20 very unique people, all individual business owners. They have to engage with the Blind Vendors Committee. What I plan to do is have our next meeting with them, talk with them about when we've experienced this before. I know actually one of them was on that earlier committee that worked with us, and talk about how we can take a step back and look at getting back on track with being a state licensing agency and a Blind Vendors Committee that work together to improve the outcomes for the program.
Okay. I want you to know, so in for this particular instance, over the last 5 months, my office and other council offices, and I promised my colleagues because they couldn't make it, have been contacted by many blind vendors in the Randolph Shepherd program. In fact, just this past weekend, I was at an event in Ward 4 and met a constituent who happened to be a blind vendor in the program. The experiences that they have shared with us are, to be blunt, traumatic. Vendors have raised numerous and wide-ranging allegations against RSA employees, including racism, harassment, favoritism, and discrimination on the basis of disability. Some of these experiences are recent and ongoing, but others go back years. I want to be clear, I do not believe that these are isolated incidents. There are so many complaints, and the level of similarities among them indicate that this is a years-long pattern of maltreatment of vendors that is being accepted and not sanctioned by DDS. This is unprofessional, and hostile treatment of blind vendors is completely unacceptable and should not be tolerated by any executive agencies, especially ones charged with providing services to the people with disabilities. Director, these blind vendors are district residents, people with disabilities, and small business owners, many of whom are minority small business owners. And I don't know why RSA's treatment of our blind vendors has been able to go on for so long, but I'm telling you that it has to stop. I do appreciate the agency willingness to work with the committee thus far on addressing some concerns in the last few months. But from what I've heard today, these issues are still ongoing. For example, over the last several months, RSA has repeatedly denied a vendor permission to retrieve almost $10,000 worth of items that are her personal property. The vendor is coming to me as her ward council member in tears because of how our government has treated her. And this is why I don't believe it's an isolated incident, because the person who came to me and told me this information, who has two council members as well, Councilmember Gray and Councilmember me, both of us know this woman, respect her. She is a Black woman, small business owner who gives back to our communities in such a significant way. She treats our children in the community with respect. She has been an integral part of district government. She has the respect of both Mayor Gray, myself, and Mayor Bowser. So this is somebody who wouldn't, and is the sweetest person. All of us know her. This isn't somebody who would make this up, in my opinion. She has a reputation of being a good person, a good small business owner, just with a heart, and has been treated. And I've seen the emails back and forth. The way she has been treated and talked to is unacceptable. And she just has the benefit of just knowing two council members and a mayor, and everybody else doesn't have that experience. And so what I'm trying to convey, or at least get you to understand, is that, like, this has to be fixed. Like,
Councilmember, I didn't disagree with anything you just said. I'm very concerned about what the vendors came here and said. And as I said, there was a prior time. We dealt with this. We fixed it. My hope, my expectation is that we're going to sit down. The Blind Vendors Committee, the new one, was sworn in last week. We're going to sit down with them and we're going to address this.
Okay.
Just to correct one item that you referenced, 65% of the blind vendors live in the district. The others live in Maryland or Virginia. They are not required to retain residents in the district, but they do continue to receive support from the program.
Yeah. I'm gonna say this. During my performance oversight hearing with CFSA earlier this week, we were discussing the work environments among social workers and the reasons so many are leaving. While the agency examined the levels of burnout and other issues among social workers, Director Matthews shared that the agency discovered many social workers were leaving actually because of a toxic work environment that was being created by just a few employees. He was transparent and honest as a leader. The director said decisions were made, and then in months since, he has been told by social workers that the difference is night and day. And all it took was a few people to make or break the entire division of an agency. So, Director, I'm looking for a night and day level of change here. Randolph Shepherd is supposed to be a resource for our blind vendors, but somehow along the way, it has now turned into a disservice. I will be keeping in touch with our blind vendors. If I get a single report of RSA retaliating against vendors who testify here today, or any other vendors that comes forward, Director, I'm telling you, I'm not going to stand for it. And other council members are willing to stand with me, for many of them that they do know because they built relationships in the districts. So my request of you, Director, is that DDS seriously examine how and who is running this program, and that the agency continue to engage with the committee to seek resolution to all complaints that we receive regarding the Randolph Shepherd program.
I also do think it's important, I think I pointed it out in my testimony, but it is also important to point out that as the vendors have transitioned back, as you know, they're in federal and district government agency buildings, primarily actually federal government agency buildings, which still have a fairly low census. In spite of that, in the last year, and it was one of the complaints that did reach my attention, there were some delays in payment because we had to do a budget mod in order to increase the budget, because our earnings in the vending that goes to the vendors outside of what they earn in their individual stands had increased so significantly. So as I said, I am not questioning any of what we heard today. I'm very concerned about it. We will follow up with it. I've not heard the specifics of the incident that you're describing right now, and would be interested. I'm hoping my staff can tell me what it is. Otherwise, I'll be reaching out to your staff so that can be resolved. But as I say, been a little while ago now, 12 years ago, we were in a challenging place in our relationship with the vendors, and we were able to engage in a process with them that really improved that. I'm hoping that among our new BVC members, that some of them are the more experienced folks who've been around for a while, who sort of recognize that maybe this is the ebb and flow of a relationship and we need to get back on track now.
Thank you. I appreciate that, Director. And I look forward to collaborating and seeing what needs to happen to make the changes that need to happen. Because I don't want any of our district residents coming to us in tears. And especially some who have served this city with fidelity and cared about all of our communities. They don't deserve that at all. DDS lists the implementation of the Developmental Disability Eligibility Reform Amendment Act of 2022 as one of its top achievements of fiscal year 23 and 24. I was proud to co-introduce this bill, which, as you know, expanded eligibility of DDA services to people with developmental disabilities, not just intellectual disabilities. I want to thank and congratulate you and your team on undertaking this very large expansion. How many applications from people newly eligible under this did DDA receive, sir?
So we had 262 applications last year. I don't know that we have it broken down by, we do, but I don't have that in front of me, broken down by a person with an intellectual disability versus another developmental disability. We do have some, we can provide all the specifics of that data to you in terms of,
Okay.
We have it broken down by people who may have applied previously but didn't meet the eligibility standard, people who applied with a developmental disability, and people who applied with just an intellectual disability. But overall, there were 262, which, as I said in my testimony, was significantly higher than the couple of years prior.
Yeah, that's great to hear. As that information comes, we would love to receive it. How many applications were denied, and what were sort of the top reasons for denials?
So I know that there were 161, I believe I said, that 169 that were eligible. So I'm not going to do the math in my head because I avoid that. But I do have the numbers of people who, the reasons that people were determined ineligible on this side of the page. Sorry, I'll be just a moment. It is. So ineligible was 33.
Okay.
Keep in mind, there are also, so 169 and 33 obviously doesn't equal 262. We also had a number of people who discontinued the process, and those people may have found themselves ineligible by what they learned with the community liaison. The primary reason for denial for these people was, the highest one was that there was no pre-22 onset of their disability, so they weren't eligible as a developmental or intellectual disability. They did not have either they didn't have functional limitations in 3 or more major life activities, which means they didn't meet our definition of a developmental disability. They had a sole diagnosis of mental illness, or there was no evidence of a current need for ongoing support across multiple settings.
And how are the needs of newly eligible people receiving services different? Like what has DDA done to ensure the agency and providers are able to meet those needs?
As I said, one of our ARPA initiatives has been behavioral health support for both the DDS staff as well as our provider staff. So we have provided a couple of different training opportunities for all of our staff that have been made available as well to provider staff. This was both with Support Development Associates, which is one of the providers we've worked with quite a bit. And that's the organization that developed the concept of person-centered practices. They have provided some training on person-centered practices for dually diagnosed people. And we also have, I know because I attended it, we provided training on behavior supports for people with intellectual and developmental disabilities and how to implement those behavioral supports. And that was those trainings have been available not only to DDS staff, but provider staff as well.
Wonderful. And then that's something that any sort of provider can continue to have access to as they learn to sort of be able to meet those additional needs.
I believe those trainings are recorded.
Yeah, we have those recorded and
Okay.
also looking to develop along the way.
Okay. In pre-hearing responses, DDS states that the average length of time between an eligibility determination and receipt of services is 126 days for fiscal year 23. Director, I'm constantly hearing from supported persons that they have to wait months to actually receive services. I understand that it often takes 90 days for DHCF to approve a Medicaid waiver. So that's a factor. But I don't know that it should probably still not be taking this long, as the criteria for eligibility for DDA services is very similar to IDD and IFS waiver criteria. Director, what is the reason it takes so long to provide services?
So one of the things you need to keep in mind is that I don't think it is helpful to provide average number of days to first service. And the reason I say that is that's from the day you become eligible until the day that you begin receiving your first waiver service. And so we have, for example, an agreement with CFSA that we reached some years ago, where all youth who are supported by CFSA apply for our services by the time they are 18. We want to make sure that all the documentation is in place so that if they need any other evaluations in order to become eligible, those are done, that we're clear about the correct diagnosis and all of that. And we want to make sure that there's a smooth transition. CFSA continues to provide their services until they reach age 21. So those people may not receive a first waiver service until their 21st birthday. Similarly, we have people who come to us, for example, a person could come at age 18 while they're still receiving services through IDEA at their school. They would likely possibly be eligible for health services for children with special needs through the CASIP program, the Children and Adolescent SSI program.
Yeah.
And those are available until they turn 26. And so the averages, as I say, are not necessarily helpful. One of the things we heard today was in an urgent circumstance where a person began receiving services with local funds, they were able to do it within that month. And so maybe they just need that pressure. The reality is we can reach out to ESA at DHCF in an emergency circumstance and say, can we put this person at the head of the line? This person was just discharged, just released. They need services immediately. We have put them into a placement. We're using local funds, but if we can get this done before the end of the month, then it can be included as a waiver service, and it will save the district a lot of money if we work together and get this done. We can't put everyone at the front of the line. So, in that instance, that person has an urgent need for services, and we meet that urgent need for services. And I think that most of what we hear is the averages sound bad. But if people have specific concerns about, I need a particular service immediately, they should call their service coordinator, their supervisor on up the chain so that we can identify what the service need is, how we can put it in place, whether we are the appropriate agency to be putting it in place. It may be that HSCSN, we've had people who've come to us and say, I need respite, I really need it, and my HSCSN provider isn't available. We're all using many of the same providers. So if it's a provider issue at another agency, then we really want to work with them to make sure that the person gets their needs met. But as I say, individual issues, please make sure people escalate them.
Got it.
Averages, not particularly helpful.
Okay. Do you all collect the data on that, sort of data on the average length of time between eligibility and determination and receipt of services without those in CFSA care?
We collect that, and we are actually working, we don't have it final. We are working with the Office of Budget and Performance Management in the mayor's office they're actually assessing with us and for us. They're trying to look at all of our data, look at what explains someone who gets through quickly, someone who takes a longer time. Are there particular characteristics that cause cases to move more quickly or more slowly? And they're also going to have some recommendations for us about changes that we could look at systematically to improve the process for people. I saw preliminary data. We don't have the final data yet, but I expect to have it very soon.
When you guys get it, we would love to see it as the committee. As well, as you know, this committee also has oversight jurisdiction over CFSA as well. In pre-hearing responses, DDS discussed its partnership with CFSA. I see that 7 youth were transitioned to DA services in fiscal year 23. DDS also, the agencies work together to identify youth who require an early transition to access DDA services and supports that are not available through CFSA. I see 2 youth received adult services prior to the age of 21 in fiscal year 23. Can you just talk more about how DDS and CFSA work together to ensure a seamless transition from CFSA services to DDS adult services, especially for youth who transition early before the age of 21?
So we have a liaison at each agency. They communicate regularly.
Okay.
They maintain a list of everyone who is headed our way.
Okay.
And so that way we're able to track who's going to need services. And then sometimes there are people on that list that CFSA intends to transition at age 21, but they find that their resources aren't able to meet their needs. So we add them to our memorandum of understanding. We begin to provide the services and CFSA continues paying the local
Nice.
share until the 21st birthday.
Good. That's good. As you know, the fiscal year 24 budget included $744,600 to increase the personal needs allowance for from $100 per month to $150 per month. This increase went into effect at the start of the fiscal year on October 1, 2023. Previously, DDS stated it planned to initiate an annual cost of living adjustment, which was set to begin in January 2024. We heard concerns during public testimony that this COLA has not yet been received. Did the P&A of supported persons include a COLA for 2024 yet? And if not, why not? And when is it expected to take effect?
I went back and listened to my testimony when people said this, and what I said was, and I apologize because it wasn't clear. I was thinking we're in a budget hearing, thinking fiscal years. I said, and the next year it will increase. I thought that meant fiscal year 25. Other people thought that meant calendar year 24.
Understood.
So we will increase every fiscal year based on the COLA that is implemented that calendar year. And the 744,000 was an enhancement that was calculated based on the amount we would need to increase to $150 per person for the number of people. So our budget was built based on the first fiscal year, it's this. The second fiscal year, it will go up by the amount of the increase. And as I said, I did go back and listen. I did not say it will increase in January 2024. I said it will increase the next year. And I apologize that I wasn't clear in saying the next fiscal year.
Thank you for getting that clarification on record. According to pre-hearing responses, there were 92 available slots for the individual and family support IFS waiver with only 28 persons enrolled. There was also significant underutilization of this waiver last year and several years prior. In contrast, every year, the IDD waivers utilization stays consistently around 95% to 97%. Director, I want to speak at greater length about this during budget season, but for now, I'd just like to ask, why are there so many spots available in this waiver?
We actually have the IDD waiver is not as close to capacity as you're referencing. And the data that we provided was accurate on the date provided. I think it may have said effective December 31st. We currently, I believe, have either 50 or 51 people in the IFS waiver. And we currently have, how many people in the IDD waiver? But we do have capacity in the IDD waiver. So both of the waivers have capacity. If I had my computer, I could look it up on my
Oh, I mean, I
dashboard.
agree with you. It's just that one is always sort of, IFS seems to be
IFS
It's,
lagged, but
it's
it stopped
underutilized over the
lagging.
years. It just continues to be underutilized where IDD is hitting its max.
Well, IDD looks much higher because it's always been much higher. In fact, IDD remained pretty flat throughout the pandemic. It was at about 1835 for about 3 years in a row, and it's now at about 1850 something. I am making up these numbers and we'll provide you accurate information later, but this is based on my recollection. It's 1850 something. And the current capacity in the IDD waiver is over 1900. So,
Yeah.
so there's capacity currently in both waivers. We have finally at this point seen significant growth in the IFS waiver. As I say, it's now up to, when I looked this morning, while people were testifying, it was at either 50 or 51
Okay,
with a number of people in the pipeline.
okay. So when we get back to budget, we'll continue to look at that one because right now it looks,
We want to make
It
sure
looks
there's capacity in that one
underutilized.
as well, because as you heard, there's participant-directed services in the IFS waiver. So we do want to make sure we retain capacity so that if people are interested in that, we do have the capacity for them to be shifted to that appropriate waiver to self-direct their services.
got it. According to pre-hearing responses, the number of providers that received a formal sanction rose 94% from fiscal year 22 to 23, approximately 19 to 37. Similarly, the number of providers that were placed on do not refer list rose 63% from fiscal year 22 to fiscal year 23, 19 to 31. What is happening here? What is the cause of these increases? Are providers committing more violations? Or is DDS quality assurance team catching more violations?
I would have to say it's a combination of all the above. We have, we've been issuing more sanctions due to a notice secure. We have some providers who are failing to provide the appropriate insurance information in order for them to maintain their human care agreement. And as they fall short of providing that documentation, we have been sanctioning providers. We have had several providers who have increased in failing in their financial reviews. So we've increased with the financial reviews and we've been sanctioning providers for that, as well as an increase with the PCR. They've been citing providers, and if providers are not responding to the deficiencies, we have been sanctioning providers to ensure that they come into compliance with the deficiencies. So it's a combination.
It's a combination.
Yes.
Just given the increase in those numbers, are you all planning on some sort of training for providers to remind them of what their requirements are, what they're going to have to meet?
Yes, we are. We're actually working with DHCF. We're collaborating with DHCF to work with the providers because that is something also that DHCF, Department of Program Integrity, have been identifying. We've discussed this as well with the provider community. So we will also be collaborating with them as we work on training curriculums. We're looking at revising our training policy and procedures, as well as the curriculums that are tied to those particular trainings. There's phase 1, phase 2, phase 3, and we realized that those trainings need to be updated because they haven't been updated in a while, and hoping that that will improve the overall performance of the DSPs as well as the provider community. We're also working with our operations team to look at the quality of the providers that are coming in and looking at our review process of the providers that are being approved within our system to make sure that they really have the knowledge and the capacity to support people.
Got it. Understood. I appreciate that. According to pre-hearing responses, there have been only 8 referrals for person-directed services, and none have started to receive services in fiscal year 23 and 24. We also heard about concerns about this delay in public witness testimony. What is the reason there are so few referrals, and what is causing the delay?
So the few referrals I can't really speak to because I know that when new people are coming in, it's presented to them at every ISP meeting that people have. They are presenting this as an option so that they educate people about it. The delay, I think we probably could have done a better job of educating people up front because when it was explained to me, it made perfect sense, which is when you are self-directing your services, you are essentially creating your own agency. You have to create payroll, you have to hire staff, you have to train staff. When we refer a person for services to a provider agency, all of that is in place. Our fiscal intermediary works with people to help them put all of that together. That's why I was really glad to hear that this week we have someone who has their budget done. They're all ready to go. But it is, and in fact, the timeframes that we're seeing are consistent with what they see in the EPD waiver for self-direction, which is unfortunately 3 to 6 months for someone to get up and running. But when you consider that you're essentially building an agency, it may be an agency to serve just yourself, just one person, but you still have to go through all the steps of hiring staff, developing a budget, training staff. And those things unfortunately do take longer than I think people anticipate. And we do need to make sure that we're including all of that information when we educate people.
Yeah, the delay makes sense. The low referrals is still a concern, I think. Does DDS expect the number of referrals to increase in fiscal year 24?
It would just be speculation on my part. Our hope is certainly that they will. And hopefully as people become familiar with it and have success with it, then by word of mouth, people will then start to become interested. We do see in the EPD waiver, the utilization is extremely high. So my hope is that that's what we would see once people become familiar with the process.
Got it. Derek, I want to thank you for DDS handling of the unwinding of the federal public health emergency. From what I understand, not a single supported person lost or had a gap in coverage, which is great. One area that does not seem to have had that same level of success was the changes to companion services, which we heard about earlier. It is a mess, is what we heard during public witness testimony today. Families were confused and service coordinators were not being transparent about the changes, particularly in regard to the exemptions that allow people to receive companion services without considering other services. So Director, first, I'd like to give you the opportunity to respond to the public witness testimony about companion services and discuss sort of what happened there in comparison to.
One of the things we saw, which I think is human nature, we did, and I think I outlined them, a number of events over a year to help prepare people for what we were preparing them for. Is we had the waiver renewal and the waiver amendment in October of 2022. These new waivers went into effect. But because of the Appendix K, none of the changes in the waiver would go into effect until 6 months after the public health emergency ended. So we began in November of 2022 to advise people this is what's coming, to talk about what it's going to look like, to have training for all of service coordination, to have training at our provider fair. We talked about it 4 times, I believe, 3 or 4 times at community forums. The first time that we had a really engaged community forum on this topic was in late October, because it was about to change. Prior to that, it was the exact same presentation every time. Prior to that, we didn't have questions, we didn't have feedback, we had none of it. In October of 2023, when we were 3 weeks away from the change, all of a sudden, all of the very specific questions came up. So part of it is just sort of the urgency of, oh, that's not today's problem, I'll worry about that later. The other thing is to be very clear. Companion existed before the public health emergency. We created it as a service initially because we had people who were in residential settings who had reached a particular age and no longer wanted to have to get up and go out to a day program every day. They felt, and I appreciate that, I'm beginning to appreciate that feeling more and more as I get older, the idea that maybe I just want to sit home with my feet up and watch TV today. And so for those people who wanted to engage in some other kind of constructive activity during the day, we created companion service. And then the pandemic came and we were all stuck at home. And so we expanded companion service for everyone. Expanded it well beyond what it was initially intended for, but we expanded it for everyone because we wanted everyone engaged in constructive activities during the day while they were home and up and awake and hopefully active. And then as we've resumed, there isn't really, I don't consider it an exemption. I don't think I'm reading that wrong. There's when people are considering their day services, we want to make sure, because for all of us, it's physically and mentally more healthy to get up and go out and be engaged in the community during the day. So we do first look at someone being engaged in a community day service, an employment service, and those services must first be considered before authorizing companion service. So a team can decide that one of those services is not appropriate and therefore companion service is. And in that instance, they will authorize companion service. However, when they do need to make sure that the companion service involves some constructive, beneficial activity during the day, and that there's a plan that accompanies it of what the person will be engaged in. Because as I said, we want people engaged socially, engaged physically, because those things help maintain our health. I think, well, I won't speculate as to what people's frustration is. I certainly understand, and you could probably appreciate. So as we've educated 80 service coordinators to go to all of these team meetings, there may be some variation
my
in how it's
concern,
presented.
which is what you're not articulating. My concern is that DDS was reducing companion services sort of more than what was required by the federal waiver. And I was wondering if like you all were sort of weaning out companion services as sort of as a policy choice. And so I'm because and based on the witness testimony, I was like, maybe this is true, because I'm hearing from families that meaningful day assessment allows companions, but DDS is saying other services should be utilized instead. So that's.
Can I just say, this is not our budget hearing. Companion is our least expensive service. If I was going to steer people to a service, and IDS is our most expensive service because it's an individualized day service where you're developing a plan with two people to actively engage in some activity out in the community all day. It requires real planning, real support. Companion requires keeping someone healthy, comfortable, safe, and following a plan for what they're engaged in during the day. But in terms of the qualification of the staff that's required, it's less. It is not a service that we have any intention of reducing or eliminating. In addition, because as I said, it was initially envisioned for people who had gone a lifetime to a day program and were ready to stop doing that in the same way some of us reach an age where we're ready to stop going to work every day. And it was kind of retirement for people. It's expanded a little beyond that, but that was its initial intent.
Got
It
it.
looked like
Okay.
Mr. Woodland was trying to jump in.
Okay.
No, I was just going to say, it occurred to me that because of the pandemic, there are people who were determined eligible and introduced to companion who never had the experience of some of our other programs. And I was really encouraged to hear from one of the witnesses that they actually, upon exploring IDS, found it to be useful for themselves. And that's the typical experience. If you've only known companion because you were determined eligible at the heels of the pandemic, and that's the service people don't like to give up something that they know. It's just human nature. But I just thought of that. So we're anyone who has concerns, we've been trying to address them individually. But
I was gonna say my ask, I know if any family or supported person approaches DDS with concerns about how their companion services were changed, that you please look at their case closely to ensure sort of proper procedure was followed and that they now have the supports they want, need, and are eligible for.
Yes.
Okay. I want to go to turn back to RSA. According to pre-hearing responses, among the 18 schools with over 100 students eligible for pre-employment transition services, only 30% of eligible students were reached. Why are so few students reached, and what challenges has RSA identified in reaching students in both DC public schools and DC public charter schools?
I'm going to ask Mr. Evans to address it, but first I also want to point out that that involves reached by RSA. And so we have reached out. We have an MOU with DC Public Schools, and we have a human care agreement with the Special Education Cooperative, and they also provide services to youth. It may mean that someone hasn't been referred to us for services. It doesn't mean that they haven't received them. We also have a pretty extensive service delivery system that School Talk provides. They have a really well-attended annual conference that is student-led. The students create all of the workshops, do all the presentations, and they reach a number of students that we might not reach. And that does get back to the issue of that in order for a school to refer someone to us, they have to have the parents' consent first. But I do believe that 30% number is not, it does not reflect. So we have reached and provided at least one pre-employment transition service to 80% of students who are eligible.
Okay.
But that includes services that are provided to people who are not listed in our system. But I'm going to let Mr. Evans speak for just a moment.
And that's correct. What Director Reese is laying out is you don't have to get pre-employment transition services from us. So the mathematics, I'm not sure where that came from for this hearing, but the mathematics that we supplied to you is absolutely correct. We've reached 80% of the students and had at least one pre-employment transition service. Again, as Director Reese has alluded to, we have an MOU with DCPS. We work closely with the DC co-op and public charter schools. We have multiple events that encapsulate pre-ETS students. And again, they don't have to come to us for that. In addition, the Department of Education sends a dashboard that showed us achieving over the last 5 years, much higher numbers that are reportable and money spent on students achieving pre-ETS in FY23 than in the last previous 5 years. So I'm not comfortable with
That was the number. That was the number y'all gave us in the pre-hearing response. So that's where it came. And
Could you tell me which
Question-
response you're looking at?
question
Thanks.
126 and
Thank
122. How does RSA define potentially eligible students? Are these students who have IEPs and or 504 plans, or does it just include students who have completed and submitted the authorization and consent forms to RSA?
We consider potentially eligible. Under the law, potentially eligible is any student with an IEP, a 504 plan, or a qualifying disability. The challenge is no one can tell you how many students who don't have an IEP or 504 plan may have a disability, but not require any accommodations for that disability. So when we look at our percentages of students served, we're looking at the OSSI date, the Office of the State Superintendent data, which gives us the number of students who have an IEP or 504 plan in each school.
Got it. Okay. I want to ask about in regard to pre-hearing response for question 144. Do the transition unit counselors have cases only for transition age youth, or are the VR cases or for all ages? In public witness testimony, we heard that VR specialists are overworked and their caseloads are too high. And we heard that in addition to not just public witness testimony today. Do you agree, and what can be done to lower caseloads and improve RSA services?
If you look at the general VR caseloads, you would never argue that those caseloads are too high. If you look at the transition caseloads, you would say they're too high. And then keeping in mind, as I said, we have just hired 2 more staff. So my hope is that will move that number down some. We also made sure to break out. We have students who are included in our database who are receiving a pre-employment transition service, and that's their only involvement with us. And so they are included in the counselor's numbers. We did split them out. I'm not going to search for where those numbers are. I'll just acknowledge that for transition, even with splitting those numbers out, there are some counselors who are too high. There should be 14 counselors. When there are 14 counselors, then we're able to keep the caseloads where they need to be. Pre-ETS means that they're registered in our system, that we've had the consent to provide pre-employment transition services. It may mean that the counselor has provided one of the 5 services to them. It may mean that one of our partners has provided it. It doesn't mean that they have an ongoing relationship with that student. So that's why I don't think including those numbers gives a fair representation of the amount of their workload.
Okay. But you said, I think you said earlier that there were going to be more, you were addressing those vacancies.
Oh, yeah. And as I said, and maybe I shouldn't be, I can't see our HR person from here. So I'll go ahead and say we have made offers for the two vacancies, and I'm hoping that they'll accept those offers. And then we will have a full complement of VR counselors in transition, which will address that number.
Got it. One final thing on RSA, back to Randolph Shepherd, because I forgot one thing. We heard in testimony earlier about blind vendors' inability to receive communication from RSA in an accessible method. So on one hand, I'm hearing RSA is sending correspondence to blind vendors in really small print, and that requests for the agency to communicate via audio are denied or go unanswered. And then on the other hand, DDS and pre-hearing responses, question 36 says requests for Braille and accessible communication methods have not been received. Both of those cannot be true.
Well, they
can't.
can be true in that the pre-hearing responses, I don't know that we certify anywhere here that we have communicated with every employee of the agency to confirm this. All that I can say is from the staff that completed this, we haven't received them. It is unacceptable to respond in the manner that was reported today, and we will be following up.
Thank you. That's what I was going to ask. Can you just see that all communications from DDS are being provided to blind vendors in the required and necessary accessible method of communication, whether it be large print, Braille, or audio. And if you need some guidance, we have an amazing Mayor's Office of Deaf, Blind, and Hard of Hearing who are willing to help you and give you guidance there.
We have staff in our office. We translate things. We have a brailer in the office. We have communicated in this manner with this staff for years. As I said, unacceptable, and we will make sure that that is addressed. And we have not only should we be communicating in the manner most appropriate that the person requests, we've purchased equipment so that the person is able to access the communication that we send. So, so it is not the program's intent to respond in that manner.
We've heard some questions about rent cap today. Can DDS examine increasing the rent cap in the fiscal year 25 budget?
We can examine it.
That's what we're all going to do in this budget. As we move into this budget season, Director, I know that you all are going to be tasked already. I know that you're currently being tasked. Every agency is going to be asked to trim where they can trim. I have told every agency in my cluster that we are vital agencies to serving district residents. So I say that to say, advocate for yourself and the lack of those cuts and trimming and thinking about the impact, the people impact on what trimming in certain areas will be. And it'll be, I will be up next to advocate after that, but I'm asking every director in my agency to, as you are in the room, to make clear sort of what your agents, how critical your agency is to the district and the constituents that you serve as a part of your agency. So that's it. Thank you, Director, for your testimony and service to our district residents with disabilities. Don't forget what I said about the Randall Shepherd, night and day.
Oh,
Night and day.
absolutely.
And review of what's happening there. I appreciate your engagement with me during this hearing. And I hope and believe we can work together on the areas that we discussed and continue to be successful in the areas that have been successful. Thank you.
Thank you.
Next, last but certainly not least, we will transition to the performance oversight hearing for the Mayor's Office of Deaf, Blind, and the Hard of Hearing. Again, we will begin with public testimony. And so I'm going to invite our panel of witnesses, Marilyn Rivas, Haresh Rumrup, and Brianne Berger. And for anyone's name that I completely got wrong, feel free to correct me and please charge it to my mind and not my heart. Thank you. Harish, if you're here on virtual, I see you. We're trying to promote you to panelist. If you could accept the requests to promote you to panelist, please. Thank you.
Testing, testing. Testing, testing. Testing.
Yeah, that's more than fine.
Testing. Great. I think.
Do you have a good?
Oh. That's her, right?
Yeah.
You like to whisper? Okay. Yes. I'm looking right here. Can you hear me? Got him in there. Scared. I have a reach pin. I don't have Brienne. She's right there now. She looks here.
We will start with our first public witness, Harish Rump. Harish, if you can unmute and turn on your camera. Perfect.
All right. Can you see me? Hello, hello?
Yes.
Can you all see me? I got it.
Oh, they can't.
Okay, you can see me. Great, fantastic.
You may begin your testimony.
All right, thank you. I wanted to let you know I'm a longtime deaf resident in DC since 2010. And I'm a bit of a transplant to this area. And I have experienced a lot of hardships and barriers regarding the access that I've been trying to receive with DPR, the Department of Parks and Recreation. So just a little bit more background for myself. I am married. I have a deaf wife. We both are deaf. And I have 4 children. One child is deaf. And so, of course, we do like to be involved with DPR, the different events and programs that they do offer. And so in all of this time, we have experienced a lot of frustration. And obviously with this testimony that I use, I could go on for about an hour, but I'm going to go ahead and compile that down into 2 main pain points. The first one, for my deaf daughter, at times DPR will have different programs and events that they'll offer, like class or school setting events. And so her own ability to be involved in those programs are limited. She does have to register online, first of all. We go through the process, we register. And on the form itself, it actually does have a section which asks, do you have any need for reasonable accommodations? And so 100% of the time, we always do put down, yes, we do need ASL interpreters for our deaf daughter, or sometimes for my wife and myself. And so we do put in that information on the form and send it in. I would say 100% of the time when we do send in that form and we show up at the event or whatever it may be, there is no interpreter present. Which means often the very first class that we have or whatever the event or program that they're offering, it's kind of a confusion. There's a mismatch and we're kind of missing that whole benefit of that first experience that we have at this program because we're kind of, we're tied up at the front desks trying to work things out, getting interpreters, or they don't really understand how to work with deaf people or provide reasonable accommodations. And so there's just this mismatch, this runaround that we end up getting. And so we do get their contact information, we reach out, we try to get things fixed up. But again, we have another runaround. And 2 or 3 weeks later, we'll finally get an interpreter set up for those programs. And then at that point, we've missed the first 3 classes, the first 3 weeks of classes. So it's been frustrating at this point. For example, there's also a free class that we do offer. I think the class is available for the age 7 to 13. And so I do have 2 daughters. My one daughter is 10 and my other daughter is 8. So one is deaf and one is hearing. So we do still request ASL interpreters during that process for these programs and events. And we show up and then there are no interpreters present. We try to go through the process and make sure that they understand we do need accommodations. And then second class, there's still no one there. And so for my deaf daughter, we'll miss all the information that my hearing daughter actually benefits from. And so that access really isn't, parallel. There are so many examples that I could provide, so many more examples I could give. So really the second pain point I wanted to mention here, I've noticed that within DPR, there have been, there's some dishonesties. There's not really awareness of training or really to work with deaf people. And so I really do have a perfect example. I think it was around 2017 or 2018. I can't remember the exact year. I wanted to send my daughter, who was deaf, to a camp through DPR. It was a youth camp for the summer. And at that time, there wasn't the lottery system, didn't exist, but we were able to get a spot with her older sister, her older hearing sister. So they both were able to get a spot in the camp. And so we were able to get some contact information. We found someone to be able to provide, that reasonable accommodation. And I did inform them that we would need 2 ASL interpreters for my deaf daughter to benefit, for the entire session for this summer camp. And the response that we got from the DPR official said, oh, well, he said, oh, we're going to refer you to the therapeutic center. They can go there, you can get an evaluation, they can provide resources to be able to meet your deaf daughter's needs because your deaf daughter has special needs. Those were his words. And I said, what? And so I really had to take a step back. So I went along with it, because obviously it seems that they know their system a little bit better than we do. So fine, I went along with it. And we were able to get an appointment with the help center. I think it was on G Street in Northeast, the therapy center. And I think it's near the library. I forget which library it was, but we went there and they didn't have any interpreters present for that time. So we were writing back and forth on some paper to be able to communicate. And I tried to explain with them that we just needed an ASL interpreter. We need interpreters. We don't have other physical needs or demands. We just needed an ASL interpreter. And so we would go through, we tried to figure out this process and clarify with them. And then from then forward, there were no interpreters at any other events. And several times we actually weren't able to attend many events because they didn't have interpreters. And so we would reach out and we didn't get any response, actually. It ended up, they kind of shut us down. They weren't willing to work with us or communicate with us or, reach any sort of resolution. So I kind of had to end up canceling some of the access and the programs that my daughter was involved in. So she was really home for the entire summer. And her sister who was here and was able to go and enjoy the camp. And so it was very frustrating for us because of that. We decided not to send our daughters to any DPR camps moving forward. So that was around 2018 until now. And we have no choice. We do have to send, our daughter to a camp. And so we go through DPR. We went ahead and registered again. And this time we used the lottery system. But again, there's no information that I can use to be able to reach out to someone to get an ASL interpreter for the program. There's no forms for me to fill out to get reasonable accommodations. That doesn't exist anymore. So the whole thing is even more frustrating for me as a DC resident. And it's 2024, so come on now, we need to do better. And just one little piece of advice I wanted to give for you, a solution to this problem. I would recommend you designate a central person to be responsible for coordinating all accommodation requests to ensure that they need to have that seat at DPR. And then that person or that team, whatever, they are the person of contact for all reasonable accommodations that are processed and provided before the program begins, so that I can reach out to them and have this clarity. Rather than me showing up and them being frustrated because there's no access. And I'm trying to make sure I get a hold of the right people to make sure that they can have interpreters provided moving forward. And it's, again, 2 or 3 weeks that I've lost and there's no access. So I would really like there to be essentially a central person or a team within DPR that focuses on those reasonable accommodations and those requests. Thank you.
Thank you. Next, we will have Brianne Berger. Brianne, you may begin your testimony.
Okay, great. Thank you. Okay, hello, my name is Brianne Berger, and I live in Ward 4. And I've been a DC resident for almost 20 years. That's a long time. I wanted to share just some suggestions for how the city Oh, I'm sorry. I wanted to share some suggestions on how the city can maximize the use of the mayor's office for the deaf, deafblind, and hard of hearing, or MODA, as we call it. I wanted to propose first that the DC government agency videos all include captions. So any government website or department website include captions on their videos. Each agency should be providing ASL version or documentation. For example, if there's an emergency evacuation notice or any other documents that is provided in other foreign languages, we ask that ASL be included as well, or listed as a language on those resources as well. Translation and caption services are limited based on the current staff capacity. And I would like to formally request that the city create a position for language access coordination or language access coordinator within MODA. And that will allow for these services to be provided. I also think that that person who's going to be the language access coordinator would essentially visit restaurants and gyms and other public spaces to ensure that all of the captions are visible on television screens within their establishments. I would also like to suggest that the current mayor's interpreter, who is actually on full-time status, they are a full-time FTE, that they would be included on location and on site with ODR. And we want to make sure that they would actually be moved over to oversight, to provide oversight for MODA as well. My third solution would be that MODA right now is physically located in an office, and that building is not accessible for wheelchair users or accessible in terms of communication for any visitors who are deaf or deafblind. That building itself is not accessible where MODA is located, and we would like the city to reimagine or consider moving the MODA offices to a more accessible building. Those are my three suggestions. Thank you for, those are my, or even suggest moving the office to City Hall. I would also like to add that 2% of DC employees, we would increase the hiring of 2% to see the increase in hiring of those who are deaf, deafblind, late deafened, or hard of hearing, to increase the employment population to 2%. We are seeing that we want to see more case managers for senior citizens as well. We want to see more behavioral health services, more housing services, and community development services be provided to this community as well. DPR, the Department of Parks and Recreation, we would like to see more accessible programming there. We would like to see additional interpreting services. Also, law enforcement, the hard of hearing, the deaf and hard of hearing unit. We would like to see more of those officers and members learn sign language. I already mentioned earlier about DC government agencies providing captions on all of their videos that they post on their websites and other places. I would also like to relate that to WMATA as well, to make sure that all information that's announced over the speakers in the metro system be captioned as well. We'd also like to see deaf business owners and entrepreneurs be supported further. We would also like to see MODA staff being able to access events. We've noticed that there's been fees associated with some events, and it restricts a lot of the MODA staff and constituents from being able to access these events. And so that fee creates a barrier to entry for a lot of these individuals. There are two other areas of feedback that I would like to provide specifically to the MOCA office regarding resources. So one, MODA should not be expected to attend all MOCA events, MOCA events. I would ask that you please consider that MODA's use, like what is the best use of MODA's time and effort. They're constantly having to go to these events, and their main priority is to work specifically with the deaf, deafblind, hard of hearing community. And so taking up time attending MOCA events is probably not the best use of their time. MODA also is working on their operations priorities. And it's important for the office to focus specifically on their priorities. And MOCA's priorities are not specifically aligned with the deaf, deafblind, and hard of hearing. And so it really is not the best use of MODA's time or priorities in attending the MOCA events that they're required to attend to. So I would ask that we reevaluate the necessity of MODA employees and staff attending those MOCA events. I would also like to suggest, as we've seen ongoing use of MODA, we've noticed that MODA has not received advance notice of upcoming events, and that does not give them enough lead time to provide the necessary resources for those events. And so we ask that giving them advance notice will allow them to increase the capacity, increase accessibility services they're able to provide for these events. Advance notice will allow them to be able to let the deaf community know about these events well in advance and allow for more attendance within the deaf and hard of hearing community. Thank you so much for your time.
Thank you for your testimony. I'm just checking to see if Marilyn Rivas, if you're online, raise your hand so we could promote you as a panelist. And then checking in to see if there are any other witnesses who wanted to testify. If so, you have to raise your hand on the there's one. Wait. Jose, you can turn your video on and we will hear your testimony.
Can you see me?
Yes, I can see you. Thank you for being here. You may begin your testimony.
All right, perfect. So I will try to be brief. I know your time is important. Good morning and good afternoon, Chairperson George, and members of the council as well, members of the Committee on Families or on Facilities and Family Services, and for all of the service that you are doing in DC. My name is Jose Rodrigo Uresti, and I am a deaf graduate student at Gallaudet University. And it's really been an honor to be here with you all today. And so for some of this, I am a student at Gallaudet, and so I am deeply committed to safety on campus and in around DC. And so I have a little bit of concerns about my own safety as well as the safety of others. And so I have noticed there has been a lack of bike lanes in some areas in DC. And so when traffic is very high, for example, on M Street, my friends and myself, we do use scooters very often to make our way around. We do ride bikes sometimes to get around DC. And often that will lead to our own feelings of being unsafe. When there are no bike lanes wherever we're trying to go, often I would recommend that we add more bike lanes all over DC to improve that navigation for the safety of everyone involved. And so my other concern is also for access regarding captioning barriers for any deaf residents that live in DC. for any notice that goes out, for the best communication and access for everyone, it would be important to have captioning services provided. For the law enforcements that do work with deaf and deafblind constituents, it's important that they have that awareness as well. So that training needs to be improved. I think there would be a benefit for all law enforcement officials, emergency personnel, to be able to learn the basics of ASL, of American Sign Language, and that would be the best interaction and experience on both sides. And that's even more important in an emergency situation when some deaf or deafblind or hard of hearing residents, emotions may be high at certain times, and the language barriers at that time increase twofold. And so often there is, in the same way, a lack of effective communication. There was a time that someone had attempted to steal my friend's scooter that they were riding. And so we actually tried to get the attention of a law enforcement officer on the next street, but there was a communication breakdown. So it is vital in terms of, being inclusive in this environment and in this space to make sure that we are creating more of a beautiful society for everyone to enjoy here in DC, to allow us to, envision DC as a place where we feel safe, where everyone feels safe. And we do have a sense of belonging. So thank you so much for your time and your consideration.
Thank you for your testimony. I have some questions for this panel. First, Harish, is that how I pronounce your name? I just want to be respectful. Is it Harish? Harish, thank you. Thank you, Harish, for being here. I want to start by apologizing for how you and your daughter were treated by DPR and district government. I think this situation was wholly unacceptable, and preventing this type of situation is exactly why we now have a mayor's office of deafblind, and hard of hearing. How do you think having MODDHH back in 2018 would have changed things for your daughter's ability to participate in camp? And what suggestions do you have to improve other campers' experience in the future?
Yes, hello. Would you mind just repeating the question? I wasn't totally paying attention at that time.
I said, how do you think having a MODDHH office back in 2018 would have changed things for your daughter's ability to participate in camp? And how do you suggest we improve for future campers like your daughter?
Yes, thank you for the question. So I believe if MODDHH had existed in 2018, I think things might be a bit different. There'd be some big changes because now I do know who to reach out in terms of assistance. MODDHH has been very helpful with my own, the requests that I've had for ASL interpreters. There have been a few events that I've attended in the past recently. For example, there was one, it's escaping me at this time. There was an event, I think, Disney on Ice for the kids to be there. So we did actually register. We wanted to all attend. And I reached out to MODDHH right after that, and they were able to take care of getting services for us. So it was a relief that we didn't have to work harder than normal. So that fear, that wondering of whether we would have an interpreter at this event was non-existent. And so my suggestion to you then to improve regarding that camp experience that we had at DPR, again, that there would be a person, someone on that side of DPR that has the training, the knowledge to train their staff to work with deaf people. And I don't really think that is the responsibility of someone at MODDHH. I think that is the responsibility of someone at DPR in order to have someone there to provide that training, to be able to facilitate how to work with deaf people for their experiences so that deaf people are included in the process for different activities that you do offer. And that's it.
I agree. Thank you for that suggestion. And we will follow up with DPR. Brianne.
Yes, thank you.
Brianne, thank you for your testimony. I will be discussing with MODDHH the recommendations you provided for increasing the district's government's accessibility. One of your recommendations focused on language access. Can you talk more about how the district government is failing to achieve true language access and how a language access coordinator would help remedy those issues?
Absolutely. So an example would be, okay, you can see me. Okay, great. So one example would be services. So I actually serve on a disability council committee for HSEMA, Homeland Security Emergency Management Agency. And this is under DCAG. And we've been providing a ton of recommendations to Homeland Security about emergency situations that may occur. If there's an emergency evacuation, how we would develop the plan, so on and so forth. We've talked about how we would curate those materials in case of emergency, and I've been able to provide feedback on how they can make those materials more accessible and to ensure that they're provided in American Sign Language as they are provided in other foreign languages. We also want to include captions and ASL translations on these websites that these resources would be posted. Now, I realized that this isn't a requirement, and I was surprised when I found out that it wasn't a requirement. And HCMA was surprised that it wasn't a requirement as well. And so this was a resource that we definitely need, and we needed to have staff dedicating time to translating the videos and making sure that they're provided and that they're accessible in ASL. And so another position, maybe through MODDHH, would allow for all government materials to be available in American Sign Language. So that's just one example of many.
Thank you. Jose, are you still here? I don't see Jose. All right, well, thank you to this panel of witnesses. And thank you for your testimony. We will now turn to government witnesses. With us here today is Director Carrie Cook, Director of the Mayor's Office of Deaf, Deafblind, and Hard of Hearing. Thank you, Director Cook, for being here today. Before you begin your testimony, I'm going to administer an oath to you. Please raise your right hand. Do you swear or affirm, under penalty of perjury, that the testimony you are about to give to the Committee on Facilities and Family Services is the truth, the whole truth, and nothing but the truth? Yes. Thank you, Director. You may begin your testimony.
Hello, my name is Carrie Cook. I'm a Black woman with Black dreadlocks, wearing a purple tweed suit with white pearls and matching earrings. Good afternoon, Chairperson Janice Lewis-George, members of the council, staff of the Committee on Facilities and Family Services, and residents of the District of Columbia. I am honored to have been selected by Mayor Bowser to lead the Mayor's Office on Deaf, Deafblind, and Hard of Hearing. In the past year and a half of its existence, I am proud of all that has been and will continue to be accomplished by this phenomenal team, with experience from the National Association for the Deaf, Laurent Clerc National Deaf Education Center, the National Association of Black Interpreters, and Gallaudet University. The team holds certifications from the Federal Emergency Management Agency in Emergency Management for People with Disabilities, the Registry of Interpreters for the Deaf, and National Interpreting Certification, and NIH's Collaborative Institutional Training Initiative Certification in Social and Behavioral Research. It is clear that my staff's background spans the most elite and community-embedded organizations in both national and district deaf, blind, and hard of hearing communities. In fiscal year 23, MODDHH focused on community outreach and cementing our place within the Mayor's Office of Community Affairs as the outreach arm of Mayor Bowser. In addition to the numerous community engagement events and programs, we started initiatives that address the needs of the community with large numbers of community member involvement, thus showcasing how invested deaf, blind, and hard of hearing residents are in the work of MODDHH. From meeting and talking with residents and organizational leaders, we determined our priorities and vision for the community members in the District of Columbia. We continued our outreach heavily, partnering with the Department of Disability Services in their provider and community stakeholder forum, the DC Public Library's Accessibility Center on Deaf Outreach, the Office of Disability Rights in their annual Disability Tech Expo, and so much more. In recognition of Deaf Awareness Month on September 28th, MODDHH co-hosted and co-sponsored the Global Technological Accessibility Summit during International Sign Language Week with international deaf leaders who served as delegates from France, India, Germany, Namibia, and more. Also in attendance was the president of the World Federation of the Deaf and the president of the National Association of the Deaf. The summit discussed the latest technological innovations worldwide that increase accessibility for deaf, blind, deaf disabled people, cementing Washington, D.C. as a premier thought leader in technology accessibility for people with hearing loss. Looking ahead, we are excited about the work coming out of our office. The rest of the fiscal year will be spent maintaining the District of Columbia's effective communication program, ensuring that ASL, pro-tactile ASL for deaf-blind constituents, certified deaf interpreters for those with language deprivation, and CART, captioning for those with hearing loss that do not sign, is an embedded part of DC government and public service, ensuring that all of our residents of DC can gain access to the various district government resources available. In addition, with partnerships such as the DOH Early Hearing Detection and Intervention Committee, the creation of the program for hard of hearing and late deaf constituents, the current hashtag DC in 3D initiatives for deafblind residents, policy advocacy, such as language access, and our annual end of the year report with the social impact assessment, MODDHH is primed to make a significant impact. The work continues with the upcoming year, boding well for continued success in serving deaf, blind, deaf disabled, hard of hearing Washingtonians. Again, thank you all for this opportunity to testify. I welcome any questions from the committee, and I invite anyone who might be interested in contacting our office to please do so by emailing moddh@dc.gov or visiting us online at our website at dc.gov/community-affairs/MODDHH. Thank you.
Thank you, Director, for your testimony and for your entire office service to district residents. I want to start with, you all have been doing an extensive amount of community outreach and services, which has been amazing. Can you discuss some of the community outreach and services you've been doing, and how have our residents responded?
Sure. So in fiscal year 2023, we have done so much in outreach, and it's no surprise, right? Because we serve as the community outreach arm for the Mayor Bowser administration specific to the deaf, blind, and hard of hearing community. These things range from developing our cultural competency training, the SAFE project, which stands for Securing Accessibility for Emergencies, where we work with HCMF, FEMA, and MPD in making sure that their services are accessible. One thing with accessibility, I think you mentioned it earlier in your statement with ODR, that it's more than compliance. Accessibility is that ingrained nature. And like the staff at ODR mentioned, district government wants to do that. They want to be accessible. And so we've really equipped and empowered them by giving them the information and resources through our training to be able to do so. Now, as it relates to direct community engagement, we have several programs and projects that reflect that. For example, we have the Youth Wellness Collective called Douglas Thrive That. That is a program to promote wellness in deaf, deafblind, deaf disabled, hard of hearing, and late deaf and Washingtonians by providing educational workshops, activities, and networking specific to resources in district government. So that's really the mandate of our office, right? We're not a major compliance office like ODR, we're not a service office like DDS, but we as community engagement, the main reason for being is to make sure that Washingtonians are connected to the vast amount of resources, and that not just connected, but those resources are accessible. And so what we've done is take on what Marion Barry said, right? He said, if you take care of the youth and take care of the seniors, the rest will figure it out. And so in following that, we have the youth program where we meet once a month, and then we have, for example, the district agency come in and talk about their resources, and sometimes they have youth programming themselves that they can share. So we based it on the 8 pillars of wellness. So for example, with financial wellness, we had the ISB come in. The wonderful thing about the ISB is that the commissioner for the ISB herself is a sister, a sibling of 2 brothers with hearing loss disabilities. So she has been a great ally to our office and very, very supportive of many of our initiatives. And we've seen that across district government. We're often surprised to find that not only are deaf people everywhere, but our allies are everywhere too. And I think that's very much a testament to Mayor Bowser and the work she does in making sure that her values are reflected in her administration. Additionally, we had the Hard of Hearing, Deaf, Blind, Deaf DC Works Employment Summit this past October for National Disability Employment Awareness Month, NDEAM. This employment summit really focuses on the fact that not only are Washingtonians with hearing loss looking for jobs, but DC government is hiring. So we were very excited about the opportunity to partner with not just DCHR, but almost all the offices that are looking for work and hiring. DDS was there, as you know, they have staff that they're looking for. Many different branches of government were there. And that gave the opportunity for Washingtonians to come in, hear directly from these agency leaders and representatives about the kind of opening they have, the work they have, and in some cases to even interview. So we're really excited about expanding that and increasing our partnerships. We've already heard from DDS and ODR that they definitely want to be a part of it for next, this coming ending in October. And so we see that that was our first one and it went really well. So we want to make sure we expand that. And another aspect of our work is the senior citizens engagement. So MODA aims to provide space for DC's signing senior citizen population by providing opportunities for them to learn more about district resources, engagement opportunities, to connect with positive experiences that center ASL as the primary form of communication. Here's why that matters. Because right now, when we think of senior citizen services, it's very common that hearing loss is a part of the senior citizen experience. Very normal. So there's a large number of Washingtonians who are senior citizens with hearing loss. However, the vast majority of them grew up hearing or acquired language through oral, through speaking, and do not sign. What this does, though, is it leaves senior citizens who were maybe born deaf or who are incarcerated in the deaf community and sign, feeling isolated amongst other senior citizens with hearing loss. So we try to fill in that gap with our partnership with DACA. We have been very, very, very pleased with how much DACA has been willing to be a partner with us. And we're very excited that we were able to have the very first deaf Miss Senior DC contestant this past year. And that's really because of our commitment to partnerships and reflecting Mayor Bowser's value that all of DC should be accessible. That was something she said during my interview. I said, what are your goals? What do you want from this office? And she said, I want deaf, blind, and hard of hearing Washingtonians to feel like an embedded part of the community. And that's what we've been doing. And I'm very, very grateful for the success we've had thus far.
I love that. I think commend you all on the ways you have shown up in community. You know, community engagement and community activism and advocacy is how this agency came to exist. Community knew their needs and rights were not being met and sort of demanded the district government do better. And so I'm glad that you are staying rooted in community in that way. I want to talk about some of your partnerships with other agencies and what that looks like. I'll start just with the agencies in your cluster. Could you describe your agency's collaboration with DDS and how you collaborate, and then your agency's collaboration with the Office of Disabilities Rights? In that regard, I'm particularly interested in the partnership your agencies formed to transition ASL interpretation services from ODR to MODA.
Yes, ma'am. Give me 1 second to look at my notes here. Here we go. So as it relates specifically to DDS, they have been phenomenal partners and continue to be so. For example, we collaborated by participating and providing resources and opening new cases, as well as answering questions for deaf, blind, and hard of hearing and late deaf and residents during MODA being Mayor's Office of Deaf, Blind, and Hard of Hearing Employment Summit for Disability Employment Awareness Month. So not only did they support us by having a table there, but they had case managers on site to be able to open cases for people who were looking for work. And that we were very intentional about that with our employment summit. We didn't want it to just be a place where people come in and they're like, okay, I'm looking for a job, let's go to interview. We wanted to start from beginning to end. So that meant, for example, we had folks from the University of DC Workforce Development Committee come in and share about their free workforce development training programs. Then we had DDS team come in and they talked about their free vocational transition and training services, right? So we wanted it, no matter where you were in your employment journey, we wanted you to be able to feel like, here are all the resources. I say it all the time, you know, I'm a Brooklyn girl from New York, and moving to DC, I am so in awe of the vast amount of resources the district has. I mean, I have never seen anything like it, but we need to make sure that our constituents know that they are there, not only there, but that they're accessible to them. DDS has been a very strong partner with us. And so we're very grateful to them and their team. We are continuing doing some wonderful work developing an MOU. So I can't say anything definite yet until we have that MOU signed, but look forward to it. I can definitely confirm DDS is serious about making sure that our deafblind and hard of hearing residents fully have full access to their services. Additionally, we were able to present about our office and services at DDS 2023 provider fair. We collaborated with DDS on the Tech First initiative, as well as partnering with DDS in their RSA administration services, and also working with NEON, which is DDS's national expansion of employment opportunity network. So they reached out to us. We didn't know about this, right? They reached out to us and said, we want to make sure that everything we do is accessible to deaf, blind, and hard of hearing communities. Please join this program, and we sure did. So that's just one example of many of the ways DDS has been a great partner for us. Did you want me to talk a little bit more about ODR?
Office of Disability
Sure,
Rights,
of
yeah.
course. So with ODR, from day one, the program analyst, Charlie Carl Brown, was detailed to MODDHH 3 days a week for 1 fiscal year to train us on how to run what was then known as a sign language interpretation program. So as you may remember, we said that program was transitioning to our office, but of course, Mayor Bowser didn't want us to set us up for failure. So she made sure the person who was running that program over in ODR came on board to train and help us. So that's how we were able to be set up for success in the way that we are right now. Additionally, ODR provided resources at our employment fair, as well as being a co-sponsor, and MODDHH and ODR partnered for the international conference on Accessibility Global Group Summit on Technology that took place in the district. So that's just some really short examples of the way that we have partnered with ODR. We also have a natural relationship. So the ODR, the interpreters for the mayor, are housed over at ODR. So we're constantly in communication with them, making sure that all of Mayor Bowser's communication, public outreach is accessible through their interpreters. So it's very much a natural collaboration.
Got it. I appreciate you all working together as the Office of Disability Rights starts to evaluate some of the agencies like Department of Parks and Recreation that we heard from earlier, DC Public Schools, and others. You all have been a great partner for us. And so please be a great partner to them as they evaluate those agencies and try to make experiences better for the deaf, blind, and hard of hearing. The other agency I wanted to ask about is our public safety cluster. As you know, public safety is the #1 issue in the District of Columbia right now. And we've had testimony as well to that nature. How are you working with the Metropolitan Police Department, as well as Fire and EMS, and our Office of Unified Communications to ensure they are providing the services and that is necessary for the deaf, blind, and hard of hearing?
So I briefly mentioned the Securing Accessibility for Emergencies initiative. That short for that is SAFE. So the SAFE project that's housed under MODDHH covers the full range of public safety services. That includes all of our partnerships with MPD, FBMS, and NHCMA as well, NHCMA. So with that, of course, we're very much tapped into MPD's Deaf and Hard of Hearing unit. But in addition to that, we have followed and heard all of our constituents. As I mentioned in my testimony, we're very much community-led in what are the issues that they want us to address. So they said, we definitely want to make sure that MPD is more accessible. Most folks don't even know that there's a Deaf and Hard of Hearing unit. So we've been very intentional about letting constituents and letting the community know that there is a Deaf and Hard of Hearing unit in existence that's available just for them.
I know that either.
Yeah, exactly. So they can contact the Deaf and Hard of Hearing unit at any time. Instead of, you can dial 911 or you can reach out to the Deaf and Hard of Hearing unit to make sure that you can have accessible communication. Obviously, MPD also had virtual relay interpreters so that at any time, they can whether or not they know ASL or have caption access, they'll be able to communicate with Washingtonians with hearing loss. To that end, within our SAFE project, we have focused on emergency management. And for example, you may have heard of the horrible shooting that took place in Maine that impacted the death and led to the death of many deaf constituents, as well as some interpreters even. We took that to heart, but we know that that cannot happen in the district, and it won't happen. The reason why is because shortly after that, we reached out to ASHIMA as well as MPD, and we said, hey, what can we do so that we can make sure that all of your emergency management outreach, more specifically active shooter drills, are accessible? They jumped right on board. They said, okay, yes, let's make it happen. We started off with a focus group. So we invited constituents from the full range of hearing loss and signing abilities and communication abilities to join our focus group, where the staff of MPD provided their training, their active shooter drill training, and the focus group was able to provide feedback and say, okay, this is where it could be more accessible. That's good, keep that up. Or accessibility is more than just ASL, it's cultural inclusion, right? So deafness is a culture, and there's a way of being. So there's a reason why just having interpreters everywhere isn't enough, because it's a cultural component as well. That was very successful. There are going to be some follow-up meetings from that, but MPD is making those changes to make sure that they're fully accessible. I can't say enough. Mayor Bowser did a great job when she selected her team, because her team really does value accessibility.
Great. Thank you. I appreciate that. And that's an agency cluster that I'm going to ask you all just to continue to work with to make sure we are supporting and that people are aware of the services that are available to them. Because this is my first time hearing about the MPD having that unit as well. I want to ask about, you all are working on your annual report for fiscal year 23. It is, I think, drafted, completed, and waiting final design and publishing. When do you all think we will see the finished product?
That finished product will be ready when it is high quality and meets the Mayor Bowser standards. So while we have our draft ready, we're making sure that the executive office of the mayor takes a look at it, make sure that it reflects everything that Mayor Bowser wants us to include, and more, and also up to the code, the requirements of the office code. So that will be done as soon as we get the quality that it deserves.
Got it. Well, we look forward to seeing it. As soon as it's ready, please make sure you send it over. We're excited to see it as well. Director, during last year's performance oversight hearing, you and I discussed the concern of public witnesses who felt the agency was not doing enough to provide resources to the hard of hearing community, even though the hard of hearing community is the agency's largest constituency. Can you describe what progress the agency has made in expanding services and resources specifically for district residents who are hard of hearing in this new year?
Oh, yes, I have been very grateful to community leaders in their partnership with us, right? We never take that for granted. I think as public servants, we're so often like we want to serve the community, but we can't serve the community without the community's investment and involvement. So I want to give a big shout out, especially to the Hearing Loss Association of America DC chapter. Just big kudos to them, because they have been our partners with us every step of the way. Being that our office is not just for deaf and deafblind and signing folks, it's also for hard of hearing individuals. We have numerous constituents who are hard of hearing who come to our office and say, you know, I need these types of services. I'm having trouble accessing this, anything that may come up. And of course, ASL is not going to be beneficial to them if they don't know sign language. HLAA has stepped in the gap every single time in making sure that we are up to par with the quality that the hard of hearing community deserves, such as making sure that we are moving forward with not just closed captioning, but induction loops and other technological assets that improve quality of life for hard of hearing individuals. I myself grew up hard of hearing before I was deaf. So I'm very much, it's personal for me, right? It's not just, before I learned ASL, I was very much reliant on whatever goodness of heart people had in making sure that I received accessibility. So I am very grateful to the hard of hearing community in the district who had, when we reached out and we called, we say, we want to make sure we're doing this right.
Got it.
They step in and make sure and advise us when needed.
The committee received written testimony about the benefits of induction loop systems, also known as hearing loops, to provide greater accessibility in public spaces. Are you aware of any DC government offices or agencies that currently use induction loop systems? Can MODA examine the feasibility of integrating these systems in DC government buildings and let the committee know what the agency finds?
Sure, that's definitely been a priority for us. One example of a government building that has induction loops is the very room we're in right now. So if you look outside of the hearing room, there's a sign with like the ear, the blue sign with the out. That is a notification that this room is set up for induction loops. So that induction loops is a part of part of the hearing aid, like I have here, that allows you to have sound come directly to your ear. The room itself is set up for induction loops. So it's definitely something that is not new to district government. Our policy analyst has also been working with some folks from other states in getting ideas and information on how they have implemented the induction loop system within their own government system. And we look forward to providing our policy memo on that shortly.
Great. I just want to touch on a few things we heard from public witnesses before we close out. I was deeply troubled by the experience shared regarding DPR. I think it's unacceptable that a deaf child is unable to attend youth camp in the district because the requests for ASL interpreters were not fulfilled, and the agency was not responsive. Director, I'd just like you to get your reaction to that testimony. I think the recommendation was for this problem was to centralize coordination of accommodation requests and ensuring that they are processed and provided before they are needed.
Yes, no, I think I echo everyone's sentiment when one situation like that is one too many. And so I'm very grateful to Harish for being in contact with the office, and every single time we've heard of anything, we've been able to step in. One thing to keep in mind is that our effective communication program includes ASL or tactile ASL, CDI, which is a deaf interpreter, as well as captioning. So no constituent can come to our office and say, hey, can you provide me an interpreter? That's not how it works. The district agency reaches out and says, I have a constituent who is looking for a post-tactile interpreter, and then that's how we process it, because the constituent is not going to pay for it, right? We want to make sure that all government services fall under Title I and Title II, more specifically, making sure we have free access to not just compliance, but accessibility. And so what we have done, my community engagement team has worked on a phenomenal cultural competency training. Many thanks to your council itself, which took our cultural competency training as well. Something that from our cultural competency training is where we are able to ensure that district government agencies are not just focused on making sure we have ASL, making sure we have captioning, but understanding the nuances of how to engage the community in a culturally competent way. Again, the deaf community is not just a disability, it is a culture with its own norms and mores and ways of being that make the world more accessible. That's part of what we go through and share more about in our training. We look forward to partnering with ODR and the ADA coordinator system, because that's where the compliance is, right? So what we aim to do is to partner with ODR and reaching out to the ADA coordinator for DPR and say, okay, so we understand you're the person who maybe focuses on making sure the buildings are accessible, or if someone requests an interpreter, you fill out that form, sure. But let's make sure that all across the DPR system, people are made aware. And so ODR, they mentioned earlier, that's something that they want to do, and we will definitely partner with them.
Wonderful, thank you. If you could follow up in that regard, that would be great. I wanted to I wanted to ask about what agencies you are getting the most requests from. Which agency requested motor services most often in fiscal year 23?
Oh, DCPS without fail. And that's actually because DCPS is deeply committed to making sure accessibility is a key for families and parents and children. So they have been our #1 agency by far, by about, how much would you say the percentage would be? Yeah, wow. So about 25%, that's a quarter of our requests
Yeah.
alone, come from DCPS. Again, what we want is for all agencies to be asking for lots and lots of requests, because Washingtonians with hearing loss are everywhere, right?
That's
We
right.
want to make sure that they're all using all of the services. So we're very grateful to DCPS for their commitment to access.
Yeah. In your pre-hearing responses, question 25, 71% of requests MODA received were for services were for ASL only. About how many requests is that total?
I think I remember. What, are you talking about fiscal year 23?
Yes.
Yeah. So we took over the what's now known as the Effective Communication Program. We took that over in February. So we only have data from February 2023 until September 2023 for fiscal year 23, which means that in that time period, we had about 500 requests, just altogether combined ASL card, protactile, certified deaf interpreter. Altogether, we have 500 from February to the end of fiscal year 23 in September.
Got it. Okay. Wow. That's good. For the record and everyone watching, can you describe the process for how district agencies should request ASL interpretation services from MODA?
Sure. So the first thing, there are 2 ways in which that they can get started. They can go online at dc.gov/communityaffairs/MODDHH. And on our resources section, we have what's called the Effective Communication Program Application or Request Form. When they click on that, they can fill out the form themselves and submit the information. Our operations assistant will then give a quick follow-up phone call saying, hey, we received your request. Tell us a little bit more about the event, because sometimes they'll say, we just need 2 interpreters, but it's a major event with over 400 people. We're gonna know from, that's why we're here, right? To fill in that knowledge gap and say, well, you're gonna need a lot more than 2. You're gonna need at least 4 or 5, right? So that's what that follow-up phone call is about. Once they move forward with that process, they just need to make sure that they stay in communication with any follow-ups we have. And then we share the information on which interpreters have been selected or assigned from our vendors. Another way that they can do it is that they can call the ECP, the Effective Communication Program line, and say, hey, I want to fill out this form. It's my first time doing it. Can you walk me through it? We are more than happy to do that. And we have done that multiple times, more times than I can count, where someone call in and say, hey, this is my first time doing this. How do I do this? We love that, because it means that you never really used this service before, and now you see the value and the need for it. So we want to make sure we encourage that and make sure folks feel like you don't have to be the experts. That's why we're here. We're here to support you in that process of making sure that all of district government services are fully accessible.
Right. You will have to make sort of, when we establish this, it requires you to make recommendations to the mayor and the city administrator on how the district can better improve its services to the deaf, deafblind, and hard of hearing community. Have you already made your recommendations to the mayor and the city administrator? And if so, when will you all do your recommendations? Will it be ahead of budget? Because that's the critical piece, is to make sure we have the funding budgeted for the recommendations that you may provide.
Sure. So as far as recommendations, Mayor Bowser doesn't, work slow. She said, we're gonna make sure we start on time. So in October is when we were able to submit our budget recommendation for Mayor Bowser. We are very grateful in that every single time we made a recommendation, she made sure to include it. So that's something that's very much a testament to her commitment to us, making sure that Washingtonians have accessibility.
As this budget season comes up, I'm going to ask you all to work with ODR as we look at agencies who need to be in compliance with the ADA. And as it relates to our deafblind, and hard of hearing community, I just want to make sure you're able to convey to them the funding that is going to be necessary to make sure our district residents are served. All right. I want to thank you and your agency. I first want to thank all of our government and public witnesses today. I also want to thank our fantastic captioners and ASL interpreters. Thank you all for helping us and making this hearing more accessible to district residents with disabilities. This concludes today's performance oversight hearing for the Office of Disability Rights, the Mayor's Office of Deafblind, and Hard of Hearing, and the Department on Disability Services. For the public, if you would like to submit written testimony for the record, please do so by 5 p.m. on Friday, March 1st, by uploading your testimony to the Council's hearing management system or emailing facilities@dccouncil.gov. The time is 4:07 p.m. and this hearing is adjourned.